Skin superficial fascia, external oblique muscle aponeurosis, internal oblique muscle aponeurosis, transverse abdominis aponeurosis, fascia transversalis, extraperitoneal tissue, parietal peritoneum. Umbilicus composed of cicatricial tissue placed at level of L3, L4. Anatomical importance: water shell and subcutaneous lymphatic from upper area of abdominal wall drain into axillary and lower হচ্ছে superficially inguinal include. Retroperitoneal tumor at the level of umbilicus requires an examination of testis or ovary. And the skin around the umbilical supplied by segment of T10 or spinal cord. Umbilicus is one of the important sites in which tributaries of portal vein anastomosis with systemic vein portocaval anastomosis. Below arcuate line organized into superficial deep fascia, superficial fatty layer compass and membranous such as carpa. Umbilicus and pubis and masculine arcuate line is superficial fascia, দুইটা layer divided by superficial fatty layer compass fascia. Continues over inguinal ligament of margin, superficial fascia of thigh continues over pubis and perineum, superficial layer of the superficial perineal fascia. Lacunar ligament cartilage strangulated humeral hernia release করে. In the scrotum represented campus fascia as a layer of thin smooth muscle, dartos muscle. Deep membranous layer carpus fascia attached to fascia lata just below inguinal ligament. খুব লাগতেছে. Continues over the pubis perineum and the membranous layer conus fascia of the superficial perineal fascia of the scrotum. It is as the tunica dartos. In the median plane, membranous layer thickened to form substantial ligament and funniform ligament. The penis or clitoris serves as a firm unit suturing superficial fascia during closure of anterior abdomen. Perineum after abdominal or pelvic surgery may contain extravasated urine between the fascia and deep fascia of the abdomen, resulting of rupture of spongy urethra, funniform penile lengthening. Mid-inguinal point, anterior iliac spine plus symphysis pubis এই বরাবর femoral artery. femoral artery medially থাকবে femoral vein. inguinal ligament, proper ligament. It is the folded lower border of aponeurosis of external oblique muscle. Enters from anterior superior iliac spine to pubic tubercle 1.245 cm above থাকে deep ring, midpoint of inguinal ligament. Forms the floor interior wall of the inguinal canal, slightly convex towards the thigh, length 12 থেকে 14 in the medial তিনটা expansion. Lacunar ligament apex is formed by the pubic tubercle basis tree from the medial boundary of femoral ring. Strangulated femoral hernia, release lacunar ligament. Reflected part, 2 number reflected part of inguinal ligament, perineal ligament of Cooper. CV line, internal the jugular, then subclavian, then femoral vein towards the umbilical. Conjoint tendon formed by fusion of the lower part of both internal oblique and transversus abdominis inserted into pubic crest and iliopectineal eminence forms and strengthen the middle part of posterior wall of inguinal canal. As a conjoint tendon, fox inguinally, it is continuous medially with the anterior wall of rectus. Nerve sulfile ilioinguinal nerve. Surgical importance is weakness predisposed to direct inguinal hernia, injury of ilioinguinal nerve during appendectomy, paralysis of conjoint tendon, direct inguinal hernia paralytic type, and conjoint tendon prevents direct inguinal hernia from descending to scrotum, so is defect descent of direct inguinal hernia to the scrotum, funicular type. Deep inguinal ring, inlet inguinal canal and ring. Oval gap in fascia transversalis 1.25 cm above mid-inguinal point. Inferior epigastric artery lies medially to this ring. Structure transmitted through in male somatic cord without its covering processes vaginally and female round ligament of uterus with its nerves and vessels. So visual inguinal ring, outlet oblique triangular gap in aponeurosis or external oblique from margin tubular prolongation of internal somatic fascia extend over the somatic cord and testis. Downward direction, upward and lateral structure transmitted through in male somatic cord ilioinguinal nerve processes vaginally and female round ligament of uterus with its nerve and vessel ilioinguinal nerve. Inguinal canal muscle. Muscular aponeurotic tunnel 4 cm length extend from deep inguinal থেকে superficial downward forward medially above and parallel with the medial half of the inguinal ligament. Newborn shorter, less oblique. তারপরে হচ্ছে external ring lies almost directly over the internal ring. Female the canal is narrow. সেজন্য inguinal hernia হয় না, কম হয়. Boundary anterior wall external oblique aponeurosis assisted laterally by internal oblique muscle and strengthening the internal oblique. Posterior wall internally fascia transversally, partially medially by half by conjoint tendon. Conjoint tendon equal strength দেবে. Medial 1/4 by reflected part of inguinal ligament. Medial 1/4 part by inguinal ligament. Vast fiber of internal oblique and transversus abdominis. Floor grooved our upper surface of inguinal ligament. Medially lacunar ligament contains spermatic cord in male and round ligament of uterus in female. Vast difference. Feminiform venous plexus, genital artery, genital branch of genitofemoral nerve, ilioinguinal nerve, partial contact. Inter through superficial ring only, and deep ring strength দিবে internal oblique and superficial ring strength দিবে conjoint tendon. আচ্ছা, mechanism, flap valve mechanism, guarding of the inguinal ring, strata mechanism, slit valve and ball valve. আচ্ছা, mid inguinal point ASIS থেকে pubic symphysis হচ্ছে femoral artery, medially femoral vein, CV line. Mid point of inguinal ligament হচ্ছে ASIS থেকে pubic tubercle 1.25 cm উপরে deep ring. Rectus sheath above anterior wall above the costal margin wall is thin, formed by external oblique aponeurosis from costal margin to midway between umbilicus and symphysis pubis. Wall is thicker, formed by anterior lamina of internal oblique aponeurosis blending with external oblique aponeurosis from midway between umbilicus and symphysis pubis. Thick effusion of aponeurosis of all three flat muscle posterior wall from costal margin to midway between umbilicus and symphysis pubis, formed by posterior lamina of internal oblique aponeurosis blending with transversus abdominis. Abdominis at its lower extent, the wall presence of free margin known as arcuate line, which is connected downwards with inferior epigastric artery enters the sheath in front of arcuate line. Below the arcuate line, the wall is division covered by thin layer of fascia transversalis support, and above the posterior margin, rectus muscle lies on 5-6 costal cartilage support. Content হচ্ছে rectus abdominis, pyramidalis, subcostal nerve, আর হচ্ছে ভেসেলস হচ্ছে ইনফিরিয়র এপিগাস্ট্রিক আর্টারি, সুপিরিয়র এপিগাস্ট্রিক আর্টারি, সাবকোস্টাল নার্ভ ব্র্যাকেটে আছে, নার্ভ হচ্ছে লোয়ার 5 ইন্টারকোস্টাল নার্ভ এন্ড সাবকোস্টাল নার্ভ, তো পিরামিডালিসের সাথে সাবকোস্টাল নার্ভ। ফ্যাক্টর প্রিভেন্টিং গ্যাস্ট্রোএসোফেজিয়াল রিফ্লেক্স, flutter valve, oblique direction, flap valve, right free margin of oblique muscle freno, esophageal membrane, mucosal rosette, Prinzcock action of esophageal opening of diaphragm. আচ্ছা, factor preventing gastroesophageal reflux, last anatomic contraction of rectus fibers of diaphragm that passes to the left of the diaphragm opening from a sling around the abdominal esophagus, angle of entry of the esophagus, longitudinal fold of the esophagus because high pressure zone of the lower 3 cm of esophagus, the effect of positive intra-abdominal pressure of the abdominal segment of esophagus. আচ্ছা, স্টোমাক রিজিয়ন, কার্ডিয়া, ওপেনিং অফ ইসোফেগাস, ফান্ডাস বডি, পাইলোরাস 10 cm, পাইলোরা ক্যান্ট্রাম 7.5 cm, পাইলোরা ক্যানাল 2.5 distal end, pylori sphincter, greater curvature convex, forms left border, forms attachment of greater omentum, gastrosplenic ligament, lesser curvature concave, form right border, forms attachment of lesser omentum, cardiac nose, incisura cardiaca, superior angle between fundus esophagus, angular incisura angularis bend with the lesser curvature. Okay, stomach weight, left class of diaphragm, left suprarenal, anterior gland, anterior surface of left kidney, torsosplenic artery, transverse vesicle, anterior surface of pancreas, left colic pressure, spleen symptoms. So stomach weight is separated from stomach by lesser sac. আচ্ছা, posterior inferior surface relation, আচ্ছা, lesser sac বা omental bursa. Histology, mucous membrane lining, lamina propria, all gland and blood vessels present, muscularis mucosa, inner circular, middle longitudinal and outer circular, submucosa muscular layer, inner oblique, এটা extra, middle circular, outer longitudinal and serosa. At a glance, total layer of stomach 10টা, বাট লেয়ার যেটি 9, মাস্কুলার ইনার অবলিক অ্যাসিডিক কাইম তৈরি করে। আর হচ্ছে লেসার ওমেন্টাম হচ্ছে থাকে লিভারের সাথে যুক্ত, ট্রান্সভার্স কোলনের সাথে গ্রেটার ওমেন্টাম, অ্যান্ড ইন জিআইটি অল গ্ল্যান্ড এক্সেপ্ট present in lamina propria but in duodenal glands of Brunner present in submucosa. Structure of stomach. আচ্ছা, সাবমিউকোসা, গল ব্লাডার, সিবিডি, আচ্ছা, সাবমিউকোসা অ্যাবসেন্ট, সেকেন্ড টিউবে, গল ব্লাডার, সিবিডি, ইউরিনারি ব্লাডার, ইউরেটার, ইউটেরাস অ্যান্ড ইউটেরাইন টিউব। আচ্ছা, গ্ল্যান্ড অফ দ্য স্টমাক, সিম্পল টিউবুলার ব্রাঞ্চ, সিক্রেট মিউকাস, কার্ডিয়াক গ্ল্যান্ড, ফান্ডিক অ্যান্ড বডি গ্ল্যান্ড হচ্ছে গ্ল্যান্ড টিউব লাইন বাই 3 টাইপ অফ সেল, zymogenetic chief cell, cuboidal, basophilic, secret pepsinogen, parietal, oxyntic cell, large polyhedral cell, acidophilic, secret ACL, IFC, mucous neck cell, secret mucous, pyloric gland, predominantly mucous secreting cell, G cell, present which secretes hormone gastrin, iron deficiency anemia, vitamin B12, vaculoplastic anemia. আচ্ছা, left gastric, left gastric branch of celiac trunk, right gastric branch of common hepatic, right gastric epiploic, gastroduodenal, left gastric epiploic branch of splenic, short gastric branch of splenic. আচ্ছা, gastroduodenal artery, posterior hemorrhage and anterior হচ্ছে perforation. blood artery to expose celiac tract lesser, to expose the celiac tract lesser momentum. Nerve supply T6 T9 are parasympathetic vagi, mostly by left vagus, anterior vagal drum. Development fusiform dilatation of foregut, vertical 90 degree clockwise, 90 degree clockwise right surface থেকে posterior inferior surface, left surface থেকে anterior superior surface, anterior posterior 90 degree clockwise, cardiac end থেকে deviate to the left and pyloric end থেকে deviate to the right. আচ্ছা duodenum, আচ্ছা mesentery small intestine, broad fan shaped fold of peritoneum, suspend jejunal ileum from posterior abdominal wall by root of mesentery, contain jejunal ileal branch of superior mesenteric vessel, autonomic nerve plexus, lymphatic lymph node, connective tissue, fat. Duodenum C-shaped rounding the head of pancreas, retroperitoneal except for its beginning location, epigastric umbilical, connecting to liver by hepatoduodenal ligament. Flexure, superior duodenal flexure, inferior duodenal flexure, duodenojejunal flexure, surrounded by a fold of peritoneum containing muscle fiber, ligament of Treats. Pylorus is identified by prepyloric vein of Mayo. Traits হচ্ছে fibromuscular band, suspend support DJ flexure, arises from right crus of diaphragm close to right side of esophagus, passes downward behind the pancreas, attached to posterior surface of DJ flexure, third and fourth part of the duodenum. Normally its contraction increases the angle of DJ. Submucous coat, loose areolar tissue containing blood vessels, lymphatic, duodenal gland of Brunner, secretive fluid in bicarbonate enzyme, activation of trypsinogen, mucous membrane, surface epithelium lined by sepal columnar epithelium, application of goblet cell, numerous villi, lamina propria, contain creams of liver bone, which are straight tubular gland and receive the bottoms opening of Brunner's gland. Duodenal cap, triangular opaque shadow, political cyst, relationship. Obstruction of third part of duodenum may be caused by pressure by superior mesenteric artery, contraction of ligament of Treats, in barium meal, widening of C, curvature of duodenum, cancer head of pancreas, inverted figure 3, periampulary carcinoma, trifoliate deformity, duodenal ulcer. Jejunum ileum, location upper left quadrant, walls thicker and more vascular, lumen wider, more often empty, villi larger, thicker and more abundant, jejunumira. Mucosal fold, plica circularis, large and more closely set. আর হচ্ছে মেসেন্টারি উইন্ডো প্রেজেন্ট, ফ্যাটলেস অ্যাবান্ডেড, আর্টেরিয়াল আর্কেড 1 or 2, ভাসা রেক্টাল লঙ্গার এন্ড ফিওর অ্যান্ড লিম্ফয়েড নোডিউলস। আর হচ্ছে সার্কুলার মিউকোজাল ফোল্ড। লিম্ফয়েড নোডুল, পেয়ার প্যাচেস অ্যাবসেন্ট। আর হচ্ছে লিম্ফেটিক ফলিকলস, ফিভার্স। আইলিয়ামের ক্ষেত্রে লোকেশন হচ্ছে লোয়ার রাইট কোয়াড্রেন্ট। আর থিনার লেস ভাস্কুলার, লুমেন ন্যারোয়ার, অফটেন লোডেড। আর হচ্ছে ভিলাই হচ্ছে শর্টে, থিনার লেস অ্যাবান্ডেড। মিউকোজাল ফোল্ড হচ্ছে স্মলার অ্যান্ড স্পার্স। মেসেন্টারি নো উইন্ডো, ফ্যাট মোর অ্যাবান্ডেড, আর্টেরিয়াল আর্কেড 3 থেকে 6, ভাসা রেক্টাল শর্টার, মোর নিউমেরাস, লিম্ফয়েড নোডুল প্রেজেন্ট, লিম্ফেটিক ফলিকল মোর নিউমেরাস। Makers diverticulum, 2% of the population, 2 inches long, 2 feet proximal to ileocecal valve, attached to antemesenteric border of the ileum. 2 types of ectopic cell present, arytal and pancreatic, 2x more in male. 50% symptomatic under 2 years of age. Its caliber is equal to that of ileum. True diverticulum complication, peptic ulcer disease, perforation, hemorrhage, interstitial obstruction, interstitial and diverticulitis. Large intestine, tinea coli, appendices, epiploica, circulation hosta, and vestibular fold. Tinea absent in vermiform appendix and rectum. Appendices epiploica absent in cecum, vermiform appendix and rectum. Mucous membrane glass cut. 500 ml fluid per day. Digestion of cellulose with the help of bacterial putrefaction. cecum হচ্ছে 6, large intestine 1.5 meter and anus হচ্ছে 3.8 centimeter. rectum 12 centimeter, colon হচ্ছে 150 centimeter, cecum হচ্ছে 7.5 centimeter. Right hypochondrium and epigastric region and right upper quadrant, largest gland of the body, exocrine endocrine দুইটাই থাকে, regulating body serves important function of regulating body temperature, আর হচ্ছে in child hemopoietic function. Anatomical liver divided into right and left lobar by the attachment of falciform ligament anteriorly and posteriorly by the fissure of the ligamentum teres, inferiorly by the fissure of the ligamentum venosum. Posteriorly, right lobe is much larger than the left lobe and forms 5/6 of the liver, contributes all the 5 surface of the liver presents caudate and quadrate lobe. Caudate situated on the posterior surface boundary on the right by groove of the inferior vena cava, on the left by fissure for ligamentum venosum, inferiorly by porta hepatis. Above it, it is continuous with the superior surface. Below and to the right, just behind the porta hepatis, it is connected to the right lobe of the liver by the caudate process. Below and to the left, it presents at a small rounded elevation called papillary process. Quadrate lobe, it is situated on the inferior surface boundary anteriorly by the inferior border, posteriorly by the porta hepatis, on the right by fossa for gallbladder, and on the left by the fissure for ligamentum teres. Porta hepatis, deep transverse fissure about 5 cm long, situated on inferior surface of right lobe, lies between caudate lobe and the caudate lobe. Below and in front, portal vein, hepatic artery, hepatic plexus of nerves enter the liver through porta hepatis, which is right and left hepatic duct, and a few lymphatics leave it. The relation within the porta hepatis are formed behind forwards at the portal vein, hepatic artery, and hepatic duct. Lip of the porta hepatis provides attachment to lesser omentum. The left lobe of the liver is much smaller than the right lobe, forms only 1/6 of the liver, flattened from above downwards near the fissure or the ligamentum venosum. It is its inferior surface presents a rounded elevation called the omental tuberosity or tuber omentally. Physiological divides: right and lobe by gallbladder, inferior vena cava, includes caudate and quadrate in upper and quadrate on the lower part of the liver. আচ্ছা, caudate উপর পাটে and quadrate lower পাটে। আচ্ছা, factor keeping liver in position: hepatic vein, then inferior vena cava, intra-abdominal muscles, ligament of liver হচ্ছে peritoneal fold or false ligament, falciform ligament, sickle shaped peritoneal fold consisting of 2 layers connect the liver to the undersurface of the diaphragm, anterior abdominal wall up to umbilicus. Content: ligamentum teres, para-umbilical vein, tributary of portal vein, numerous small vein known as accessory portal system of Sappi, which communicate para-umbilical vein with diaphragmatic vein, coronary ligament, right and left triangular ligament, lesser omentum. True ligament: ligamentum teres hepatis, remnants of obliterated left umbilical vein, ligamentum venosum, remnant of obliterated ductus venosus. Bare area of liver: bare area, an area between the liver and diaphragm which is devoid of the peritoneum. The bare area closely related to the diaphragm, inferior vena cava, right suprarenal gland, along the attachment of falciform ligament, coronary ligament, right and left triangular ligament. Group for IVC: porta hepatis, porta hepatis, fossa for gallbladder, fissure for ligamentum teres hepatis. Relation and impression: superior surface cardiac impression, right lateral surface upper third lungs up to 8th rib, middle third pleura extend up to 10th rib, middle lower third diaphragm comes in direct contact with the 10th and 11th, so needle velocity should be right or should be right 9th or 10th intercostal space during forced expiration, very important. আচ্ছা, posterior surface bare area, portal system anastomosis, part of right suprarenal gland, groove for IVC, floor is pierced by hepatic vein devoid of valves. আচ্ছা, caudate lobe, fissure for ligamentum venosum, groove for esophagus. Inferior surface, most of the surface covered by peritoneum except fissure for ligamentum porta hepatis, fossa for gallbladder. Gastric impression: tuber omentally, fissure for ligamentum teres, quadrate lobe, porta hepatis, caudate and papillary process, fossa of gallbladder, non-peritoneal, extend from cystic nose to right end of porta hepatis, duodenal impression, colic impression, renal impression. Microscopic organization of liver composed of parenchyma cell, hepatocyte, connective tissues from a sinusoid, bile, canaliculi, portal triad and tributaries of hepatic vein. Hepatocyte are arranged in arranged in plates or cords that are one cell thick and separated by vena sinusoid. Microscopic organization of the liver cell grouped into 3 cell cluster: hepatic globule, portal lobule, porta S and ashepatic globule. Hepatic globule structure: unit of liver, hexagonal areas, the central vein at its center, portal triad at the corner, is portal triad contain a branch of portal vein, hepatic artery and bile ductule. All this ensheathed by glycine capsule. Each hepatic lamina is made of about 20 hepatic cells from the periphery to the central vein. Portal lobule, nutritional lobule, functional areas of liver. These polygonal areas of the liver centered on a portal triad drawn by joining the central vein of the 3 adjacent hepatic lobule. The bile from this area drains into bile ductule into the portal canal. আচ্ছা, portal acinus metabolic unit of liver, diamond shaped area formed by connecting adjacent to central vein. This can be divided by into 3 zones based on the proximity of the hepatocyte to the incoming blood. Useful in concentration of blood flow, pattern of oxygenation, pathological degeneration. Zone 1, inner zone around the vascular backbone and is well oxygenated, gluconeogenesis, bile salt formation, nutrients, and can most readily carry out function requiring oxidative metabolism such as protein synthesis. Zone 2, আচ্ছা, জোন 1 হচ্ছে অ্যানাবলিক, জোন 2 ক্যাটাবলিক, জোন 3 হচ্ছে ক্যাটাবলিক, বায়াল স্টেসিস বেশি। জোন 2 হচ্ছে ইন্টারমিডিয়েট জোন অ্যান্ড মডারেটলি অক্সিজেনেটেড, মোনো অক্সিজেনেশন, গ্লাইকোলাইসিস and glucuronidation. Zone 3, outer zone close to central vein and get the least oxygen and nutrient. They are the preferential site of glycolysis, lipid formation, drug biotransformation, fast hepatocyte to undergo fatty accumulation, ischemic necrosis. Catabolic, আচ্ছা, bile stasis বেশি। Space of DC between walls of sinusoid hepatic lamina or cell, there exists potential space known as space of DC prior to sinusoidal space. These spaces filled with blood plasma and chylomicron which percolate throughout the fenestrative wall of sinusoid and contain in addition etocell or stellate cell. আচ্ছা, space of small periportal, potential space, interlobular space between the Gleason capsule and portal canal and hepatic plate of cell. Lymphatic of liver begins at the space of small and as blind radicals. আচ্ছা, হেপাটোসাইট ফাংশন, মেটাবলিজম, প্রোটিন, ফ্যাট, সিনথেটিক, সেক্রেটরি স্টোরেজ, এক্সক্রেটরি, ডিটক্সিফিকেশন, হেমাটোপোয়েটিক, ইটোসেল, হেপাটোস্টেলেট, পেরিসাইনোসাইডাল লাইপোসাইট, রিজেনারেশন by fibrous growth, fibrosis by FGF, secrete the collagenous matrix including proteoglycan, storage, fat soluble vitamin B12, folate. Kaffer cell phagocytosis, large granular lymphocyte, Bapit cell, they are natural killer cell, protect against the virus, etc. Hepatic segment based on the distribution of the portal and hepatic vein, 18 number, AC supply, principal branch of hepatic artery, portal vein, bile duct tool, caudate lobe, posterior segment, defined as segment 1, divining segment, numbered in a clockwise manner up to segment 8, segment 1, 2, 3, 4 confined in left lobe, whereas 5, 6, 7 involve the right lobe. Segment 1 corresponds to the caudate lobe and segment 4 quadrate lobe. Segment 1 lies behind to the right and of the inferior vena cava. Segment 7, 8, 4 আর 2 arranged clockwise above the portal vein. Segment 6, 5, 4, 3 situated below the portal vein. আজ 5 আর 4 কার্সিনোমা রিসেকশন উইথ মানে গলব্লাডার কার্সিনোমার সাথে হচ্ছে 5 আর 4 হচ্ছে রিসেকশন করব। আচ্ছা, লিস্ট আচ্ছা, ক্লিনিক্যাল ইম্পর্টেন্স হচ্ছে সার্জিক্যাল ক্ষেত্রে বেশি ভেসেলস কাটা লাগে না, ইউনিক ক্যাপাসিটি অফ রিজেনারেশন, লিভার উইল রিগ্রো টু ইটস অরিজিনাল সাইজ উইদিন এ কাপল অফ মান্থস আফটার রিসেকশন। সেগমেন্ট 1 ডুয়াল সাপ্লাই, সেগমেন্ট 1 বাউন্ড, আচ্ছা, ডুয়াল সাপ্লাই পাই, আর হচ্ছে ডুয়াল সাপ্লাই বাইল বোথ হেপাটিক আর্টারি আর হচ্ছে সাপ্লাই ভেনাস, আর ভেনাস ব্লাড ডিরেক্টলি ড্রেনস ইনটু আইভিসি 1 থেকে। সেগমেন্ট 1 কেন দুইটা সাপ্লাই পাই, দুইটা ডাক্টেই হচ্ছে মেনলি ড্রেনেজ দেয়, বাইল আর হচ্ছে ভেনাস ব্লাড ডাইরেক্টলি ড্রেনস ইনটু আইভিসি। Blood supply of the liver receives 20% blood supply through hepatic artery, 80% through portal vein. Mode of supply of blood supply, আচ্ছা, portal vein 40% oxygen, 60% oxygen, hepatic artery. Hepatic artery and portal vein, right and left branches, segmental vessels, interlobar vessels opening into hepatic sinusoid, drain into intralobular vessel, joint to form sublobular vessels. This one আচ্ছা, এটা লাগবে না। lymphatic, আচ্ছা, this in turn united from hepatic vein directly drain into inferior vena cava. Lymphatic drainage, hepatic node, then pyloric node, then celiac node, then cisterna chyli. Superficial lymph node drains through the diaphragm to anterior mediastinum node and its under surface to nodes in the porta hepatis. Deep plexus drains into posterior mediastinal and porta hepatis node. Development of the liver parenchyma, bile capillaries, endodermal origin from hepatic bud, sinusoid, mesodermal origin formed by breaking down of umbilical, vital and vein. Capsulostoma, hemopoietic cell, cover cell, mesodermal origin from septum transversum. আচ্ছা, ফান্ডাস হচ্ছে মানে মার্ফিস সাইন, ফান্ডাস অ্যান্ড সাম পোর্শন অফ দ্য বডি কভার্ড বাই পেরিটোনিয়াম গলব্লাডারের ক্ষেত্রে। Biliary apparatus, hepatocyte, bile canaliculi, canal of herring, bile ductal, right and left hepatic duct, common hepatic duct, cystic duct, gallbladder, common bile duct, unites with main pancreatic duct, ampulla of Vater, opens into second part of duodenum in the major duodenal papilla. Gallbladder, located at the right costal margin and of the rectus abdomen, which is site for maximum tenderness and acute inflammation of the gallbladder. Fundus, body neck থাকে, fundus হচ্ছে tip of the right costal cartilage covered by peritoneum, in the mid clavicular line, contacts with transverse colon covered by peritoneum. আচ্ছা বডি হচ্ছে রেস্ট অন দ্য মেজর upper parts of the duodenum, transverse colon, neck, narrowest and goes to the cystic duct with spiral valve. Hiatal valve may have an abnormal conical pouch, Hartmann pouch. Pouch is called ampulla of gallbladder. Submucous coat is absent. Callus triangle under surface, above and laterally under surface of liver, below and laterally cystic duct, medially common hepatic duct, contains cystic artery and lymph node of blood. Sites where pain gallbladder can be referred through the vagus to stomach, epigastrium through the sympathetic nerve to inferior angle of right scapula, through phrenic nerve to right shoulder. Gallstone fistula হইতে পারে ইরোড করে করে ফান্ডাসে ট্রান্সভার্স কোলনে, তখন হচ্ছে একটা অ্যান্ডিওডেনামে হতে পারে, ইন্টারস্টিশিয়াল বডি ইন্টেস্টাইনাল অবস্ট্রাকশন হতে পারে ডিউ টু ডিজে জাংশনে, ওইখানে হচ্ছে গলব্লাডার আটকাইতে পারে। দেন মিউকোসিলি হতে পারে, হার্টম্যান পাউচে স্টোন ইম্প্যাক্ট হতে পারে, নেকের হার্টম্যান পাউচ। আর দেন পায়োসিল হতে পারে ইম্প্যাক্ট অফ সিভিডিতে, জন্ডিস, ভিটামিন ডেফিসিয়েন্সি, এডিইকে অ্যান্ড স্টেটোরিয়া। ভেটার অফ অ্যাম্পুলা, স্ফিংক্টার অফ বডি, প্যানক্রিয়াটিক ডাক্ট, দেন হচ্ছে বিলিয়ার, ওখান থেকে হচ্ছে অবস্ট্রাকশন হলে দেন বিলিয়ারি প্যানক্রিয়াটাইটিস হতে পারে অ্যাকিউট, কারণ তখন হচ্ছে তখন এনজাইমগুলো পুরো আবার প্যানক্রিয়াসেই যাবে, প্যানক্রিয়াসে ডাইজেস্ট করা শুরু করবে। Scalous triangle, lymph node of blunt sentinel. আচ্ছা, pancreas head within C-shift of duodenum lies over inferior vena cava, right and left renal vessel, also related common bile duct posteriorly. SBতে আসলে 1 CVD, then IVC, then terminal portion of both renal vein. Uncinate process, projection of lower part of the head posterior to the superior mesenteric vessel and anterior to the outer neck. Lies in front of the commencement of portal vein, transverse mesocolon attached towards the lower border of the neck body. আচ্ছা, আমরা এখন পেনক্রিয়াসে আসি। আচ্ছা, superior body crosses the aorta at the origin of the celiac trunk. Splenic artery passes to the left along upper border of the body of and tail. Pancreatic neck lies in front of the commencement of the portal vessels. Transverse mesocolon is attached towards the lower border of the neck body. Superior border crosses the aorta at the origin of the celiac trunk. The splenic artery passes to the left along the upper border of the body and tail. Inferior border along the side of the neck crosses the superior mesenteric vessels. Anterior border of the body gives attachment to root of transverse mesocolon where the layers diverge. Tail ends as it passes in between layers of the linorenal ligament and reaches the spleen. এটা কাটলে iatrogenic diabetes হবে। Structures of pancreatic ducta consist of numerous lobules separated by interlobular septal lobule. Contents of numerous alveoli. Alveoli connect with the main duct through intercalary, interlobular, interlobular ducts, alveolar cell, single layer of tall columnar cell, junction between ducts and alveolar cubical cells, centriocenar cell. Endocarp, numerous islets or langerhans outside the alveoli, more in tail, alpha 20% granule, then surrounded secret glucagon, beta 60% granule, rectangular, আচ্ছা alpha, beta, delta, pp. আচ্ছা, পিপি হচ্ছে সিক্রেট পিপিএস উইচ স্টিমুলেট গ্যাস্ট্রিক অ্যান্ড ইন্টেস্টাইনাল এনজাইম সিক্রেশন অ্যান্ড ইনহিবিট ইন্টেস্টাইনাল মোটিলিন। ডেল্টা হচ্ছে সোমাটোস্ট্যাটিন, বেটা হচ্ছে ইনসুলিন, আলফা হচ্ছে গ্লুকাগন, অ্যান্ড এন্ডোক্রিন সিক্রেট সেরোটোনিন। Islets of Langerhans, endocrine portion of pancreas, all embedded in the exocrine pancreatic tissue. More in tail, copious blood supply covered by very thin sheet, polygonal rounded cluster of cell arranged in cords separated by a network of sinusoid like blood capillaries. Pancreatic duct, major, minor. আচ্ছা, arterial supply and arteria pancreatum magna branch of splenic artery, superior pancreaticoduodenal artery branch of gastroduodenal artery, inferior pancreaticoduodenal artery branch of superior mesenteric artery, main duct of Warsaw, accessory duct of Santorini. আচ্ছা, development arises from ventral dorsal ventricular bud from endoderm of caudal foregut formed by migration of ventral bud to fuse with dorsal bud. Ventral pancreatic duct bud unseen process lower part of the head of the neck. Dorsal হচ্ছে remaining part of the neck, body, tail and of the pancreas. Applied anatomy. Head of pancreas, occasional site of carcinoma, malignant growth, obstructive jaundice cause করে compressed portal vein producing ascites, accumulation of the fluid abdomen, pylorus producing pylotic obstruction, ectopic pancreatic tissue may be found in liver, mecal, reticulum, mucosa of small gut, stomach bed. Spleen hemolymph organ আর হচ্ছে belongs to reticular endothelium system, ligament, renal ligament, contains splenic vessel, nerve, lymphatic, tail, pancreas, gastrosplenic anterior layer from greater second, posterior layer from lesser second, contain short gastric left gastroepithelial vessel, phrenicocholic ligament extend from left colic fleshes to diaphragm, phrenicocholic ligament, phrenicos আচ্ছা দুইটা ফ্রেনিকোস্কলিক ফ্রেনিকোস্প্লেনিক লিগামেন্ট সারফেস ডায়াফ্রাম কস্টাল সারফেস 9-11 আর হচ্ছে ফিসারাল হচ্ছে ফান্ডাস অফ দ্য স্টমাক অ্যান্টিরিয়র সারফেস অফ দ্য লেফট কিডনি লেফট কলিক ফ্লেশের টেল অফ প্যানক্রিয়াস স্ট্রাকচার অফ স্প্লেনিক প্যানকামা হোয়াইট পাল্প সেন্ট্রাল আর্টেরিয়াল ইনভেস্টেড বাই লিম্ফেটিক শীথ টি সেল ইন দ্য সেন্ট্রাল আর্টেরিয়াল লিম্ফেটিক শীথ এটা জিবিতে আসছিল যে টি সেল আচ্ছা মাঝখানে থাকবে then B cell in the middle and dendritic antigen present cell periphery. Red pulp 75% of splenic parenchyma contain large number of sinusoid. Venous sinusoid incomplete endothelium filled with stem cell out of the size of slits to maintain the passage of blood. Splenic coda sponge like consists of macrophage. It removes senescent and effective RBC microorganism cellular debris. আচ্ছা আচ্ছা সেন্ট্রাল আর্টারি বা হোয়াইট পাল্প আর্টারি splenic artery divides into 5 more branches, trabecular branches, parenchyma enveloped by periarterial sheath, যেটা central artery, white pulp artery, venous sinusoid, bulk and trabecular vein. আচ্ছা applied anatomy splenomegaly projects towards the right iliac fossa in the direction of the axis of tentric during splenectomy operation. Damage to belly of the cranium tail of the pancreas have to be avoided. Phrenicocolic ligament prevent downward displacement. Long axis and then long axis, then spleen supported by splenic flexure phrenicocolic ligament. আচ্ছা সো প্রিভেন্ট ডিসপ্লেসমেন্টের দুইটা কারণ ফ্রেনিকোগলিক লিগামেন্ট আর হচ্ছে এটা লং অ্যাক্সিস টেন্ট্রিপ বরাবর সুপ্রাটেনাল গ্ল্যান্ড আউটার কর্টেক্স মেসোডার্মাল অরিজিন সিক্রেট নাম্বার অফ স্টেরয়েড মিনার মেডুলা নিউরোক্লাস ডেরিভেটিভ মেড আপ অফ ক্রোমাফিন সেল সিক্রেট অ্যাড্রেনালিন নরএড্রেনালিন আচ্ছা ফার্স্টে যদি ফিওক্রোমোসাইটোমার ক্ষেত্রে ভেভিন লাইকেট করলে বিপি সাডেন ফল করে এর জন্য এনেস্থেটিওলজিস্টকে বলতে হবে যে এখন আমি বিপি পারাপারিটিভ বিপি মনিটর করতে হবে যে হচ্ছে এখন আমি অ্যানেস্থেসিওলজিস্টকে বলবো যে এখন আমি লাইকেট করতেছি রাইট সুপ্রানাল গ্ল্যান্ড pyramidal shape surmounts the upper pole of right kidney lies on the diaphragm and process in front of the right kidney relation apex related to the beryllium liver relation to important apex related to beryllium liver base upper pole of kidney anteriorly IVC beryllium of liver posteriorly right cusp diaphragm anterior border suprarenal vein emerge medial border right celiac ganglion left suprarenal crescenting in shape drapes over the middle border of the left kidney lies on the left cusp diaphragm আচ্ছা overlaps in front of the left kidney relation upper and posterior end of the spleen lower end suprarenal vein emerge anterior surface stomach splenic artery pancreas SSP posteriorly left cusp of diaphragm lateral border stomach middle border left celiac ganglion histology zona glomerulosa fasciculata reticularis আর তিন ইনার মেডুলা অটোনমিক গ্যাংলিয়ন সেল ক্রোমাফিন সেল আর হচ্ছে presence of cortex cell conversion noradrenaline into adrenaline by methylation of primary
amines. The supply having arterial portal system, superior suprarenal branch of inferior phrenic artery, middle suprarenal branch of abdominal aorta, inferior suprarenal branch of renal artery. Venules start from venous sinusoid from a single suprarenal gland, right drain drains into IVC, left drain drains into left renal vein. Blood supply. আচ্ছা, abdominal aorta ends opposite L4 vertebra just to the left of the median plane. Left length হচ্ছে 10 থেকে 14 সেন্টিমিটার, breadth হচ্ছে 2 সেন্টিমিটার। On the right side এটার inferior vena cava থাকে, cisterna cardia, thoracic duct, razor vein, right cusp of diaphragm, right celiac ganglion, left side left cusp of diaphragm, left celiac ganglion, DJ flexor opposite L2 vertebra, left sympathetic trunk, inferior mesenteric artery, ascending descending branches. আচ্ছা, then হচ্ছে এটার branches: ventral celiac trunk, superior mesenteric artery, inferior mesenteric artery, lateral paired inferior phrenic artery, middle suprarenal artery, renal artery, gonadal artery, dorsal fourth pair of lumbar artery, median sacral artery, terminal right and left common iliac artery. আচ্ছা, right common iliac artery anterior to IVC, right common iliac vein. আচ্ছা, paired branch 9টা, unpaired. আচ্ছা, umbilicus L3 L4 left to umbilical, abdominal aorta, aneurysm below renal artery. Arterial supply of GAT visceral associated organ, ciliac artery. Celiac artery, celiac trunk branches from abdominal aorta below the aortic opening at the upper part of upper bottom vertebral L1, just above the pancreas. Supply foregut derivative abdominal part of esophagus, stomach, above their part of duodenum up to major duodenal papilla, ampulla of Vater, liver, common bile duct, pancreas, spleen, superior mesenteric artery branches from abdominal aorta at the lower border of the L1 and supply midgut derivative lower RI part of duodenum below major duodenal papilla of Vater. Oh, khoda. Digestion malleus appendix, ascending colon, right coliflexor, right to the transverse colon, inferior mesenteric artery branches from abdominal aorta approximately vertebral level. Healthian supplies and gut derivative left of on the transverse colon, descending colon, sigmoid colon, rectum, upper part of the anal canal, above pectinate line, rectum, middle rectal fold up to pectinate line, endodermal cloaca, below pectinate line, endodermal cloaca. Na ectodermal proctidium. আচ্ছা, branches celiac trunk, branches left gastric artery, right downwards and lesser curvature. Branches esophageal gastric splenic artery runs along the superior border of pancreas, enters 2 layers of tenoidal ligament. Branches short gastric artery, fundus of the stomach, enters into gastrosplenic ligament. Left gastromental gastrobiliary artery run along the greater curvature of stomach. Pancreatic branches, artery of pancreatic magna, splenic branches. Common right hepatic artery, right gastric artery run along the lesser curvature. Proper hepatic artery near the protohepatic divides into right left hepatic artery. Cystic artery, branches of right hepatic artery supply to gallbladder. Gastroduodenal artery downwards to duodenum. Branches supraduodenal artery, right gastroduodenal artery branches, supraduodenal artery, right gastromental gastrocriploic artery run along the greater curvature of the stomach. Superior pancreatic duodenal artery supply the head of the pancreas and the duodenum. Inferior mesenteric artery, superior rectal artery একটা branch দেয়. Marginal artery Drummond formed by anastomosis between main arteries supplying the colon, namely ileocolic, right ileocolic, left colic and sigmoid arteries. In fact, it is utilized in surgery. However, at junctional point between the main vessel there may be variation in the competence of anastomosis. Vasa recta are in the arteries. In trauma we do resection end-to-end anastomosis. Vasa recta arises from the vaginal artery supply the colon. Closest to colon is descending and sigmoid part. Internal iliac artery supply. Pelvic organ except those are supplied by the superior rectal, ovarian, median, sacral artery, perineum, greater part of the gluteal region branches. আচ্ছা, anterior division in male 6টা branch: superior vesical, inferior vesical, middle rectal, inferior gluteal, interoparental, parental, obturator. In female 7 branches. Inferior vesical artery is replaced by vaginal artery. Uterine artery is the 7th branch. As a posterior division: superior gluteal artery, iliolumbar artery, two lateral sacral artery, internal parental artery, chief artery of perineum branches, inferior rectal artery, perineal artery, artery of the penis or the clitoris, external iliac artery branches, inferior epigastric artery, deep circumflex iliac artery. Inferior epigastric artery ক্ষেত্রে herniatomy and LUCS এর ক্ষেত্রে, আর deep circumflex iliac artery appendectomy এর ক্ষেত্রে. Inferior vena cava formed by union of the right and left common iliac vein. Inferior left conveys blood, oxygenated blood derived from left umbilical vein via ductus venosus formed in front of the L5 vertebra, 2.5 right to the median plane, reaches vena cava opening at T8 level, opening to right atrium opposite 6 costo sternal joint, length 20 to 30 cm, breadth 2.5 cm on the right side, right ureter, second part of relation, second right side right ureter, second part of duodenum, medial part of right kidney, hepatorenal pouch of Morrison, bed area of the liver on left side, abdominal aorta, right cluster diaphragm with cisterna, chyli, thoracic duct, omental bursa, caudate lobe of liver, tributaries. SBA MCQ, very important. Pair of common iliac vein, third fourth pair of lumbar vein, pair of renal vein, pair of renal vein, right coronal vein, right suprarenal vein, hepatic vein. Total vein হচ্ছে আচ্ছা portocaval anastomosis is an important abdominal part of the anastomosis between portal vein with the vena cava system forms the collateral circulation in portal obstruction. Important site: abdominal part of esophagus, esophageal tributaries of left gastric, portal vein with esophageal tributaries of the azygos, hemiazygos vein, systemic, umbilical, paraumbilical vein, portal and epigastric, systemic, bed area of liver, hepatic venule portal with intercostal veins and phrenic veins, systemic, posterior abdominal wall veins of the posterior abdominal wall veins of the retroperitoneal organ portal with the retroperitoneal veins of the abdominal walls and the renal capsule, systemic. Anal canal, superior rectal vein portal with the middle rectal, inferior rectal vein, systemic. আচ্ছা portal hypertension portal vein obstruction, caput madosa at the umbilicus, esophageal varices, gastroesophageal junction, hemorrhoids at the anorectal junction. আচ্ছা celiac plexus, phrenic plexus, hepatic, left gastric, phrenic and splenic, suprarenal, renal, testicular, ovarian, superior mesentery, abdominal, aortic or intermesentery plexus. अच्छा preganglionic sympathetic fibers greater lesser slightly, postganglionic fibers arising from the celiac ganglion, preganglionic vagal fiber, posterior vagal trunk containing fibers from the both left and right vagal nerve. The nerve from the right vagal story dominates. Sensitive fibers from the diaphragm reach the celiac plexus along inferior phrenic arteries. Posterior hypogastric plexus, superior hypogastric plexus, presacral nerve. Sympathetic descending fibers from aortic plexus, third fourth lumbar splanchnic nerve, parasympathetic pelvic splanchnic nerve. Branches to inferior hypogastric plexus, superiorly branch to uterine, testicular, common iliac. আচ্ছা inferior hypogastric হচ্ছে sympathetic T10 থেকে L2 derived from hypogastric nerve, parasympathetic pelvic splanchnic, branches pelvic viscera, some abdominal viscera. Parasympathetic craniosacral, dorsal nuclei, esophagus, stomach, liver, pancreas, duodenum, jejunum, ileum, ascending colon, proximal to third of transverse colon, আর sacral through theta 1/3 distal transverse colon, rectum, anus, sympathetic centers, thoracolumbar, prevent ganglion, prevertebral ganglion, celiac, superior mesentery, inferior ganglion. আচ্ছা obstruction, okay. Portal vein, venous blood from stomach to duodenum, jejunum, ileum, colon, rectum, pancreas, gallbladder, spleen, enters the liver through the hepatic portal vein, sinusoid of liver. Hepatic vein drains into IVC, enters into right atrium of heart, formed by union of the splenic vein and a formed superior mesenteric vein at the level of vertebra L2 behind the neck of pancreas. Course passed posterior to the superior part of the duodenum, enters into portal vein with the bile duct and procohepatic artery. Portal vein and its tributaries a divider valve, access reservoir of blood about 1/3 of entire blood. Tributaries of portal vein, superior mesenteric vein, splenic vein, right gastric vein, left gastric vein, systemic vein, parallel umbilical vein, superior pancreatic to duodenal vein. আচ্ছা আচ্ছা except liver, foregut, midgut, hindgut up to pectinate line হচ্ছে drains into portal vein, আর liver হচ্ছে drains into hepatic vein. Suprarenal gland, kidney, ureter, testis, ovary, right and left common iliac, lymph node, drains into lateral or lumbar para-aortic lymph node, দুইটা lumbar lymph node, lymph right and left trunk, drains into cisterna chyli. Foregut, midgut, hindgut plus anal canal up to pectinate line হচ্ছে ইনফিরিয়ার মেসেন্টারিক লিম্ফ নোড, সেটা দেন যায় সুপিরিয়ার, দেন যায় সিলিয়াক, আর হচ্ছে এগুলো হচ্ছে প্রি অ্যাওর্টিক, এটা দেন হচ্ছে ইন্টারস্টিশিয়াল লিম্ফ ট্রাঙ্ক, সেটা যাবে হচ্ছে সিস্টারনা কাইলি T12 লেভেলে। সো দুইটা হচ্ছে রাইট অ্যান্ড লেফট ট্রাঙ্ক প্লাস মাঝখানে একটা ইন্টারস্টাইনাল লিম্ফ ট্রাঙ্ক, যেটা প্রি অ্যাওর্টিক থেকে আসে, এগুলা হচ্ছে সিস্টারনা কাইলিতে T12 লেভেলে ড্রেন করবে। Cisterna chyli elongated lymphatic sac, আচ্ছা, situated in front of the first, second lumbar vertebrae immediately right to the abdomen, overlapped by right crest of the diaphragm upper and continuous with the thoracic duct, situated in posterior abdominal wall. আচ্ছা, what? I'm done.
Okay, inferior vena cava is formed directly receives right suprarenal veins. Puborectalis muscle component of anorectal drain, an important component in the continence mechanism, gives a fibrous to longitudinal muscle as cisterna chyli receives lymph from alimentary tract, lies within the right crest of diaphragm, and aorta receives right and left lymph tract. Now sublet both Meissner orbit plexuses are present in the colon and small intestine. Inferior mesenteric artery supplies the descending colon and rectum. Transverse colon of the large intestine, subgluteus lymphatic drain from fallopian tube to the parietic nodes and scrotum to the superficial inguinal nodes. Regarding normal anatomy of GIT, valvulic conjunctives are 1 mm thick in ileum. Maximum diameter of jejunal loop is 4 cm in the stomach. Acetylcholine stimulates secretion of gastrin. Histamine stimulates secretion of hydrochloric acid. Gastrin stimulates the secretion of histamine. Acetylcholine stimulates the secretion of hydrochloric acid. Stomach, G cell found in the antrum. Parietal cells are found in the fundus. The epithelial foramen is bounded by inferior vena cava and first part of the duodenum. The entrance to lesser sac is bounded by inferior vena cava and first part of the duodenum. The lesser omentum lies between liver and stomach, has a right margin behind lies the epiploic foramen. Contains portal vein. The greater omentum is attached to the transverse colon. Greater curvature of stomach. Mesentery small. Intestine attached to from duodenum through iliac junction. Small intestine contain branches of superior mesenteric artery. Transverse colon attached to horizontally to the anterior border of pancreas. Sigmoid colon contain internal iliac vein, inferior mesenteric vein. Macal diverticulum is the most common congenital abnormality of GI tract. Can mimic the acute appendicitis when inflamed. Macal's diverticulum, remnant of vital intestine duct, cytopectomic gastric tissue, cause of intussusception. Portal vein carries nutrient-rich blood from GIT and drains into the liver sinusoid. Is main blood supply of liver. Portal vein is formed by the union of the superior mesenteric and splenic vein and drains venous blood from the abdominal part of the esophagus up to the part of anal canal. Gains tributaries from the anterior abdominal wall. Pudendal nerve is a branch of sacral plexus. Enters the pudendal canal by curling round the sacrospinous ligament. Gives inferior rectal nerve. Supplies anal canal below the pectineal gland. Structures which can be palpable during the DRER. Cervix, seminal vesicle, coccyx. The rectum supplied by autonomic nerves related anteriorly to the cervix. Skin around the anal canal has a sensorial supply. Pudendal nerve and posterior ramiosacral fold. Zone 2 of hepatic acidosis is first to show ischemic necrosis. Hepatic acidosis further divided into zone provides a relation of blood perfusion metabolic pathway. The caudate lobe of the liver receives arterial supply from both right and left hepatic arteries. Characteristically enlarged in Bucciati syndrome. Gallbladder, closely related to duodenum, supplied by branch of right hepatic artery, have muscular layer that arrange distinctly in different layers. The pancreas, both anatomically functionally a mixed gland, partially retroperitoneal, forms part of the stomach bed, is connected to the hepatobiliary system through its duct. The pancreas supplied by gastroduodenal artery, superior pancreaticoduodenal artery, splenic artery, head of the pancreas related posteriorly with the following structures: common bile duct and inferior vena cava. Spleen is the relation with stomach, left kidney and left colic flexure. Suprarenal gland supplied by the inferior phrenic artery, renal artery, perinephric fat accumulate posteriorly to form distal
distinct thickened layer. The kidney is protected from trauma by heavy lumbar muscles in the back, anterior abdominal muscles, abdominal viscera, and vertebral bodies and ribs. Following are the congenital anomalies of kidney, horseshoe kidney, and pelvic kidney. Certain statements are correct regarding the adrenal gland. They lie anterior to diaphragm. The left adrenal lies behind the lesser sac. The cortex derived from the mesoderm. Ureter is related to the sacroiliac joint and tip of the lumbar transverse process. Female ureter related to ovarian fossa, related to obturated neurovascular bundle, and runs through the bladder wall obliquely. The right ureter is related posteriorly to the internal iliac artery genitofemoral nerve. The left ureter receives its main arterial supply from branches of aorta adherent to overlying peritoneum, inferior to uterine artery, lateral to surface of the uterus, medial to obliterated umbilical artery and the lateral wall of pelvis. Bladder. Female urethra is squamous epithelium in distal part of its length, are urinary bladder attached to the umbilicus, closely related to the pubic bones. Internal urination sphincter in case of male. Sympathetic nerve T11 থেকে L2 if it traverses sphincter urethra. It is located in the prostatic urethra ejaculatory tract. Develops from vesicourethral pouch and consists of smooth muscle involuntary. Testis epididymis lined by principal cells containing stereocilia, displays tunica albuginea on the inside and is located on the posterior edge of the testicles. The scrotum fibromuscular pouch has reached sensory nerve and has a median raphe. Size of undescended testes are deep inguinal ring, inguinal canal. Undescended testes, deep inguinal ring. Site of undescended testes, inguinal ring, inguinal canal. Size of undescended testes, inguinal ring. Ectopic testes, femoral canal, front of the thigh, perineum. Acha, ectopic testes, femoral canal, front of the thigh, perineum, superficial inguinal pouch. Size of ectopic testes, medial side of thigh, root of the penis. Site of ectopic testes, femoral triangle, perineum, superficial inguinal pouch, perineum, pubic area, femoral triangle, femoral canal, pubic area, contralateral heaving scrotum. The testis is supplied by sympathetic nerve originating in the 10th thoracic segment, is drained by the lymph vessels to the paravertic lymph node. Normally completes its descent into scrotum at birth. Acha, in the testis, spermatogonia are the cells from which all spermatozoa are derived, and the sustentacular supporting cell of Sertoli are attached to the limiting membrane of the tubule. Prostate is the homologous of Skene's tubule in female, developed from primitive urethra, involved in carcinoma that affect mostly in the peripheral zone, characterized as fibromuscular glandular organ. Ovary drains into the paravertic lymph node situated above the pelvic brim in the newborn vagina. Related alternative to the ureter, has a lymph drainage both to iliac and superficial inguinal node, and is covered in its upper posterior part with peritoneum. The ovary lined by germinal epithelium from which ova is derived. Is attached to the infundibulopelvic ligament supplied by the ovarian artery. Achilles is lateral position by migrating along the paramesonephric duct, refers its pain along the distribution of obturator nerve. The vulva perineum is supplied by the following nerves. Inferior rectal. A midline abdominal incision below the umbilicus passes through the lineal by extraperitoneal fat fascia transversally as anterior uterine receives supply from the following nerve. Subpostal ilioinguinal, iliohypogastric. Following statements are correct concerning the abdominal layers. Scarpus fascia afford little strength in wound closure. Fascia transversally provides the strength to the abdominal wall and preventing hernia. The wall is supplied by both thoracic and lumbar sinus segment. Laceration. Abdominal wall between deep layer of superficial fascia and deep fascia. The penis between the superficial and deep fascia. Scrotum deep to the dartos layer. Acha. Laceration of male urethra just inferior to the urogenital diaphragm would likely to result in extravasation of urine into the. Acha. The pelvic peritoneum covers both the uterus with the uterine tube, covers the superior surface of the bladder in both sexes. Female pelvis, border sacrum, larger angle of pubic arch, narrow, greater sciatic nose, psoas major muscle inserted to the lesser trochanter of the femur, flexor hip joint and the trunk. Acha. Factor preventing inguinal hernia, obliquity of the inguinal canal, shutter, action of the arch fiber of the internal oblique transversus abdominis, contraction of chemostatic muscles. Lymph drainage of pelvic include scrotum to the superficial inguinal node, fallopian tube to the pre-aortic node. Levator ani muscle gain attachment from the fascia covering obturator internus, gain attachment to the both perineal and coccygeal body. আর হচ্ছে is reinforced. আচ্ছা, inguinal canal transits ilioinguinal nerve, has the fascia transversalis and conjoint tendon along its posterior wall. The relation and landmarks in the abdomen, neck of the pancreas lies in the transvalvular plain right adrenal gland posterior to the inferior vena cava. With regards to a plain abdominal extra trauma is likely if psoas shadow is outlined more clearly. The fractures leaves are 10, 11, 12. There is scoliosis to the injured side. Inferior epigastриc artery. Anastomosis is the branch of the internal thoracic artery. Pierces the fascia transversalis, passes in front of the arcuate line. Male contents of the deep perineal pouch in sphincter urethrae. Ureteral artery, deep transverse perineum. Atrial rectal fossa communicates with each other, contain the perineal nerve in its posterior part, lies inferior to the in its posterior part, lies inferior to the levator ani, which is the branch of the external iliac artery, inferior epigastric artery. 40-year-old patient suffering from chronic duodenal ulcer presents with hematemesis melanoma, which artery is responsible gastroduodenal artery regarding terminal ileum. Their special is abundant appendicular artery, branch of ileocholic artery. 40 years old men undergoing right hemicolectomy, which artery is intently ligated. Ileocholic artery, main factor responsible for maintaining anal continence. Pudendal is part of levator ani. Patient undergoes surgery for fistula and nano. After surgery, pain is due to which nerve? Pudendal. Is 30-year-old female presents with acute cholecystitis, which nerve root is involved for shoulder tip pain? C 3, 4, 5. Acha 4. Regarding spleen, which is true, long axis lies in the 10th rib, halamo kidney related posterior to the anterior pelvic artery vein. PAV. Pelvis artery vein. Acha, patient suffering blow to the perineum due to fall from the high cycle west part of the urethra is injured. Bulbar urethra, most constrictive part of the urethra. External urethral meatus. Structure is in front of the right sympathetic trunk in lumbar region, IVC. Descent of testis is governed by gubernaculum testis. Primary support of uterus, McIntyre's ligaments versus reason. In the fascia campana and fascia scarpa, femoral artery, ascending colon, venous drainage to superior mesenteric vein, superior mesenteric vein drain into portal vein. 18 years old lady with history of NVD, 15 days back, now anal incontinence developed. What is the most probable diagnosis? External, internal anal sphincter injury. Acha, female patient with complaints of hernia. Which structure most commonly injured in herniaplasty? Inferior epigastric artery, anal continence, anal sphinctering action loss, inferior hypogastric plexus, also known as pelvic plexus. 65 years old female in the OPD presents pruritus vulva, heart travel, hypertrophied biopsy reports cancer vulva with lymphogenous superficial inguinal lymph node. Needle pass through the sacrospinous ligament. Structure most commonly injured হচ্ছে pudendal nerve. Levator ani muscle forms a bulk of pelvis floor. Radical hysterectomy done and exposed broad ligament, also transverse cervical ligament. Which structure is more injured? Ureter. Which nerve passes through the sacroiliac? Obturator nerve. Joint. Obturator nerve. Calyx triangle severely bounded by undersurface of liver, below by cystic duct. Regarding segment of liver, caudate lobe 1 and left hepatic vein lies between segment 1 and 2. Suprarenal gland, middle suprarenal artery derived from abdominal aorta, inferior phrenic artery derived from renal artery, and right suprarenal vein drains into IVC. Anal cushion membrane, mucous membrane, arteriovenous anastomosis, anterior relation of the right ureter, right gonadal vessels, and root of mesentery. Inguinal hernia. Direct hernia lies medial to the inferior epigastric artery and lies lateral to the pubic tubercle. Which structure drains into superficial inguinal lymph node, lower part of anal canal, vagina below hymen, anterior abdominal wall below the umbilicus, pudendal nerve, exit through greater sciatic foramen along with course of internal pudendal artery, supply the external genital organ. Relation of vagina, cervix and vagina are anticlexion condition. Acha, the supply of Bartholin gland, internal pudendal artery. Female urethra supplied by pudendal nerve, line-wise transitional epithelium. Uterus connect to structures, board ligament attached in its lateral wall. Its position is anteverted to vagina, supravaginal part most fixed. Regarding squamo-columnar junction, precursor carcinoma reproductive age is mainly identified. Following structure completely covers posterior wall of inguinal canal. Fascia transversalis, pupillary vein of Meyer drains into right gastric vein. 25-year-old boy diagnosed as a case of acute appendicitis. What is the position of appendicitis? Following hip flexion, internal rotation over abdomen produces severe abdominal pain. Retrocecal. Following pelvic fracture, patient presents with acute retention of urine, blood, external meatus. Membranous urethra. Ulcer in the posterior wall of stomach, bleeding from which artery is splenic. Following blunt injury to kidney, bleeding accumulated in
Fascia of Gerota. Most differentiating features of jejunum from ileum. More fat and mesenteric tumor in upper half of ileum spread by internal iliac node. This structure plays vital roles in keeping the liver in its position. Attachment of hepatic vein to IVC. Most constant features of Meckel's diverticulum lies at the antimesenteric border of ileum.
10 সেকেন্ডের গ্র্যাপ তারপরে serous peritoneum abdomen 73 page. Serous membrane lined by mesothelial cell divided into parallel peritoneum. Lines the inner surface of abdominal and pelvic wall, the lower surface of diaphragm, embryologically derived from somatopleutic layer of lateral plate mesoderm, blood supply and nerve supply from body wall, somatic innervation and so pain sensitive. Visceral peritoneum lines the outer surface of organ, embryologically derived from slankopleutic layer of lateral plate mesoderm, blood supply nerve from underlying viscera, autonomic innervation. Visceral peritoneum evokes pain when it is stretched, ischemic or distended. আচ্ছা, intraperitoneal movable stomach, duodenum first proximal 1 inch, jejunum, ileum, appendix, cecum, transverse colon, sigmoid colon, liver, gallbladder, spleen, fallopian tube, ovary, আর হচ্ছে retroperitoneal duodenum except proximal 1 inch, ascending colon, descending colon, pancreas, suprarenal gland, আর হচ্ছে কিডনি, গ্রেট ভেসেল, ভ্যাজাইনা, সার্ভিস, সিম্পাথেটিক চেইন। সেকেন্ডারি ওনলি যারা শুরুতে পেরিটোনিয়াম দিয়ে কাভার ছিল সেটা হচ্ছে সেকেন্ডারি রেট্রোপেরিটোনিয়াল অর্গান, যেটা ডিওডেনাম, এক্সেপ্ট প্রক্সিমাল 1 inch, ascending colon, descending colon, pancreas, and subperitoneum, rectum, uterus and urinary bladder. Folds of peritoneum, momentum, greater and lesser momentum, mesentery, mesoappendix, transverse mesocolon and sigmoid mesocolon. Thoracic duct drains into the meeting point of the left jugular vein and left subclavian vein. T3 লেভেলে এটা রাইট থেকে লেফটে যায়, NC7 লেভেলে এটা কার্ভ হয়। ওকে, ডান। ডেভেলপমেন্ট অফ পেরিটোনিয়াল ফোল্ড, ফোরগার্ড পেরিটোনিয়াল ফোল্ড, ভেন্ট্রাল মেসোগাস্ট্রিয়াম ফর্ম, falciform ligament, right and left triangular ligament, superior inferior coronary ligament, lesser momentum, dorsal mesogastrium form, greater momentum, gastrosplenic ligament, duodenal ligament, gastrosplenic ligament and spleen. আচ্ছা, ভেন্ট্রাল মেসোগাস্ট্রিয়াম থেকে মেইনলি লিভারের ফোল্ডগুলো আসে, ফলস লিগামেন্টগুলো আসে। আচ্ছা, মিডগার্ড অ্যান্ড হাইন্ডগার্ড পেরিটোনিয়াল ফোল্ড থেকে হচ্ছে develop from dorsal mesentery which forms mesentery, mesoappendix, transverse mesocolon and sigmoid mesocolon. Lesser omentum inverted L shaped, যুক্ত থাকে with ligamentum venosum, porta hepatis. Function of peritoneum, movement of viscera, protection of viscera, absorption, dialysis, healing power, adhesion, storage of fat, provides pathway. Peritoneal cavity, greater sac, lesser sac, connected by omental foramen, epiploid foramen of Winslow. আচ্ছা, vertical slit opening through which the lesser sac communicate with greater sac, 3 cm situation, right free margin, আচ্ছা, situated behind the right free margin of lesser omentum at the level of 12 thoracic vertebra, boundary anteriorly. Right free margin of lesser omentum contain portal vein, hepatic artery, bile duct, posteriorly inferior vena cava, right suprarenal gland. ছবি 12 thoracic vertebra, superiorly chordate process of the liver, inferiorly first part of duodenum, horizontal part of hepatic artery. Importance, internal hernia into lesser sac can take place through the epiploid foramen. Greater sac, okay, recess আছে, subphrenic, suprahepatic recess, subhepatic recess, hepatorenal recess, Morrison pouch, paracolic gutter, দুইটা gutter, right and left. Right, right হচ্ছে communicate above with hepatorenal pouch, eventually infected fluid may extend into this gutter. From hepatorenal pouch and omental bursa, gastric content may be found in the pelvis along the gutter following perforated gastric or duodenal ulcer. Left gutter, paracolic gutter, is partially separated in the upper part of this from spleen by the phrenicocholic ligament. Okay, phrenicocholic ligamenটের জন্য স্প্লিন নিচে যেতে পারে না। Anteriorly inferior, hepatorenal pouch of Morrison, Anteriorly inferior surface of right lobe of liver and gallbladder, posteriorly right suprarenal gland, upper part of right kidney, second part of duodenum, hepatic flexure of colon, transverse mesocolon, a part of the head of the pancreas, in front renal surface and right lobe of liver, behind right kidney and right cauliflower, below recesses open and communicate with right paracolic artery, left side communicate with lesser sac through apopleural foramen, right side limited by diaphragm. अच्छा, greater omentum contain right and left vestibular apopleural vessels and fat. Lesser omentum, rectory margin of the lesser omentum contain protohepatic artery, portal vein, bile duct, lymph node, lymphatic, hepatic flexus nerve, all enclosed in perivascular or fibrous sheath. Along lesser curvature of stomach, along the upper border of vagina, part of the duodenum contain right gastric vessel, left gastric vessel, gastric group of lymph node and lymphatic branches from gastric nerve. Mesentery, attached border of the root of mesentery, 15 cm long, attached from duodenal flexure at the level of L2 to the right sacroiliac joint. Structure caused by root. Third part of duodenal, abdominal aorta, inferior vena cava, right gonadal vessels, right ureter and psoas major, right genitofemoral nerve, right sacroiliac joint. T10 ট্রানসেকশনে আম্বিলিকাসের পর কোনো সেন্সেশন পাওয়া যায় না। Okay, confused. Acha, free or intestinal borders, 6 meter extended from DJ flexion to ileocecal junction. Contain jejunum ileum, jejunum ileal branches of a mesentery artery accompanying vein, autonomy, nerve plexus, lymphatic and lacteal, 100 থেকে 20 lymph node connective tissue with fat. Appendicular vessels, nerve, lymphatic. Okay. Sigmoid mesocolon triangular fold peritoneum which suspend the sigmoid colon from pelvic wall. Attachment root is shaped like inverted V. Apex is over the left ureter at the termination of the left common iliac artery. The left limb of the V attached along the half of the left external iliac artery and right limb of the posterior pelvic wall extending downward medially from the apex to the medial plane at the level of the vertebra. দুইটা লিম্বি oblique. আচ্ছা, বাইফার্কেশনের নিচ দিয়ে হচ্ছে আচ্ছা ওয়াটার আন্ডার দ্য ব্রিজ, তো না এখানে ওয়াটার আন্ডার দ্য ব্রিজ না। আচ্ছা যাই হোক, ইউরেটার, লেফট ইউরেটার, অ্যাপেক্স অফ সিগময়েড মেসোকলন, এক্সটার্নাল ইলিয়াক আর্টারি, বাইফার্কেশন, লেফট লিম্ব অফ সিগময়েড কোলন, রাইট লিম্ব অফ সিগময়েড কোলন, বাইফার্কেশনে। lies over the left ureter at the termination of the left common iliac artery. আচ্ছা, যখন বাইফার্কেট হবে এখান দিয়ে উপর দিয়ে লেফট ইউরেটার যাবে, তার উপরে এই কোলন, content sigmoid and superior rectal vessels and nerve, lymph node and lymphatic. Works the left ureter at the termination of left common iliac artery. তাহলে কোনটা উপরে কোনটা নিচে? Pouch of Douglas, rectouterine pouch. Anteriorly uterus and posterior fornix of vagina, posteriorly by the rectum, inferiorly by rectovaginal fold relation. আর ছেলেদের হচ্ছে rectovesical pouch. Dependent part of the body in standing, hepatorenal pouch of Morrison, right has subhepatic space in standing in case of male, rectovesical pouch in case of female, rectouterine pouch, pouch of Douglas. Vagus, foregut plus midgut through celiac plexus and T5 থেকে T9, greater flanking nerve, celiac ganglion, postganglionic fiber, celiac plexus, post plexus fiber থেকে foregut structure, sympathetic supply T10 থেকে 11 থেকে lesser and 12 হচ্ছে least, এই দুটো মিলিয়ে superior mesenteric ganglion থেকে plexus থেকে midgut, ganglion থেকে plexus and L2, 3, 4 lumbar splanchnic, hypogastric, তারপর inferior mesenteric ganglion, then plexus, then fiber, then hindgut থেকে anal canal up to pectinate line. Kidney are kept in position by perinephric fat, renal fossa, paranephric fat, excretory organs situated in the posterior abdominal wall. Anterior surface irregular, posterior surface flat, hilum from anterior to posterior vein artery pelvis. Kidney located in epigastry, hypochondria, umbilical and lumbar. Transvalatory plane crosses to upper part of the hilus of the right kidney and through the lower part of hilus of the left kidney. 11 cm long, 6 cm broad, 3 cm thick, 150 gram male, 130 gram female. In the fetus, lobulity made of 12 valvular kidney moves with respiration. अच्छा trans retroperitoneal organ अच्छा a kidney and covering fibrous capsule, perinephric fat, rectal fascia and paranephric fat. अच्छा fibrous capsule, perinephric fat, rectal fascia कोई से हमें sorry renal fascia and paranephric fat. Renal fascia is important. It is formed by the condensation of areolar tissue between parietal peritoneum, posterior abdominal wall, and restrain the extension of perinephric abscess. Renal fascia consists of anterior posterior layer. Anterior layer is thin, also known as fascia of total, posterior layer thick and known as fascia of Zucker-Kendall. Suspensive ligament of suprarenal gland prevent downward displacement of kidney. अच्छा inferior mesenteric plexus also supply internal anal ureter sphincter urinary bladder. Secretory part and collecting part portions separate ना होले polycystic kidney intraperitoneum होले भाषमान floating kidney. Cortical arch and medullary pyramid separate ना होले lobulated kidney. अच्छा congenital और अच्छा Renal fascia attachment above. Both the layers are fused upper end of kidney and split to enclose the suprarenal gland in separate compartment at the upper end. Later, the layer reunited continues with the subdiaphragmatic fascia forming the suspensive ligament of suprarenal gland, and this ligament prevents the downward displacement of kidney below. Two layers remain separate enclosing the ureter. Anterior layer merges with the extraperitoneal connective tissue of the iliac fossa, while posterior layer blends with the fascia iliaca. Laterally, both layers are fused at the lateral border of kidney continuous with the fascia transversalis. Medially, anterior layer covers the front of the kidney renal vessel continuous with the similar layer opposite renal fascia in front of the aorta and inferior vena cava. The continuity of the anterior layer, both renal fascia traceable up to origin of superior mesenteric artery. Posterior layer covers the back of the kidney renal vessels, blends with the psoas fascia and attached with the body of lumbar vertebrae at the medial border of the kidney. The fascia forms a septum which is pierced by the renal vessel. Because of this septum, perirenal effusion cannot cross the opposite side. Posterior relation of kidney diaphragm, medial and lateral arcuate ligaments, psoas major, quadratus lumborum, transversus abdominis, subcostal vestral, subcostal iliohypogastric, ilioinguinal nerve, right kidney 12 kidney and left kidney 11 12 kidney. Posterior relation আছে. Anterior relation kidney right and left. সখী হেলে দুলে কোথা যাও. Right suprarenal gland, liver, second part of duodenum, hepatic flexure of colon, small intestine. Left kidney সখী সখা গায়ে পায়ে জল কেন. Suprarenal gland, left. Spleen, gastric, posterior inferior surface of the stomach, pancreas, body and splenic vessels, jejunum, colon, splenic fraction and descending colon. Histology of kidney. Outer retrorenal cortex, inner pale, medulla, space, renal sinus, renal cortex, two part cortical arches, cortical lobule. They form caps over the base of renal pyramid, renal column in between the pyramid, each pyramid, cortical arch form the lobe of kidney. Medulla made of 10 conical pyramid. Apices form the renal papilla which indent the minor calyces. Renal sinus space that extend into the kidney from the hilus. It contains branches, renal artery, tributaries of renal vein and renal pelvis. Pelvis divides into 2-3 major calyces. These in turn divide into 7 to 13 minor calyces. Each minor calyce ends in expansion which is indented by 1 to 3 renal papilla. Hindgut parasympathetic S2-3 for pelvic splanchnic nerve through inferior hypogastric, superior hypogastric and inferior mesenteric. Glomerular membrane, capillary endothelium, fenestrated messenger cell, contractile cell, secret ECM immune complex, basal lamina of capillary endothelium contain negatively charged glycoprotein food process or podocyte. Development. Metanephron or permanent kidney develop from two sources, ureteric bud, metanephric bud. Ureteric bud arises from lower end of mesenteric duct. It gives collecting part of kidney, collected tubule, minor calyx, major calyx, kidney and ureter. Metanephric, lowest segment of the intermediate mesoderm, segmented into small masses. Each masses gives the nephron excretory unit of the kidney. Secretory, Bowman's capsule, proximal convoluted tubule, loop of Henle, distal convoluted tubule which join the collecting tubule. আচ্ছা, developmental anomalies, lobulated pelvic, horse-shaped kidney, unilateral double kidney, congenital polycystic rosette kidney, cakey kidney. Horse 2 হচ্ছে due to non-union of the two metanephric blastema across the midline. Exposure of the kidney from back, skin superficial fascia, posterior layer of thoracolumbar fascia, erector spinae, middle layer of thoracolumbar fascia, quadratus lumbar of muscle, anterior layer of thoracolumbar fascia, subcostal nerve and vessel, para, renal fat, renal fascia, perirenal fat, renal capsule, kidney. Kidney stone, large kidney stone may lodge at the 3 natural constriction of the ureter, where the renal pelvis joins the ureter, where the ureter crosses the pelvic brim, and at the entrance of the ureter into the urinary bladder. Ureter relation, abdominal part of ureter. Passes downward and slightly medially beneath peritoneal, posterior abdominal wall, and enters pelvic cavity by crossing either bifurcation of the common iliac artery or beginning of external iliac artery. Posterior relations was major muscle and fascia medially, genitofemoral nerve passing downward and laterally, and strip of transverse process of all number vertebra separated by first major muscle. Bifurcation of common iliac artery. Anterior relation, right ureter, parallel peritoneum, left same, right gonadal vessel, left gonadal vessel, right ureter, second and third part of duodenum, left ureter, left colic segment branch of inferior mesenteric vessels, right colic and right colic and ileocolic branches of superior mesenteric vessels, right ureter, root of mesentery and terminal part of ileum, left ureter, apex of the inverted V-shaped attachment of sigma and mesocolon. Here the ureter lies in the posterior wall of intersigmoid recess of the peritoneum. In female, accompanied in its course by the uterine artery which runs above and anterior to it in the broad ligament of uterus. Because of its location, the ureter is in danger of being injured in the process of hysterectomy. Ureter runs under the bridge, uterine artery. In male, passes posterior inferior to the ductus deferens and lies in front of the seminal vesicle before entering the posterior lateral aspect of the bladder. Intramural part of the ureter. Most constitutive part of the ureter. এইটা আচ্ছা, পিছন থেকে দেখলে posterior aspect of bladder, ইউরেটারের উপরে ভাস ডিফারেন্স আর নিচে দিয়ে যাইতেছে হচ্ছে সেমিনাল ভেসিকল, সামনের দিকে, সবার মুখ সামনে, আর হচ্ছে নিচে হচ্ছে প্রস্টেট। তাহলে উপরে ভাস ডিফারেন্স, তার নিচে ইউরেটার, তার নিচে সেমিনাল ভেসিকল, তার নিচে প্রস্টেট। কনস্ট্রিকশন, pelvic আচ্ছা, মোস্ট কনস্ট্রিক্টেড ইউরেথ্রা, এক্সটার্নাল ইউরেথ্রার মিয়েটাস। কনস্ট্রিকশন 3 নাম্বার at the pelvic ureter junction, brim of lesser pelvis, passage at its passage to the bladder wall, most constricted part. Okay. আচ্ছা, bladder wall, transmural part of the ureter. আচ্ছা, histology-তে submucous absent, blood supply. Upper part branch of renal artery, middle part branches of aorta, lower part branch of vesical, middle rectal or uterine artery. Interior of the bladder, developed from mesoderm. Greater part lined by irregular mucosal fold. আচ্ছা, trigonal bladder, greater part of lined irregular mucosal fold except lower part of the base smooth due to firm attachment to muscular cord known as trigonal bladder, ureteric opening 2, 5 and 5 cm in the empty bladder, 5 cm distant bladder. Trigon bounded by দুইটা orifice of the ureter, an internal ureter orifice which is thick circular layer called the internal sphincter. Sphincter vesicae has a uvula which is small eminence at the apex of its trigon projecting into the orifice of the urethra. Structure of the trigon, mucous membrane transitional epithelium which is tense, trigon muscle of Bell which replaces submucous cord adherent to mucous membrane. Importance of the trigon, most fixed dependent part of the urinary bladder is blood supply, nerve supply developed from mesoderm, but rest of the bladder developed from endodermal cloaca. Blood supply, superior vesical artery, branch of internal iliac artery, non-obliterated part of the umbilical artery, inferior vesical artery, branch of internal iliac, replaced by vaginal artery in female. Obturator artery, branch from inferior gluteal artery in female uterine artery. Venous, vein from a vesical plexus which is situated along the inferior lateral surface of the bladder in the space of Reitzias. Plexus communicates below the prostatic venous plexus in male, finally drains into internal iliac vein through the posterior ligament of the bladder. Nerve supply, sympathetic from acha L2-3 lumbar slanking nerve and parasympathetic pelvic slanking nerve. আচ্ছা from sympathetic T11 থেকে L2 segment of spinal cord inhibitory to detrusor muscle, motor to sphincter vesicae, to called the nerve of feeling. Parasympathetic to common, sympathetic to common, nerve of feeling. Parasympathetic S2-3 segment of spinal cord, motor to detrusor muscle, inhibitory to sphincter vesicae. আচ্ছা vesical carcinoma spread communicates আচ্ছা internal iliac vein থেকে inferior vena cava, then heart, then lungs. ওকে আর এটার সাথে কমিউনিকেটস আছে ভালভ অফ বেটসন, ভালভলেস ভেনাস প্লেক্সাস অফ ভার্টিব্রাল কলাম, আর আরেকটা আছে ইন্টারক্রেনিয়াল ভেনাস প্লেক্সাস। আর ভেসিকল ভেনাস প্লেক্সাস অ্যান্ড প্রোস্টেটিভ ভেনাস প্লেক্সাস বোথ কমিউনিকেট উইথ বেটসন। লিম্ফ, ইন্টারনাল আইলিয়াক লিম্ফ নোড। Prostatic male urethra most dilated, membranous least dilatable. Urogenital diaphragm superior inferior layer upper নাম perineal membrane, membranous spongy urethra separate করে perineal membrane, deep and superficial perineal space divide করে perineal membrane which is inferior to urogenital diaphragm. আচ্ছা এটা স্পঞ্জি পার্ট অফ ইউরেথ্রা হচ্ছে বালবার পিনাল, আর হচ্ছে ইস্টার্নাল ইউরেথ্রাল ওরিফিস হচ্ছে মোস্ট কনস্ট্রিক্টেড পার্ট। রাপচার ইউজুয়ালি এফেক্টস দ্য Rupture usually affects the membranous urethra below perineal membrane. Consequently, the urine becomes extravasated in the superficial perineal pouch when the patient attempts to void urine from the superficial pouch. The extravasated urine passes forward deep to the dartos muscle of the scrotum and the fascia of penis, produce edematous swelling of the structure. On further collection, the urine may appear in the adrenal wall deep to the fascia of scarpa. Membranous layer of superficial fascia extend as high as axilla, but it cannot appear in front of the thigh due to fusion of the fascia of scarpa and fascia lata immediately below the inguinal ligament. Traumatic rupture of urethra above the urogenital diaphragm produce extravasation of urethra above the urogenital diaphragm produce extravasation of urine in the pelvic extraperitoneal space. Testis, tunica vaginalis albuginous and tunica vasculosa. Structure 2-3 east lobe containing 2-3 tubule lined by the cell which represents stages in formation of spermatozoa. 75 tubule, straight tubule 20 থেকে 30, ready testis, efferent tubule 12 থেকে 30, dilatation. Head of epididyme is ductus deferens. Histology consists of cell arranged in 4 to 8 large and fully functioning testes. The cells are of two types: spermatogenic cell forming vast majority, spermatogenic cell includes spermatogonia, primary spermatocyte, secondary spermatocyte, spermatid, spermatozoa. Supporting sustentacular or cells of Sertoli, tall and columnar in shape, extending from basal lamina to the central lumen, support and protect the developing germ cell and help in maturation of spermatozoa. Spermatogenesis controlled by follicle stimulating hormone of the anterior pituitary gland. Interstitial cellular cells of Leydig found as small clusters in between the seminiferous tubule. They secrete testosterone and androgen. The activity of Leydig cell is controlled by interstitial cells stimulating hormone ICHAs of the anterior pituitary gland. Artery supply L2 বরাবর, testicular artery lateral branch of artery supply of the abdominal aorta. L2 বরাবর. Lymphatic supply paraortic purple lymph node nerve by sympathetic nerve arising from segment of T10 aortic plexus দিয়ে যায়, which are both efferent for testicular sensation and efferent for blood vessel. Surgical importance: testicular nerve develop from T10 থেকে T12, so testicular pain may be felt around the umbilicus. Factors of descending of testis: hormone including male sex hormone by the testis and maternal gonadotropin, gubernaculum testi, SBM. Contraction arched fiber of internal oblique differential growth of body wall, intra-abdominal temperature and intra-abdominal pressure. Undescended testis. আচ্ছা lumbar iliac inguinal upper scrotal testis pathway wise এটা ectopic testis under the skin of the lower part of abdomen, under the skin of the thigh, femoral canal, under the skin of penis, in the perineum, behind the scrotum, in front of the symphysis pubis. HSBA, descent of testis. Second month begins to descend. Third month reaches iliac fossa. Fourth month rests on deep inguinal ring. Seventh month traverses the inguinal canal. Eighth month reaches superficial inguinal ring. Ninth month bottom of the scrotum. Bottom of the scrotum. अच्छा, lobe. Prostate carcinoma, posterior lobe, peripheral zone, and capsule lobe zone. Acha, zone of the prostate, central zone, 25% of glandular substance surrounds the ejaculatory duct and its opening. BAP affects this zone. Peripheral zone, 75% of glandular substance surrounds the central zone below and behind, forming the lower part of the gland. Cancer affects this zone. Transitional zone, BPH occurs. Acha, BP central zone hai. Okay. Capsule of the prostate, true. Formed by condensation of the peripheral part of the gland. False capsule lies outside. The true capsule derived from pelvic fascia anteriorly from puboprostatic ligament on its side, prostatic venous flexus embedded in it, posteriorly avascular, forming fascia of Denonville. Innermost gland is enucleated, leaving behind both the capsule and venous flexus between them. Lobe, lobe pasta, anterior, posterior, median, middle or right, and left lateral. Anterior lobe, small isthmus connecting the two lateral lobe of the gland, no glandular tissue, so no adenoma. Posterior lobe connect two lateral lobe behind the urethra, lies between the median lobe, behind the median lobe and ejaculatory duct. Primary carcinoma may occur posterior lobe. Median lobe lies behind the upper part of the urethra, in front of the neck of ejaculatory duct, just below the neck of the bladder, contain much glandular tissue, so common site for adenoma. Median lobe. Lateral lobe lies on each side of the urethra. Each lobe contain glandular tissue, so adenoma may occur. আচ্ছা, umbilicusের উপরে axillary lymph node, নিচে হচ্ছে superficial inguinal lymph node. Boundaries of the peritoneum. Superficially anteriorly scrotum in male, mons pubis in female, posteriorly buttock on each side, upper part of medial part of thigh, deep boundary anteriorly, upper part of pubic arch, posteriorly tip of coccyx on each side, conjoined ischiopubic trama, ischial tuberosity, sacrotuberosity ligament, division urogenital triangle anteriorly, anal triangle posteriorly, imaginary line passing through two ischial tuberosity divides the perineum into. Urogenital triangle, superficial perineal pouch, deep perineal pouch, anal region, anal canal, istiorectal fossa. Perineal body, 10 muscle interlaced to form it. 2 unpair external anal sphincter, longitudinal muscle or rectum. 4 pair bulbous spongiosus. Superficial transversus perineum, deep transverse perineum, levator ani. Importance of perineal body is position, condition provided stabilizing influence for pelvic and perineal structure. Injury to it during childbirth may weaken the pelvic floor, contribute to prolapse of vagina and uterus. Very important for female for supporting the pelvic organ. Pelvic diaphragm formed by levator ani and coccygeus muscle. Superficial perineal pouch, boundary, superficial deep layer of superficial হচ্ছে deep layer of superficial perineal fascia or Colles fascia, deep inferior layer of urogenital diaphragm or perineal membrane. On each side, ischiopubic rami, posteriorly fusion of Colles fascia and perineal membrane, anteriorly open and continuous to the space of the scrotum, penis and anterior abdominal wall. Deep superficially perineal membrane, deep superficial fascia of urogenital diaphragm. On its side, ischiopubic rami, posteriorly closed by union of perineal membrane with superior fascia of urogenital diaphragm. Anteriorly closed by the union of perineal membrane with superior perineal fascia of urogenital diaphragm at the transverse perineal membrane. Istiorectal fossa boundary. Laterally obturator internus muscle covered by obturator fascia, ischial tuberosity, medially levator ani muscle covered by anal fissure and sphincter ani externus apex, formed by fusion of anal fascia, obturator fascia, base formed by skin and superficial fascia. Infront fascia is limited by posterior border of perineal membrane, behind sacrotuberous ligament covered by lower fibers of gluteus maximus. Applied anatomy, common site of abscess that can extend to the other fossa by way of communication over the anococcygeal raphe. Lite syndrome, subclavian artery, lower trunk of brachial plexus arch over the first rib, hence they may be stretched or pushed up by the presence of a congenital hypertrophied scalenus anterior muscle or a cervical rib. This leads to thoracic inlet syndrome, also called scalenus anterior syndrome, cervical rib syndrome. Numbness, tingling pain along the medial side of the forearm and hand, wasting of small muscle of hand due to involvement of lower trunk of brachial plexus. Ischemic symptoms in the upper limb such as pallor, coldness of the upper limb, and weak radial pulse to compress due to the compress of subclavian artery. Sternal angle rectplan from the level reefs are connected. Secondary ascending aorta ends at this level. The arch of aorta begins and also ends. The descending thoracic aorta begins. Trachea divides into two principal bronchi below this level with upper 6 of T6. Pulmonary trunk divides into two pulmonary artery below this level with upper half of T6. Left recurrent laryngeal nerve. The asparagus vein arches over the root of the right lung and open into the superior vena cava. The cardiac pleasure situated at the same level. The thoracic duct from the right to left behind esophagus. T5 thymus gland in some cases. Upper border of heart lies at this level. Ending of pulmonary trunk, starting of pulmonary artery. টিপিক্যাল রিপ 3 থেকে 9, এটিপিক্যাল রিপ ফার্স্ট সেকেন্ড থার্ড 11 12 এটিপিক্যাল। আচ্ছা, ট্রু রিপ হচ্ছে প্রথম 7টা, আর ফলস রিপ 8 থেকে 12, লোয়ার 5, আর হচ্ছে 11 12 ফ্লোটিং। অ্যান্টেরিয়র আর্টারি 9টা। ফার্স্ট রিপ in front of scalene tubercle on the subclavian vein crosses the rib. Behind the scalene tubercle is subclavian groove where the subclavian artery and lower trunk of brachial plexus C8 and T1 are placed related to the rib. First digitation of serratus anterior attached to outer edge. Simpson fascia attached to inner border. Neck of the first rib and structure over medial to lateral. Sympathetic chain, posterior intercostal vein, superior intercostal artery, first thoracic nerve. Cervical lip and thoracic outlet syndrome. Rib arises from fibers represented by a fibrous band originating from 7 cervical vertebrae inserting into first thoracic rib, arising from anterior tubercle of the transverse process of C7 opportunity. Cervical rib may have free distal extremity or may only be represented by a fibrous band. Rib complete না হলে fluctuating pain and respiration এর সাথে fluctuating pain and complete হলে constant pain. আচ্ছা, lower trunk of brachial plexus mainly T1 is compressed, leading to wasting of interossei and altered sensation in the T1 distribution. Compression of subclavian artery may result in post-stenotic dilatation of with thrombus and embolus formation. Diagnosis, estimate, surgery are fraught with uncertainty. Vascular consequences include post-stenotic dilatation of subclavian arteries causing local turbulence, thrombosis, possibly distal embolus. Subclavian aneurysm may also arise. Pressure on the vein may result in subclavian vein thrombosis. Can cause pressure on lower trunk of brachial plexus, pain in medial aspect of hand, forearm, result in paresthesia, wasting of small muscle of hand. Blood supply, thoracic wall, posterior intercostal artery, anterior intercostal artery, intercostal vein, posterior intercostal vein. Azygophagus vein drain হচ্ছে ফার্স্ট প্রথমটা রাইট ব্রাকিওসেফালিক ভেইন, লেফট সাইডে লেফট ব্রাকিওসেফালিক ভেইন 2 3 4, রাইট সাইডে জয়েন্ট টু ফর্ম superior intercostal vein which drains into azygos. The left side joint to form left superior intercostal vein which drain into left brachiocephalic vein 5 থেকে 8, আর 9 থেকে 11 অ্যান্ড সাবকোস্টাল ভেইন অ্যাজাইগাস ভেইন, আর 5 থেকে 8 লেফট সাইডে হচ্ছে অ্যাক্সেসরি হেমিওজাইগাস ভেইন, 9 থেকে 11 অ্যান্ড সাবকোস্টাল হেমিওজাইগাস ভেইন। Clinical correlation: obstruction of superior vena cava, the collateral channel to shun the blood from upper half of the body to inferior vena cava. Azygous vein. Okay. Course and termination: azygous vein formation ascends up and leaves the abdomen by passing through aortic opening of diaphragm and enters the posterior mediastinum, ascends vertically, lying in front of the vertebral column up to the level of T4 vertebra, where it arches forward above the hilum of the right lung to terminate in superior vena cava. At the level of second costal cartilage provided with valves and may appear tortuous formation. Azygous vein formed by union of lumbar azygous and right costal, right ascending lumbar vein, right subcostal as a termination into the SBC just before vena cava pierces the pericardium. SBM. Acha, most important surface bony mark of thoracic is sternal angle, thickest strongest part of the sternum, manubrium sternum, most preferred site of bone marrow aspiration in adult. Manubrium, smallest and most vulnerable part of sternum, ossified process. Widest, most curved rib, first rib. Narrowest and smallest rib, first rib. Longest rib, seventh rib. Most laterally projecting, eighth rib. Oblique rib, most oblique rib, ninth rib. Commonest accessory rib, lumbar rib, gorilla rib, lumbar rib. Thoracic vertebra with solid body, T3. Anticlinal vertebrae, T11. All sternocostal joints are plain synovial joint except first sternocostal artery, primary cartilaginous vein movement to increase interposterior diameter to thoracic cavity. Pump handle movement, main movement to increase transverse diameter of thoracic cavity, bucket handle movement. Diaphragm. Major opening vena cava is visual aortic points. Musculophrenic vessel pierce the diaphragm. Left frenulum pierce the left dome of diaphragm. Medial arcuate ligament condensation of fascia of psoas major. Lateral arcuate ligament condensation of fascia of quadratus lumborum. Contraction of diaphragm enlarges vena cava opening to enhance venous return. Contraction of diaphragm has a sphincter effect on the esophageal opening, Pinchcock effect. Contraction of diaphragm has no effect on aortic opening because strictly outside the diaphragm. Okay. Vena cava situation T8, right part of central tendon, shape bordering structure passing through inferior vena cava, right phrenic nerve, few limb from liver, effect on contraction, dilatation. Cardiac failure pregnancy তে মানে প্রেগনেন্সিতে অ্যাভয়েড করব, কারণ হচ্ছে মোর ভেনাস রিটার্ন হয়ে হার্ট ফেলিয়ার হতে পারে, সেই জন্য ইনফেরিয়র ভেনা ক্যাভার সাইডে শুভ না, লেফট ল্যাটারাল শুভ। ইসোফিজিয়াল T10 splitty of right cross. Structure passing through esophagus, right and left vagal trunk, left gastric artery, lymphatic from liver, phrenicoesophageal ligament. Effect on contraction. আচ্ছা, vena cava dilatation, aortic no change. T12 behind the medial arcuate ligament, aortic. আচ্ছা, কি যায় aorta, thoracic duct, azygous vein sometime. Minor opening, এগুলো unnamed. Structure processing through superior digestive vessel through the gaps vessel between muscular slip arising from C5 process 7 costal cartilage. Musculophrenic artery passes through the gap between slips of origin from 7 to 8 rib. Lower 5 intercostal nerve and vessel. 7 to 11 pass through gaps between adjoining costal slip. Lower 5 intercostal nerves and subcostal nerve and vessel pass deep to the lateral arcuate ligament. Sympathetic chain passes deep to medial arcuate ligament. Greater lesser least flanking passed by piercing the crus of diaphragm on the corresponding side. Hemiazygous vein pierces the left crus of the diaphragm. Developmental source: septum transversum ventrally, pleuroperitoneum membrane at the side. Dorsal mesentery of esophagus dorsally, body wall peripherally. The diaphragm develops in the region of neck from the following four structures, most probably. Central tendon of diaphragm developed from septum transversum, domes, pleuroperitoneal membrane, part of diaphragm around the esophagus, dorsal mesentery of esophagus থেকে, peripheral part developed from body wall. আচ্ছা, action: muscles of inspiration, the main principal muscle of inspiration. When it contracts and descends, it increases the vertical diameter of the thoracic cavity. Muscles of abdominal staining: contraction of diaphragm along with contraction of muscle of abdominal wall raises the intra-abdominal pressure to evacuate the pelvic content. Voluntary expulsion effort, micturition, defecation, vomiting, parturition, muscle of weightlifting, thoracomuscular pump, this descent of diaphragm decreases intrathoracic pressure, increases intra-abdominal pressure. This pressure changes compress the inferior vena cava, consequently blood is forced upward into the right atrium. Sphincter esophagus, fibers of right crest of the diaphragm serve as sphincter control over the esophageal opening. Congenital hernia, posterior sternal hernia, common as congenital diaphragmatic hernia. In this condition, there is herniation, abdominal content into thoracic cavity which compresses lung and heart. Herniation occurs through gap pleuroperitoneal hiatus between the costal and vertebral origins of the diaphragm called the foramen of Bogdalek. Occurs commonly on the left side. Retrosternal hernia occurs through the gap between muscular slip of origin of sternal and seven cost cartilage, spessor or foramen of Morgagni. It is more common on the right side. Paroesophageal hernia. In this condition, there is defective diaphragm to the right and anterior to the esophageal opening. An important feature of paroesophageal hernia is that the normal relationship of the gastroesophageal junction in relation to the diaphragm is not disturbed. Acquired traumatic and hiatal sliding. This sliding are commonest internal hernias. Hiatus hernia caused by weakness of diaphragmatic muscle surrounding the esophageal opening and esophagus intra-abdominal esophagus pressure. Principal muscle of restriction diaphragm, commonest congenital diaphragmatic hernia, posterior lateral hernia, Bogdale, commonest of all internal hernia, acquired hiatal sliding hernia. Diaphragm receives most of the innervation C3, C4, 5 sinus signals, phrenic nerve as it mainly develops from third, fourth, 5 cervical myotome in the neck. Main factor responsible for the increase of vertical diameter of the thoracic cavity, contraction of the diaphragm, position of the body in which diaphragm lies at the highest level, supine position of the body in which diaphragm lies at the lowest level, sitting position, muscle of the weightlifting diaphragm. Okay, trachea extends from lower border of cricket cartilage corresponding to lower border of C6 vertebrae in the neck of the to the lower border of T4 vertebrae and the thorax. The upper half of the trachea located in the neck and lower heart, superior mediastinum. Extends C4 থেকে T4 cadaver placed in supine position. What? C6 থেকে T6 in the individual in standing position, C6 থেকে T3 in newborn. It is made up of 16 থেকে 20 C-shaped cartilaginous string. Posteriorly gap closed fibroelastic membrane contained transversely advanced trachealis muscle, lumen lined by ciliated pseudocertified columnar epithelium, many mucous and serous gland. Okay, arterial supply mainly by inferior thyroid artery, branches thyrocervical trunk, it is bifurcation by bronchial artery, branch of descending thoracic aorta, venous drainage, inferior thyroid vein, lymphatic drainage, pretracheal and paratracheal lymph node, nerve supply, sympathetic virus from middle cervical ganglion function, vasomotor bronchodilator, parasympathetic vagus and recurrent laryngeal nerve function, sensory and secretory motor to mucous membrane, motor to trachealis muscle development, develops from an endodermal outgrowth which appears as a diverticulum from the ventral wall of the foregut at the junction of the primitive pharynx, esophagus, known as laryngotracheal tube. So trachea is a foregut derivative. Histological structure, mucosa. Mucosa lining of trachea composed of pseudocertified ciliated columnar epithelium with goblet cell, laminopropia contain fine connective tissue fiber, diffuse lymphatic tissue, occasional solitary lymphatic nodule, elastic lamina formed by a dense layer of elastic fiber. Submucosa, trachea, submucosa composed of loose connective tissue, tubular gland, blood and lymph capillaries are prominent. Okay, hyaline cartilage next to the submucosa, 16 থেকে 20 C-shaped hyaline cartilage surrounded by dense connective tissue, perichondrium that deep at the trachea. Lumen open. Next, the tracheal muscle encloses the end of the C. Adventitia, outmost layer is adventitia containing numerous blood vessels and nerves. अच्छा, clinical correlation tracheostomy done 2-3-4 tracheal level ring है. अच्छा, importance of carina, functional importance because of the carina over the is the most sensitive. Calf reflex usually initiated here. Pathological significance helps to clear the sputum. It is visible as a sharp sagittal ridge at the tracheal bifurcation during bronchoscopy. Serves as a useful landmark located at 25 cm from incisor teeth, 30 cm from the nostril. If the tracheobronchial lymph node in the angle between the main principal bronchi enlarged due to stretobronchogenic carcinoma, carina become distorted and flattened. अच्छा, pleura, visceral pleura, parietal pleura, cervical pleura. It is domoparietal pleura extend into the root of the neck about 1 cm above the medial end of clavicle, 2 inches above the first costal cartilage called cupola, covers the effects of the lung. Therefore, utmost caution should be taken while penetrating this area with anesthetic agent. Needle, it is covered by the suprapleural membrane. Nerve supply, important. Phrenic nerve innervates the mediastinal pleura, central part of the diaphragmatic pleura, extend into the fissure of the lung, invests the entire lung except hilum and pulmonary ligament. Parietal pleura develop from somatopleural layer of the lateral plate mesoderm supplied by somatic nerve. nerve, intercostal nerve, phrenic nerve, pulmonary pleura developed from sphygmopedic layer of terrestrial bed. Mesoderm is supplied by autonomic nerve, sympathetic 2 থেকে 5 spinal nerve, parasympathetic vagus. Blood supply, parietal pleura supplied by intercostal, internal thoracic, muscular phrenic artery, vein drained into azygous vein, internal thoracic vein, pulmonary pleura supplied by bronchial artery and drains into bronchial vein. Pulmonary ligament, parietal pleura extend downward beyond the root of the lung as a fold called pulmonary ligament, which contain loose aerated tissue with lymphatic, so that pulmonary vein can expand during increased venous return. Function of the pulmonary ligament: provide dead space into which pulmonary vein can expand during increased venous return, allows descent of the root of the lung with the descent of the diaphragm during inspiration. As a result, the apex of the lung come down from tough suprapleural membrane, leaving an empty space below the membrane. Now the apex of the lung can expand into this empty space to allow the movement of the principal bronchi and pulmonary vessel during respiration. Cuff of the pleura hangs down as loose triangular fold called pulmonary ligament. The pulmonary ligament extends from the root of the lung as far as down the diaphragm between the lung and mediastinum. Parietal pleura lines the thoracic wall and mediastinum. Visceral lines the surface of the lung. Develops from parietal somatopleuric mesoderm, visceral sphygmopleuric mesoderm. Parietal innervated by somatic, visceral autonomic, parietal sensitive to pain, visceral insensitive to pain. Parietal pleura blood supply and lymphatic drainage is same drainage is same as that of the thoracic lung wall. Thoracentesis pleural tape performed at the sitting position. Usually the needle inserted in the sixth intercostal space in the mid-axillary line. Lower part of the intercostal space and upper border are intercostal nerve and vessels থাকে. Skin, superficial fascia, serratus anterior, intercostal muscle, interthoracic fascia, parietal pleura to reach the pleural cavity. Clinical anatomy: paracentesis thoracis, aspiration of any fluid from a thoracic space in mid-axillary line. Needle passed through the lower part of the space to avoid neurovascular injury. At the right and left costovertebral angle below the 12 ring behind the upper pole of the kidney has surgical importance during exposure of the kidney from the back. Pleura may be damaged at this site. Safety triangle, very important. Anterior to mid-axillary line, anterior border of latissimus dorsi, posterior axillary fold, pilion lateral to the pectoralis major muscle, anterior axillary fold, inferior nipple line, fifth intercostal. Lungs, external feature, apex with 3 border, 2 surface apex. Apex is rounded and blunt. Superior of the end of the lung, it extends into the root of the neck about 3 cm superior to the anterior end of the first rib and 2.5 the medial 1/3 of the clavicle. It is covered by cervical pleural suprapleural membrane. Relation: as subclavian artery, internal thoracic artery, saline anterior, posterior, neck of first rib and structure in front of it, ventral tremor, first thoracic nerve, first posterior intercostal artery, first posterior intercostal vein and sympathetic chain. All the structure related to apex are separated from it by suprapleural membrane. Apex is grouped by subclavian artery on the medial side and on the front. The clinical correlation: Pancoast syndrome due to involvement of structure related to posterior aspect of the apex of the lung এর জন্য হয় by cancer of the lung apex. Clinical feature: pain along the medial side of the forearm and hand, wasting of small muscle of hand due to involvement of ventral tremors of T1. Horner syndrome due to involvement of sympathetic chain, erosion of first rib. Some important feature: oblique feature cast the posterior border above about 6 cm below the apex of the level of T3, inferior border 5 cm from median plane. Horizontal feature rounds from fourth costal cartilage meets the oblique feature in the mid-axillary line at the fifth rib level. Oblique features act as the plane of cleavage so that during expiration upper part of the lung expand forward and laterally, whereas the lower part of the lung expand downward and backward. In X-ray chest view, horizontal feature available in 60% of the cases. The oblique feature is usually visible in the X-ray chest lateral view. Oblique feature of left lung is more vertical than the oblique feature in the right lung. Trunk-shaped projection of the left lung. Trunk-shaped projection of the left lung below the cardiac nose is called lingula, corresponds to the middle lobe of the right lung. Costal surface: costal surface large, smooth, convex, covered by costal pleura, endothoracic fascia. Relation: related to the lateral thoracic wall, embalmed and hardened lung. It is in embalmed and hardened lung, costal surface present impression of the rib. The number of rib related to surface allows 6 আর 10, mid clavicular, mid axillary and scapular. Structure related to mediastinal surface of the right and left lung. Right side right atrium and auricle, small part of the right ventricle. Left side left ventricle, left auricle, infundibulum, adjoining part of the right ventricle. Right side superior vena cava. left side left ventricle, left auricle, infundibulum, adjoining part of the right ventricle. Right side superior ventricle, inferior ventricle, left side pulmonary trunk, artery, aorta, descending thoracic aorta, trachea, two side trachea and esophagus, such as right side lower part of right brachiocephalic vein, and left side left brachiocephalic vein and left subclavian artery. Right side is azigovenous vein and left side is thoracic duct. Right side right vagus nerve and right phrenic nerve, left side left vagus nerve and left phrenic nerve. Root of the lung. Structure passing through lies opposite the body of the Pathwasher thoracic vertebra. Structure passing through the root of the lung, hilum of the lung, principal bronchus on the left side, and epiarterial and hyperarterial bronchi on right side. One pulmonary artery, two pulmonary veins, superior inferior bronchial artery, one on the right side and two on the left side. Bronchial vein, anterior posterior pulmonary plexus or now lymphatic of the lung, bronchopulmonary lymph node areolar tissue. Entering হচ্ছে bronchus artery, and যদি বেরোয় তাহলে vein and lymphatic. Arrangement of structure in the root of the lung at the hilum. Arrangement in the structure in the root of the lung hilum is as follows. From backward, it is more or less similar on two side: pulmonary vein, superior pulmonary artery, bronchus, left principal bronchus on the left side, and epiarterial and hyperarterial bronchus on the right. As from above downwards, it differs on two side: right artery, epiarterial bronchus, and pulmonary artery, hyperarterial bronchus, and inferior pulmonary vein. And left side pulmonary artery, left principal bronchus, and inferior pulmonary vein. রাইট লেফট লাংয়ের ভিতরে পার্থক্য কি? সাইজ অ্যান্ড শেপ লার্জার, শর্টার অ্যান্ড ব্রডার। রাইট লাং ওয়েট হচ্ছে 700 গ্রাম, লোব 3টা, আপার মিডল লোয়ার, ফিশার 2টা, হরিজন্টাল অবলিক, অ্যান্টেরিয়র বর্ডার স্ট্রেট, হাইলাম 2টা, ব্রঙ্কা আর্টেরিয়াল অ্যান্ড হাইপার আর্টেরিয়াল। আচ্ছা, সাইজ অ্যান্ড শেপ লেফট লাং স্মলার, লঙ্গার, ন্যারোয়ার, 650 গ্রাম, 2টা লোব, আপার অ্যান্ড লোয়ার, 1 একটা ফিশার থাকে অবলিক, হচ্ছে অ্যানাটমিক্যাল বর্ডার নট স্ট্রেট, প্রেজেন্স কার্ডিক নোজ, একটা ব্রঙ্কাস, লেফট প্রিন্সিপাল ব্রঙ্কাস। আচ্ছা, 25 আর 45 এর অ্যাঙ্গেল আছে। রাইট প্রিন্সিপাল ব্রঙ্কাস শর্টার, ওয়াইডার, মোর ভার্টিকাল, at 1 inch long and lies more or less in line with the trachea. Left principal bronchus narrower, longer and more horizontal than the right, 2 inches long, does not line in line with the trachea. আচ্ছা, pulmonary unit, alveolar duct, atria, air circular and alveoli. Each lower bronchus divides into segmental tertiary bronchi, one for each for bronchopulmonary segment. The segmental bronchi divide repeatedly to form very small bronchi called terminal bronchiole. The terminal bronchiole gives off respiratory bronchioles which, like cartilages in their walls, is respiratory bronchiole act. Aerates a small portion of the lung called pulmonary unit, which is concerned with gases exchange within the lung. Conducting zone: trachea, principal pulmonary bronchus, lower secondary bronchus, segmental tertiary bronchus, leading to several successive division to terminal bronchus, then lobular bronchiole, terminal bronchiole. Then আমি আসবো respiratory zone, respiratory bronchiole, alveolar duct, atrium, alveolar sac, alveolus. এইবার conductive and respiratory জোনের ভিতর পার্থক্য: hyaline cartilage present, blood supply by bronchial artery, left side 2 and right side 1, and function conduction of air. Respiratory zone hyaline cartilage absent, blood supply by pulmonary artery and gaseous exchange. Dunzo. আচ্ছা, regional distribution of the cell life of the respiratory tract epithelium. Trachea to terminal bronchial, ciliated columnar epithelial cell, goblet cell, basal cell, seromucous gland cell, neuroendocrine cell, brush cell, lobular bronchiole, ciliated cuboidal epithelial cell, basal cell, seromucous gland cell, upper part of the region only, brush cell, terminal bronchial, ciliated non-ciliated cuboidal epithelium cell, clara cell, brush cell, respiratory bronchial, ciliated non-ciliated cuboidal epithelial cell, clara cell, type 1 pneumocyte, alveoli, type 1 and type 2 pneumocyte. Cell of the air passage. না, এটা লাগবে না। ওকে, cell wall the type 1 cell of flat cell with large cytoplasmic extension and is the primary lining cell of the alveoli, covering approximately 95% of the alveolar epithelial surface area. আচ্ছা, আর নাম্বারের সাইজে যাই হোক, নাম্বার এসে 40%. টাইপ 2 সেল গ্রানুলার নিউমোসাইট আর থিকার and contain numerous lamellar inclusion bloody, although this cell make up 5% of the surface area. They represent approximately 60% of the epithelial cell in the alveoli. Type 2 cell are important in alveolar repair as well as other cellular physiology. Structure separated and functionally independent unit of lung tissue edited by a singular segmental bronchus is called bronchopulmonary segment. Infection restricted to one or more bronchopulmonary segment except malignancy or TB. Apical segment or lower lobe is the most dependent part of lung in recumbent position. So in case of severely bedridden patient, infected material especially into those segments. So infection is more common in apical segment of lower lobe. Apical segment of lower lobe. Knowledge of bronchial branching is essential for bronchoscopy and bronchogram. Knowledge of Knowledge of segment helps in surgery, TB, and helps in postural drainage of infected pulmonary regions. Characteristic features: it is a subdivision of the lobe of the lung, pyramidal in shape with apex directed towards the hilum and base towards the surface of the lung, surrounded by connective tissue, aerated by segmental tertiary bronchus. Each segment has its own artery, segmental branch of pulmonary artery. Each segment has its own lymphatic drainage and autonomic supply. Thus, bronchopulmonary segments are well defined anatomical, functional, and surgical units of the lung. Right lung is more prone to infection. Right lung is more prone to infection because right principal bronchus is shorter, wider, and vertical than left principal bronchus. Clinical correlation. Surgical knowledge হচ্ছে advancement in conservation led to the advancement of conservation of lung surgery since each segment independent bronchovascular supply potential space of separation exists between the segment. Localized chronic disease such as TB, bronchitis is venous neoplasm is restricted to one segment. It is therefore possible to dissect out, remove the disease segment, leaving the surrounding tissue intact. This procedure is called segmental resection. So one position apical segment of the lower lobe and sitting in হচ্ছে basal crepes, মানে recumbent position. Clinical correlation: aspiration of foreign body. Lung abscess occurs more commonly in the right lung. Inhaled foreign body usually right principal bronchus, shorter, wider, and in line with the trachea. Since the inhaled foreign particle tend to enter the right principal bronchus, hence it is the right lung. Blood supply, arterial supply. Lungs are supplied by two sets of artery, bronchial and pulmonary. Bronchial artery supply nutrition to the bronchial tree and pulmonary tissue. The right lung supplied to by one bronchial artery which arises from right third posterior intercostal artery from upper third bronchial artery. The left lung is supplied by two bronchial arteries which arises from descending thoracic outer pulmonary artery. The pulmonary artery supply deoxygenated blood to the lung. There is one pulmonary artery for each lung. There branches the pulmonary trunk. Ulala. Postural drainage. Foreign body descend right bronchus. Carina, Latin keel of the trachea is a sensitive area when patient is made to lie on his or her left side. Secretion from the right bronchial tree flow into the carina due to effect of gravity. This stimulates the calf reflex. Sputum is brought up. This is called postural drainage. Left lateral. HC. Aspiration pneumonia. If comatose anesthesia patient is subject to a particular risk of aspiration, such material will gravitate to the most dependent posterior part of the lung. Apical segment of the lower lobe supplied by the highest most posterior of the segmental bronchi and is therefore this segmental, particularly on the right, is the most common site for aspiration of the pneumonia in this patient. Development: only heating, pseudoglandular period, canalicular period, terminal period, and alveolar period. Nice. Superior mediastinum content: artery, arch aorta, brachiocephalic artery, left common carotid artery, left subclavian artery, vein, right and left brachiocephalic vein, upper part of the superior vena cava, left superior intercostal vein, nerve, phrenic, right and left vagus, right and left sympathetic tongue and cardiac nerve, right and left recurrent laryngeal nerve, lymphoid organ, lymphatic lymph node, thoracic duct, thymus, tubes, trachea, esophagus, muscle, sternothyroid, longus coli. Middle mediastinum contain heart, pericardium, arteries ascending outer pulmonary trunk dividing into two pulmonary arteries, pericardiophrenic arteries, vein, superior vena cava, lower half, azygous vein, terminal part, pulmonary vein, right and left, nerve, phrenic nerve, deep cardiac plexus, lymph node, trachea, bronchial lymph node, tube, bifurcation of aorta, right and left principal bronchi. Posterior mediastinum contain esophagus, thoracic duct, descending thoracic aorta and its branches, azygous, hemiazygous, accessory hemiazygous, vagus, sympathetic trunk and slunking nerve, posterior mediastinal lymph node. Pericardium. Fibrous pericardium is strong. Fibrous sac will support the delicate parietal layer of the cells pericardium with which is firmly adhered. Serous. Thin serous membrane lined by mesothelium. Double layered outer layer called parietal. Inner layer visceral. Different. Parietal pericardium adherent to fibrous pericardium develops from supraocular mesoderm innervated by somatic nerve sensitive to pain. Visceral adherent to myocardium of the heart develop from splanchoperic mesoderm innervated by autonomic nerve fibers insensitive to pain. Sinus of pericardium transverse and oblique. Arterial supply. Fibrous pericardium parietal layer of visceral pericardium supplied by the branches of the following artery: internal thoracic artery, musculophrenic artery, descending thoracic aorta, visceral layer of serous pericardium supplied by coronary artery. Nerve supply. Fibrous pericardium parietal layer of the serous pericardium supplied by the phrenic nerve, somatic nerve fiber. Visceral layer of serous pericardium supplied by the branches of sympathetic trunk and vagus nerve, autonomic nerve fiber. Thus, fibrous pericardium parietal layer of the viscera is sensitive to pain, whereas visceral insensitive. Consequently, pericarditis origin from parietal pericardium. SBA. Clinical anatomy. The sinus permits pulsation of the left atrium to take place freely during cardiac surgery, like as a pass through the transverse sinus around the aorta and pulmonary trunk to control hemorrhage. Accumulation of fluid in pericardial sac will compress the heart and decrease the diastolic capacity. This results in diminished cardiac output, but in increased pulse rate and increased venous return. Fibrous pericardium can stretch gradually if there is gradual enlargement of the heart. Sudden increase in pericardial content, as sudden bleed, stretching does not occur and cardiac function is impaired. Cardiac tamponade, paracentesis, aspiration of pericardiac fluid and intracardiac injection. Subcostal root, needle inserted through the costosified angle with an upward inclination about 45%. Parasternal root, needle inserted through the left fourth to fifth in the ICS close to lateral margin of the sternum in order to avoid injury. The left lung pleural sac in internal thoracic artery. Intracardiac injection is referred to the root. Significance: transverse pericardial sinus. During cardiac surgery, after the pericardial sac is opened anteriorly, finger is passed through the transverse sinus of pericardium posterior to the aorta and pulmonary trunk. A temporary ligature is passed through the transverse sinus around the aorta pulmonary trunk. The tube of the heart-lung machines are inserted into this vessel. Ligature is tightened. Key point: heart, slightly larger than one's own clenched fist. Conical hollow muscular organ situated in the middle mediastinal. Length 12 থেকে 9, weight 300 gram male and 250 gram female. Apex of the heart formed entirely by left ventricle, situated in the left fifth intercostal or 9 cm lateral to mid-sternal line, just medial to mid-clavicular line, below and medial to nipple. Basis formed by the left atrium, 2/3 of small part of right atrium. Upper border formed by 2 atria, chiefly left atrium. Right border formed only by right atrium. The inferior border, right ventricle, near apex by left ventricle. Left border mainly by left ventricle, partly by left auricle. Diaphragmatic surface formed by only 2 ventricle, 2/3 left and 1/3 right. Sternocostal surface formed by 2 ventricle, 1/3 left and 2/3 right. Right atrium, auricle and part of left auricle. Heart structures. Very important. Oblique sinus, posterior part of fibrous pericardium, right pair of pulmonary vein, right and left bronchi, esophagus with nerve plexus, descending thoracic aorta, thoracic duct, azygous vein, greater lesser splanchnic nerve, posterior mediastinal lymph node. Sternocostal surface. Formed by mainly right atrium, right ventricle, which are separated from each other by anterior part of the AV groove. Sternocostal surface also partly formed by the left auricle and left ventricle. The right ventricle is separated from the left ventricle by anterior interventricular groove. The left atrium hidden on the front by ascending aorta and pulmonary trunk. The part of sternocostal surface is uncovered by the left lung and cardiac nerves, forming an area of superficial cardiac dullness. Clinical correlation: apex beat. Outermost lowermost thrust of the cardiac contraction during ventricular systole felt on the front of the chest, or it is the point of maximum cardiac impulse. PMCI. Normally, apex beat is felt as a light tap in the left fifth intercostal space in the midclavicular line. Heart position more horizontally bacha color, so the apex of the heart lies in the third or fourth intercostal space. Consequently, the apex beat in children up to 7 years of age is felt in the third or fourth intercostal space, just lateral to midclavicular line. Cardiac shadow, very important. Posterior anterior view, cardiac shadow used for intestinal shadow. Left border of cardiac shadow from above downward, aortic arch, pulmonary trunk, left auricle, left ventricle. Right border, supraventricular SVC and right atrium. Acha, coronary sulcus. Circles the heart and separates the atria from the ventricle. Deficient anteriorly due to the root of pulmonary trunk. AV groove. AV groove is divided into anterior posterior part. Anterior part consists of right and left half. The right left Right half of the anterior part runs downwards to the right between the right atrium and right ventricle, lodges right coronary artery. The left anterior part of anterior ventricular groove interface between left auricle and left ventricle. It lodges circumflex branch of left coronary artery. The posterior part of the groove interface between the base and diaphragmatic surface of the heart. It lodges coronary sinus. Okay. Anterior posterior interventricular sulci separate right and left ventricle. The anterior interventricular sulcus is on the sternocostal surface of the heart and lodges anterior ventricular artery and great cardiac vein. Posterior interventricular groove is on the diaphragm surface and lodges posterior interventricular artery and middle cardiac vein. Medial point of interatrial groove, posterior interventricular groove. Posterior part of atrioventricular groove is termed crux of the heart. Circulation of blood. Right atrium receives deoxygenated blood from the whole body through superior inferior vena cava. Blood flows right atrium into right ventricle through atrioventricular orifice. The blood is prevented from regurgitating back to the atrium by means of right AV valve. Right ventricle contracts, propels the blood into pulmonary trunk, pulmonary artery, finally into the lung where blood is oxygenated. Pulmonary circulation. The left atrium receives the oxygenated blood from the lungs through pulmonary vein. This blood from the left atrium flows into the left ventricle through same valvular. Left ventricle strongly contracts, propels the blood into the ascending aorta and then into the systemic circulation. Right ventricle required to pump the blood through a relatively low resistant vascular bed, whereas the left high resistant peripheral vascular bed. Right atrium. External feature, elongated vertically, receives SVC upper end and IVC at the lower end. Upper anterior part is prolonged to the left to form a right auricular appendage. The right auricular margin of the auricular notch. The right auricle overlaps the root of the ascending aorta completely. Infundibulum of the right ventricle partly. Shallow vertical groove called sulcus terminalis extend along the right border between superior and inferior vena cava. Upper part of the sulcus contains the synovial node. Internally corresponds to crista terminalis. Vertically, right atrial ventricular groove lodges the right coronary artery and small cardiac vein. Internal features: interior of the right atrium divided into two parts. Main smooth posterior part, sinus venerum. Rough anterior part, the atrium proper. Two parts are separated from each other by crista terminalis. The interior of the right atrium also presents septal wall of the right atrium. Septal wall. Derived from septum primum, septum secundum. The septal wall, when viewing from within the right atrium, presents fossa ovalis, shallow oval saucer-shaped depression in the lower part formed by septum primum, represents site of foramen ovale in the fetus. Annulus ovalis, limbus fossa ovalis forms a distinct upper and lateral margin of fossa ovalis, represent free edge of the septum secundum. Inferiorly, the annulus ovalis is the continuous with the left end of the valve of IVC. Triangle of course, triangular area bounded in front of the base of the septal leaflet of the tricuspid valve, behind the anterior margin of the opening of the coronary sinus above the tendon of Todaro, endocardial ridge. The AV node lies in this triangle. Torus arterius in elevation in the anterior superior part of the septum produce tuitive bulging of the right posterior non-coronary sinus of ascending artery. আচ্ছা, triangular cause AV node থাকে, coronary sinus, inferior vena cava and atrioventricular groove এর coronary IVC and AV atrioventricular groove এর মাঝে, আর এখানে হচ্ছে থিবিশিয়ান ভালভ এন্ড ইউস্টেশিয়ান ভালভ ফর IVC. groove atrioventricular groove না, atrioventricular orifice এর মাঝে IVC. Okay, left atrium. Thin-walled quadrangular chamber situated posteriorly behind and to the left of right atrium, forms greater part, left two-thirds of the base of the heart, upper and prolonged anteriorly to form the left auricle which overlaps the infundibulum of right ventricle. Behind left atrium lies oblique sinus of serous pericardium, fibrous pericardium which separates it from the esophagus. Right atrium receives venous blood of the body, pushes blood to right ventricle through tricuspid valve, forms right border, part of sternocostal surface, small part of base of the head, and enlarged in tricuspid stenosis. Left atrium receives oxygenated blood from the lung, pushes blood to left ventricle through bicuspid valve, forms major pad of base of the heart, enlarged in mitral stenosis. Clinical correlation: opening into right atrium. Opening of IVC at the lower end of right atrium close to interatrial septum, guarded by rudimentary non-functional semilunar valve called valve of inferior vena cava, eustachian valve. Opening of coronary sinus, which drains most of the blood from the heart, opens into the right atrium between the opening of IVC and right atrioventricular orifice. It is also guarded by a rudimentary non-functioning valve, Lewisian valve. Right ventricle. Papillary muscle. This presents pillars of trabecular carni. The papillary muscle project inward. Their base is attached to the ventricular wall, and apices are connected to thread-like fibrous cord, chorda tendineae, to the cusp of the tricuspid valve. The three papillary muscle: anterior, posterior, and inferior septal. Anterior largest, posterior small, septal usually divided into 2 or 3 nipple. The papillary muscle of the right ventricle attached to the cusp of tricuspid valve, moderator valve, septum, marginal trabeculum. It is thick muscular ridge extending from ventricular septum to the base of the anterior papillary muscle across of the ventricular system. It conveys the right branch of AV bundle of his, a part of conducting system of the heart. It prevents the over distension of the right ventricle. In left ventricle, the walls of left ventricle are 3 times thicker than that of right ventricle. External features: left ventricle forms the apex of the heart, small part of the sternocostal surface, most of the part, left 2/3 of the diaphragmatic surface, most of the left border of the heart. Internal feature: lower rough inflowing part, small upper smooth outflowing part. Aortic vestibule. Cavity of the left ventricle is circular in cross section because the interventricular septum bulges into right ventricular. Trabeculum of left ventricle. Igloo well developed, present 2 large papillary muscle, anterior posterior, no moderator band. Opening left atrioventricular orifice and aortic orifice. Comparison. Thinner than right ventricle, thinner than left, 1/3 thickness of left ventricle, receives reoxygenated blood from right atrium, pumps into the lungs to pulmonary trunk. Wall of right ventricle thinner than that of left ventricle, ratio 1:3. Contains 3 small papillary muscle. Cavity of right ventricle crescentic in shape, forms 2/3 of sternocostal and 1/3 of diaphragmatic. Left হচ্ছে much thicker, 3 times receives oxygenated blood. Wall ratio 3:1. আর হচ্ছে contain 2 strong papillary muscle, moderate band absent, cavity circular, cross section and form 1/3 intercostal, 2/3 diaphragmatic surface. Cardiac skeleton is a collection of dense fibrous connective tissue in the form of O-ring with interconnected area in a plane between atria and ventricle. O-ring surround two atrioventricular orifice, aortic orifice, opening of the pulmonary trunk. These are annular fibrosis. They are annular fibrosis. AV fibrous rings are in front of the in the form of figure 8. And so there is no muscular continuity between atria and ventricle across the ring except for the AV bundle or bundle of His. Atrioventricle and membranous part of interventricular septum are attached to the skeleton. AV bundle, which passes between the annulus, is the single connection between those two groups of myocardium. Conducting system situated in the right atrial wall at the upper end of crista terminalis. SA node is the pacemaker of heart. From SA node, cardiac impulse spread to reach the AV node. SA node situated upper part of sulcus terminalis, central medial aspect of superior vena cava, shaped crescent-like, thickness 5 mm, function initiate physiological cardiac impulse before any part of the heart. Contains stellate cell or P cell, which can originate impulse at a higher rate than any part of the conductive system, as it can originate impulse at the highest rate of 70-80 to 80 meters per minute. It is called the pacemaker of the heart. Blood supply. পার্থক্যতে যায় অরিজিন anterior aortic sinus of ascending aorta course between pulmonary trunk and right auricle descends in AV groove on the right side, turns at the inferior border to run in the posterior part of the anterior ventricular groove. Atrioventricular groove termination ends by anastomosing with the circumflex branch of left coronary artery, branch to right atrium, right ventricle, marginal artery, and the posterior interventricular branch for both ventricle and posterior 1/3 of interventricular septa supplies the sinoatrial node, atrioventricular node, AV bundle, right bundle of AV bundle, including its Purkinje fibers. Left coronary artery, left posterior artery, sinus of ascending aorta, left between pulmonary trunk and left auricle, descends in atrioventricular groove on the left side, turns at left border to run in posterior part of the atrioventricular groove. It is called circumflex branch. Its circumflex branch ends by anastomosing with right coronary artery, left atrium, left ventricle, and anterior interventricular branch for both ventricles and anterior two-third. Branch left atrium, left ventricle, anterior interventricular branch for both ventricle and anterior two-third of interventricular septa. Anterior interventricular branch ends by anastomosing with posterior interventricular branch. Supplies the left branch of atrioventricular bundle, including its Purkinje fibers. 60% of the population is not supplied by right coronary artery, 40% circumflex artery, 3% dual supply. AV node is supplied by right coronary artery in 90%, circumflex in 10. Distribution যে posterior interventricular branch arises from right coronary artery, then right dominant coronary artery বলা হয়. The distribution pattern described for both right and left coronary arteries is the most common consist of right dominant coronary artery. The right coronary artery therefore supplies a large portion of the posterior wall of the left ventricle, and circumflex branch of the left coronary artery is relatively small. Posterior interventricular artery, branch of right coronary artery, cardiac dominance, found in the 90%. In 10%, right coronary rather small, not able to give posterior interventricular branch, in this case circumflex artery continuation of the left coronary. Provides posterior interventricular branch as well as AV node. Such cases are called left dominant. Mostly the right coronary give interventricular artery, such hearts are right, thus the artery giving the posterior interventricular branch is the dominant artery. Then left coronary artery arises from aortic anterior aortic sinus. Left coronary artery larger than right coronary artery arises from left posterior aortic sinus. আর হচ্ছে ব্রাঞ্চেস হচ্ছে রাইট coronary artery large branches, marginal posterior interventricular small branches, nodular 60% cases, right atrial infundibular terminal, right ventricular conus. Left coronary artery large branches, anterior interventricular branches to diaphragmatic surface of left ventricle, small branch left atrial pulmonary terminal. Area supplied by right coronary. Okay, right atrium, ventricle, greater part of right ventricle except the area adjoining the anterior interventricular group, small part of left ventricle adjoining the posterior interventricular group, interventricular septum, posterior part, whole of the conducting system of the heart except left branch of AV bundle. Is a note in 60% cases. Area supplied by left coronary artery, left atrium, ventricle, greater part of left ventricle except the area adjoining the posterior interventricular group, small part of right ventricle adjoining the anterior interventricular group, interventricular septum, anterior part, left branch of AV bundle, and is a note in 40% cases. Conduits: left internal thoracic mammary artery, gold standard for LED, long saphenous vein, short saphenous vein, right internal mammary artery, radial artery, cephalic vein, right gastrocnemic artery. Anterior interventricular artery, left ascending artery is the most commonly blocked. MI most commonly occurs at chest, whereas angina occurs on exertion. Venous: blood from artery, coronary sinus, arteriocardiac veins, and vena cordis minimi. It is the principal vein of the coronary sinus, principal vein of the heart. Most of the venous blood from the wall of the heart drain into the right atrium to coronary sinus. Coronary sinus, largest vein of the heart, lies at the posterior part of the atrioventricular group. Left posterior coronary sulcus develop from left horn of sinus venosus and part of left common cardiac vein. Coronary sinus, largest vein of the heart. Most of the vein draining heart draining the coronary. Heart draining the coronary, which is situated in left posterior coronary sulcus, about 3 cm long, ends by opening into posterior wall of right atrium. Opening is guarded by semilunar valve, which is known as valve of coronary sinus. Development area of drainage and tributaries. Tributaries: great cardiac vein, middle cardiac vein, small cardiac vein. oblique vein of left atrium, Marshall posterior vein of left ventricle, right marginal vein, anterior cardiac vein, vena cordis minimi. The first 6 veins open into coronary sinus, last 2 open directly into right atrium. আচ্ছা, right atrium, rough anterior part, primitive atrium, atrial chamber proper, smooth posterior part, right horn of sinus venosus, left atrium, rough part, primitive atrium, atrial chamber proper, smooth part, absorption of pulmonary vein, right ventricle, rough part, primitive ventricle, BT chordacia, proximal portion of bulbous cordis, smooth part, bulbous cordis, mid portion বা conus cordis, left ventricle, rough part, primitive ventricle, smooth part, bulbous cordis, mid portion বা conus cordis, interatrial septum, septum primum fossa ovalis and septum secundum limbus fossa ovalis, interventricular septum, muscular part, fusion of medial wall of expanding ventricle, membranous part, outgrowth of tissue from inferior endocardiac AV cushion, right corner swelling, left corner swelling, membranous part not only separate to ventricle but also separate right atrium and left ventricle, ascending aorta, pulmonary trunk, truncus arteriosus, neurocrest, turbidity or distal part of bulbous cordis from ascending aorta and pulmonary trunk is separated by spiral septum. Sinus venosus is only dilatation that does not become subdivided by septum. Circulation of fetus. Most of the oxygenated blood from placenta, about 80% of saturated with oxygen reaching the heart via umbilical vein and inferior vena cava, diverted toward the foramen ovale, pumped out the aorta to the head, while deoxygenated blood returned via superior vena cava is most commonly pumped through the pulmonary artery and ductus arteriosus to the feet and the umbilical arteries. After birth, eustachian of valve rudimentary. Change after birth. Closure of right and left umbilical artery. Remnant medial umbilical ligament. Closure of umbilical vein. Remnant ligamentum teres lever. Closure of ductus venosus. Remnant ligamentum venosum. Closure of foramen ovale. Remnant fossa ovalis. Closure of ductus arteriosus. Remnant ligamentum arteriosum. Congenital anomaly. ASD, VSD, PDA, right to left shunt হচ্ছে cyanotic, phallosteatology, ventricular septal defect, overrating of aorta, pulmonary stenosis, right ventricle hypertrophy. Phallosteatology, because there is a right to left shunt across VSD, there is usually cyanosis at earliest degree of cyanosis depends mainly on severity of pulmonary outflow obstruction. Patent ductus arteriosus, pulmonary trunk connected to arch of aorta, does just distal to the origin of left subclavian and artery by short wide channel called ductus arteriosus. Normally after birth, close functionally within a week, anatomically within 4 to 12 weeks. Obliterated ductus arteriosus is called ligamentum arteriosum. Non-obliterated ductus arteriosus is called patent ductus arteriosum. SAS. Coarctation aorta. Male female 2:1, collateral or internal thoracic artery. Isthmus of aorta, slight constriction of the aorta immediately distal to the left subclavian artery at the point of attachment of ductus arteriosus. Usual site of coarctation of aorta, perianeurysm, bicuspid aorta valve and coarctation of aorta are recognized. Associated with notching of ribs, hypertension in upper extremity, weak pulse in lower extremity, X-ray posterior aortic dilatation of aorta result in classic figure 3 sign. अच्छा, chest X-ray reveal 3 sign: upper arm dilated, left subclavian, middle arm coarctation site, lower arm dilated, descending thoracic aorta. MRA is diagnostic. Pre-ductal, ductal and post-ductal. Clinical examination: pulses may demonstrate a radiofemoral delay and murmur that is continuous in heartbeat, heart based over the thoracic spine below the left clavicle. Chest classically demonstrate rib notching because of dilated posterior intercostal vessel. The heart is usually normal size as the older child. Shows a classical tree representing typical aortic knuckle. अच्छा, descending thoracic aorta branches 9. Posterior intercostal artery on each side from 3rd to 11th intercostal space. Subcostal artery to left bronchial artery, esophageal branch, pericardial, mediastinal, superior phrenic. Subclavian artery branch, very important. Repeated question है. Vitamin C, D. अच्छा, first part থেকে from which origin to the middle border of scalene anterior. Vertebral artery forming the basal artery and joining the circle of Willis. Internal thoracic artery, mammary artery. Anterior intercostal branches perforating vessel to breast, terminating in superior epigastric artery. Musculophrenic artery. Thyrocervical trunk, inferior যেখান থেকে আসে inferior thyroid artery, suprascapular artery and transverse cervical artery. সেকেন্ড পার্ট behind scalenus anterior, এখান থেকে আসে costocervical trunk, এটা splits into superior intercostal and deep cervical artery. থার্ড পার্ট আপ টু আউটার বর্ডার অফ ফার্স্ট রিব, এখান থেকে আসে dorsal scapular artery from either, এখান থেকে আসে from either second or third part, passes backward to supply levator scapula and rhomboids. Outer border of first part থেকে axillary artery. ওকে, আচ্ছা, in left side there these three artery costocervical trunk are branches of first part of subclavian artery. Costocervical trunk arises from second part of subclavian artery on right side and from the first part of left side. Superior vena cava, area of drainage upper heart of the vena body, development extra pericardial part developed from right anterior cardinal vein, intracardial part developed from right common cardinal vein. Clinical importance: using superior vena cava to access inferior vena cava, because the superior and inferior vena cava oriented along same vertical axis, guide wire catheter line can be placed from superior vena cava through the right atrium into the inferior vena cava. This common route of access for such procedure: transtubular liver biopsy, transtubular intrahepatic portosystemic shunt, tips, and insertion of an inferior vena cava filter to catch emboli. It is lost from vein in the lower limb and pelvis, যেমন patient with deep vein thrombosis. Thymus, lymphoepithelial organ in the superior anterior mediastinum, extending as far as inferiorly as the fourth costal cartilage, as it is blood supply, produces growth factor and stimulates proliferation and differentiation of T lymphocyte. Development: third pharyngeal arch reduced in size with age. Epithelium from endoderm of ventral part of the third pharyngeal pouch. Connective tissue from surrounding mesoderm. Vascular thymic branch originating from internal thoracic, inferior, and sometimes superior thyroid. Histological structure: thymus consists of two lobes covering by connective tissue. Capsule which divides the lobe into numerous lobules. Each of the thymic lobule has outer cortex in a medulla. Thymic has corpuscle present in medulla, which is spherical lamellated aggregation of flatter cell, and characteristics of this region: large number of epithelial reticular cell, mature T cell present in medulla. Cortex and loosely packed lymphocyte, thymocyte, epithelial reticular cell, few macrophages. Most T lymphocytes develop in the cortex of thymus gland. Immune competent T lymphocyte, helper T lymphocyte, cytotoxic T lymphocyte. Thymectomy in infant is fatal. If the thymus gland is removed from newborn, the lymphoid organ will not receive the immunocompetent T lymphocyte. Significant valve will not acquire immunological competence to fight pathogen. Esophageal constriction at the beginning of pharyngoesophageal junction. আচ্ছা, C6, T4, T6, T10 at the beginning of pharyngoesophageal junction, cervical constriction. C6 is the narrowest, distant from upper incisor teeth 6 ইঞ্চি 15 cm. At crossing of the arch of aorta, aortic constriction. T4 9 ইঞ্চি 22 cm. Crossing of the left principal buncus, bronchial constriction. T6 11 inches 27 cm. Opening of diaphragmatic constriction. T10 15 ইঞ্চি 40 cm. Thoracic duct. Phrenic nerve formation formed by the ventral terminal, third, fourth, and fifth cervical nerve. Course beneath the prevertebral fascia, lateral border of scalene anterior muscle, intervene between the subclavian artery, vein in front of lungs root, laterally in contact with mediastinal pleura, right venous course, left arterial course. Greater splanchnic nerve formed by the medial branch of fifth থেকে ninth thoracic ganglia of sympathetic trunk, pierce the crus of diaphragm, join with celiac flexure, some fibers reach the suprarenal medulla. Lesser 10-11 thoracic ganglia, pierce the crus, ends in aortic renal ganglia. Least 12 passes with sympathetic trunk, behind medial arcade ligament, ends in renal ganglia. Course and relation: descends in front of the neck of the first rib, lead to second থেকে 10 rib along the bodies of T11 থেকে T12 vertebra in front of posterior intercostal nerve and vessel, passes behind the medial arcade ligament to become continuous with the lumbar sympathetic trunk. Breast. Thoracic duct drains all the body except right upper limb and right half of the body above diaphragm, drained by right lymphatic tract. Pitted appearance, with the presence of many valves and its lumen extend to the upper end of cisterna to posterior abdominal wall at the lower border of T12 vertebra through the junction of left internal jugular, left subclavian vein at the root of the neck. Measurement of the thoracic duct wide 5 mm, ends but narrow at the middle, 38 থেকে 45 cm. Situation at the superior posterior mediastinum. Formation, course and termination. Duct begins in the abdomen at the lower border of T12 vertebra as a continuation of cisterna chyli from the bodies of L1 and L2, enters the thorax through aortic opening or diaphragm. It then ascends at the posterior mediastinum to the right at the midline on the front of the vertebral body. On reaching there, T5 vertebra crosses midline from right to left side. T5A enters the superior mediastinum to run along the left border esophagus and reaches the root of the neck. Root of the neck arches laterally at the level of C7 vertebra in front of the vertebral system, vertebral artery, vertebral vein, left cervical, lymphatic trunk, and behind the carotid system, left common carotid artery, left internal jugular vein, left vagus nerve. Summit of arch has 3 to 4 cm above clavicle. Finally, the duct descends in front of the first part of the subclavian artery. Finally, terminates by opening into the junction of the left subclavian and left internal jugular vein. Area of drainage. It receives a lymph from both half of the body below the diaphragm and left half above the diaphragm. Tributaries. Pair of descending lymph trunk, pair of ascending lymph trunk, left jugular lymph trunk, left subclavian lymph trunk, left block of mediastinal lymph trunk, right and left lymph trunk, intestinal lymph trunk, external internal lymph iliac lymph trunk. Thoracic duct drains from the whole of the body except the right upper quadrant of the body, which is drained by the right lymphatic duct. Relation of the thoracic duct is as follows. Aortic orifice of the diaphragm, anterior median arcuate ligament of the diaphragm, posterior T12 vertebra, right azygos, left aorta, posterior anterior diaphragm, descending aorta, lower part esophagus, upper part posterior vertebral column, anterior longitudinal ligament, terminal part of hemiazygos and hemiazygos and hemiazygos vein. Okay, right posterior intercostal artery, right azygos, so to the left descending thoracic aorta. In superior mediastinum, anterior arch of aorta, commencement of left subclavian artery, posterior vertebral column to the right edge of esophagus to the left lung and pleura. In the root of the neck, carotid sheath containing left common carotid artery, left internal jugular vein, left vagus nerve. Posterior vertebral artery and veins following anterior muscle phrenic nerve, thyrocervical trunk and branches. Oh fuck. Lymphatic drainage of the breast. Lymphatic drainage. Level 1, those below the muscle lower groove. Level 2, those behind the muscle are the middle groove, and level 3, those lying in between the upper border pectoralis and the lower border of clavicle, upper or apical node. Lymphatic drainage of the breast. Anterior 75 into axillary groove, anterior groove, pectoral, external memory, along lateral thoracic vessel, main drainage node, central আর হচ্ছে posterior group, subscapular, lateral apical and interpectoral node, rotator node. 20% drainage into intermedullary lymph node, main from middle half of the breast, second, third, fourth, intercostal. Drainage from contralateral axial opposite lymph node also occur. Internal memory nodes are fewer in number. 5% posterior intercostal lymph node. Posterior lateral roots are rarely involved in carcinoma breast by retrograde spread. Lymphatic vessel. Superior lymphatic drains the skin over the breast except for the nipple and areola. Lymphatic drains the parenchyma of the breast. They also drain the nipple and areola. The direction of the lymph. Downline lymphatic drainage of the vessel derived from the double network. Breast lymphatic drains branch extensively and do not contain valves. Lymphatic from the breast ultimately terminate in the thoracic drain and subsequently left subclavian vein on the right, ultimately right subclavian vein near its junction with the internal jugular vein. Sentinel node defined as the first node. In case of carcinoma breast, restricted to level node, better prognosis, 2 poor prognosis, 3 worse prognosis. Lymphatic blockage through tumor occlusion may therefore reverse blood flow through the lymphatic channels. Most of the lymphatic drain in the axillary group regional lymph node either directly or through the retroareolar lymphatic plexus. Dermal lymphatic also penetrate pectoralis major to join channels that drains the deeper parenchymal tissues and then follow the vascular channel to dominate in the subclavicular lymph node. Applied anatomy. Obstruction of superficial vessel by cancer cell may produce edema of the skin, giving rise to peau d'orange. Because of communicants of the superficial lymphatic of the breast across the midline, cancer may spread to one breast to another. Because of communicants of the lymphatic vessel with those of the abdomen, cancer breast may spread to liver. Cancer cell may drop into pelvis and produce secondary deposit on the surface of the ovary, form and cook and bug tumor. Incision in the breast. Incisions in the breast usually made radially to avoid cutting lactiferous duct. Breast cancer can spread to the vertebra by venous route because the veins draining the breast communicate with the vertebral venous textures of vein. During mastectomy, following damage, long thoracic nerve, axillary breast resection, paralysis, sedge anterior, muscle producing winging of scapula. After latissimus muscle damage, affects extension, medial rotation, adduction of the humerus. Blood supply to the breast. Perforating cutaneous branches of internal mammary thoracic artery, 60% lateral thoracic artery from second part of the axillary artery. Also, acromiothoracic artery, superior thoracic artery, branch of axillary artery, lateral branches 2, 3, 4, posterior intercostal arteries, vein, superficial vein into internal thoracic vein and into superficial veins of the lower part of the neck, deep veins into internal thoracic and axillary and posterior intercostal vein. Nipple areolar complex. Erectile structure points outwards. 12 থেকে 15 lactiferous duct is duct independently opens into the nipple. Sensory nerve supply contain modified sweat gland and sebaceous nipple is supplied for the intercostal nerve. Areola circular pigmented area contain involuntary muscle arranged in concentric ring as well as radially subcutaneous tissue contain numerous sweat gland, sebaceous gland later which enlarge during pregnancy after lubricate the nipple during lactation. Montgomery tubercle secrete oily lubricant to nipple and areola region. Modified sebaceous gland which enlarge during pregnancy and lactation as areola nipple do not contain hair and fat beneath. Secretory apparatus of breast. Large duct site of duct papillum and duct ectasia. Distal smaller ducts at the site of fibroadenoma during development of the breast cyst formation, sclerosing adenosis during involution of period, estrogen, ductal proliferation, progesterone, glandular proliferation, prolactin, milk secretion. Mammary bed pectoris major serratus anterior external oblique. Topography. Vertically extend from the second to the 6th mid-clavicular line. Lies over pectoris major serratus anterior external oblique muscle. Horizontally from side to the sternum to mid-axillary line. Anatomy. Breast. Modified sweat gland. Lactation under influence of estrogen, progesterone or prolactin. Axillary tail. Third rib of axilla, interaxillar fossa, foramen and langur. Comes in contact with anterior group of axillary lymph node. Axillary tail enlarged may be mistaken as lipoma. Axillary tail may perforate deep fossa extended first superiorly as the apex of axilla. Histological. Lobule is basic structure unit of mammary gland. Number and size of the lobule may vary enormously. They are most numerous in young women, 10 to over 100 ovules. Lobule are empty via ductile into a lactiferous duct. 15 থেকে 20 pyramidal lobe is being drained by separate 15 থেকে 20 lactiferous duct. Each lobe contain alveolar lactiferous lactiferous duct 2 থেকে 4 mm in diameter. Nearest termination each duct has a dilatation called a lactiferous sinus ampulla. Alveolar epithelium cubital in resting phase and columnar during lactation. Lactiferous duct striated columnar squamous epithelium. Lactiferous duct converted to sinus. Lactiferous sinus ampulla and lactiferous sinus converted to areola. Ligation of Cooper are ligament of Cooper, hollow conical projection of fibrous tissue filled with breast tissue. Pieces of the cone are attached firmly to the superficial fascia, thereby to the skin overlying the breast. Carcinoma breast creates tension of this ligament, causing pitting deeply of the skin. Myepithelial cell lie between epithelium basement membrane from the alveolar to the duct. Stroma. It forms the supporting framework of the gland. It is partly fibrous, partly fatty. DCI is ductal. X-ray. LA is X-ray for calciation, and LCI is lobular. Most important structure of a pectoral region in a female breast. Largest muscle of pectoral region, pectoralis major. Key muscle of pectoral region, pectoralis minor. Most lymph drain, axillary node of lymph node. Subareolar plexus of Seppi. Plexus of lymph vessel deep to the areola. Drains into anterior axillary group node, lymph node. Rotas lymph node, interpectoral lymph node. Most common site of breast cancer, upper and outer. Main artery supplied the breast, lateral thoracic artery. Development of breast is modified sweat gland, mammary gland, and apocrine type epithelial lining of the duct acini of the breast developed from ectoderm. Supporting tissue derived from the mesenchyme to milk crease, thickened band of ectoderm on its side extend obliquely from the axilla to inguinal region. In human, whole of the region atrophies except only a small portion in its pectoral line, from which breast, whereas accessory breast tissue will form along the course of milk reach. If it does not appear outside the area where breast normally derives. Triple assessment, clinical assessment, radiological tissue sampling, cytology, histopositive predictive value of this combination should exceed 99.9. Mammography for screening, it is done after 40 years. যদি আগে করা হয়, যদি ফ্যামিলি হিস্ট্রি থাকে। Mammography before 35 is not usually done. Suspicious lump বা strong family history থাকলে থাকে। Ultrasound particularly in young women. আচ্ছা, magnetic to distinguish scar from recurrence in women who have previous breast conservation therapy was cancer, assess multifocality, multicentricity for lobular cancer, assess extent of high-grade ductal carcinoma in situ. Less useful in low-grade DCIS, breast imaging modality for breast women with implants, screening tool for high-risk women. FNAC histology specimen taken by core biopsy allows a definitive pre-operative diagnosis. Differentiate between DCIS and invasive disease also allows the tumor stain for receptor status important before commencing neoadjuvant therapy. আচ্ছা, least invasive technique হচ্ছে FNAC obtaining cellular diagnosis, rapid, accurate operator cytology experience, histological specimen taken by core biopsy allows a definitive priority diagnosis. Trigeminal nerve, cranial nerve 5, mixed motor sensory. আচ্ছা, muscle of mastication, temporal, masseter, medial, lateral, pterygoid, mylohyoid, anterior belly of digastric, tensor palatini, tensor tympani, class ATM. NTM kita. Okay, skeleton, maxillary process, tree maxilla, maxilla zygomatic part of temporal bone, mandibular process, and mandibular ligament, lingula of mandible, macal cartilage, malleus incus, anterior ligament of malleus, quadrate cartilage, artery, fast aortic arch, persist as a maxillary artery, second arch, hyoid arch, facial nerve, cranial number 7, muscle of the facial expression, vaccinator ocularis, frontalis, serratus, orbicularis, oculi, orbicularis, oris, posterior belly of digastric, styloid, stapedius, skeleton, stapes, styloid process, styloid ligament, lesser horn, and upper portion of body of hyoid bone, second aortic arch, stapedial artery from dorsal parts, third arch, cossopharyngeal nerve, cranial nerve 9, stylopharyngeus, greater horn, lower portion of the hyoid bone, third aortic nerves, ventral part of CCA, dorsal part, stem of ICA, fourth arch, external laryngeal division of superior laryngeal branch of vagus nerve, cranial nerve 10, muscle cricothyroid, levator palatine, constrictor of pharynx except stylopharyngeus, আর হচ্ছে fourth aortic arch, right proximal part of right subclavian artery, left part of arch of aorta, sixth arch হচ্ছে recurrent laryngeal branch of vagus nerve, cranial nerve 10, intrinsic muscle of larynx except cricothyroid. আচ্ছা, skeleton both fourth and sixth arch হচ্ছে laryngeal cartilage, thyroid cartilage, fourth arch mainly cricoid cartilage, arytenoid at corniculate and cuneiform, আর sixth aortic arch, right ventricle, right pulmonary artery, right dorsal DCBS, left ventricle, left pulmonary artery, left dorsal ductus arteriosus. Derivative of pulses, first pass middle ear cavity, auditory tube, endodermal lining of tympanic membrane, second pass palatine tonsil, third pass inferior parathyroid gland, parathyroid 3 and thymus, fourth pass superior parathyroid gland, parathyroid 4 lateral thyroid element, fifth pass ultimo bronchial body which later form the parafollicular or C cell or clear cell of thyroid gland. আচ্ছা, superior mediastinum, inferior parathyroid. Scalp or skin, a thick and hairy connective tissue, more fibrous and dense in the center than at the periphery of the head. It provides the proper medium for passage of vessels and after the skin. Epineuritis, epicranial epineuritis, gallia epineuritica, deep fascia of occipitofrontalis muscle, loose areolar tissue, immediately vein থাকে এতে, dangerous layer আর safety layer দুইটা এটা, pericranium loosely attached to the bone but firmly attached to the suture. Clinical importance of scalp is a common site of sebaceous cyst because of abundance of sebaceous gland, blood supply reach, avulsed portion need not to be cut away, they can be replaced with in position and stitched. They usually take up and heal well. Wounds of the scalp bleed profusely because the blood vessels are prevented from retracting by the fibrous fascia. Bleeding can be arrested by applying pressure against the bone because of the density of the fascia. Subcutaneous hemorrhage are never extensive. Inflammation of the fascial layer cause later swelling but much pain. The layers of loose areolar tissue is known as danger area of the scalp because the emissary vein which open here may transit infection from scalp to the cananeous venous sinuses. Collection of blood in the layer of loose connective tissue causes কই রে Collection of blood in the layer of loose connective tissue causes generalized swelling of the scalp. The blood may extend anteriorly into the root of the nose into the eyelid, causing black eye. Wound of the scalp do not gape unless the epicranial appendage is divided transversely because the pericardium adherent to surface collection of fluid due to the pericardium known as cephal lematopa take the shape of the bone concerned. Nerve in front of auricle, superior supratrochlear, sensory nerve, supratrochlear branch of frontal ophthalmic division of trigeminal nerve, supraorbital branch of frontal ophthalmic division of trigeminal nerve, zygomatico-temporal branch of zygomatic nerve, maxillary division of trigeminal nerve, auriculotemporal branch of mandibular division of trigeminal nerve, motor temporal branch of facial nerve. Behind the auricle, posterior division of greater auricular nerve C2 C3 from cervical plexus, lesser occipital nerve C2 from cervical plexus, greater occipital nerve C2 dorsal ramus, third occipital nerve C3 dorsal ramus, motor posterior auricular branch of facial nerve. Fifty-one plate of ethmoid olfactory nerve filament আসে optic canal থেকে optic second cranial nerve with meningeal sheath, ophthalmic artery branch of internal carotid artery with sympathetic plexus of nerve, foramen rotundum maxillary nerve branch of trigeminal nerve আসে foramina ovale mandibular nerve branch of trigeminal fifth cranial nerve, accessory meningeal artery branch of maxillary artery, laser superficial petrosal nerve, emissory vein from cavernous sinus to pterygoid plexus of vein, mnemonic male, foramen spinous middle meningeal artery branch of maxillary artery, nerve sinusus meningeal branch of mandibular division of trigeminal nerve. Superior orbital fissure, oblique rough triangular space bounded by lesser wing above the greater wing below and body of standard medially in life and in fresh specimen. It is divided into thick compartment by attachment continuous string lateral to medial border of orbital surface of greater wing medially to orbital walls to closing. Structure above lateral to continuous string from cranial cavity to orbit trochlear nerve. Fourth, frontal nerve and lacrimal nerve, branches of ophthalmic division of trigeminal nerve, orbital branch of middle meningeal artery, lacrimal artery from orbit to cranial cavity, superior ophthalmic vein below frontal nerve, recurrent meningeal branch of lacrimal artery. Structure within from cranial cavity to orbit, superior and inferior divisions of oculomotor, third cranial nerve, nasociliary nerve, branch of ophthalmic division of trigeminal nerve, lies between two divisions of oculomotor nerve, abducent sixth cranial nerve, lies inferior medial to nasociliary nerve. Structure below from orbit to cranial cavity, inferior ophthalmic vein, internal auditory meatus কোত্থেকে আসে এর কন্টেন্ট কি ফেশিয়াল নার্ভ, সিভিল ক্রেনিয়াল নার্ভ, মোটর সেন্সরি রুট, কক্লিয়ার নার্ভ, এইট ক্রেনিয়াল নার্ভ, ভেসিকুলার নার্ভ, ইন্টারনাল অডিটরি, লেবিরেন্থাইন আর্টারি, ব্রাঞ্চ অফ বেসিলার আর্টারি. Structure passing through jugular foramen. Anterior part, middle part, posterior part, anterior, inferior, petrosal sinus, meningeal branch of ascending meningeal artery, middle part, 9, 10, 11, cranial nerve, posterior part, internal jugular vein, meningeal part of occipital artery, foramen magnum, licensed squamous part of occipital bone, largest foramen skull bounded by the basilar part in the front, squamous part behind, condylar part of either side, divided incompletely into two compartments by the alar ligament and attached to the tubercle on the middle part of the occipital condyle. Transmit anterior transmit কি করবে all structure pass from below upper apical ligament, upper band of cruciate ligament, membrane tectoria, continuation of posterior longitudinal ligament of vertebra, posterior larger compartment structure passing from upward downward, lower end of middle oblongata within meninges, one anterior, two posterior spinal arteries in the subarachnoid space, vein joining venous plexus of middle oblongata with vertebral venous plexus of veins in subarachnoid space, lower part of tonsil of cerebellum may also project on each side of the middle oblongata. Structure passing from below upward vertebral arteries of right and left, plexus of sympathetic nerve along the vertebral arteries from inferior cervical ganglion, spinal root of accessory nerve, anterior margin of foramen gives attachment to anterior atlanto-occipital membrane, the posterior margin to posterior atlanto-occipital membrane. Pterygopalatine fossa, pterygopalatine ganglions, stylomastoid foramen, facial nerve, stylomastoid branch of posterior auricular artery. Boundary of orbit, upore frontal bone, lesser wing of sphenoid, flore, maxilla and zygomatic palatine, lateral zygomatic greater wing of sphenoid, medial frontal process of maxilla, lacrimal bone, orbital plate of ethmoid, body of sphenoid. Content eyeball, anterior one third of the orbit, fascia orbital and bulbar, muscle extra ocular vessels, ophthalmic artery, superior inferior ophthalmic vein and lymphatic nerve, optic, oculomotor, trochlear, abducens, branch of ophthalmic and maxillary nerve, and sympathetic nerve, lacrimal gland, orbital fat. Extraocular muscles are as follows: voluntary mesentery muscle, 4 rective, superior 4টা rective, 2টা oblique, levator palpebris, superiority elevates the upper eyelid, involuntary muscle, superior tarsal muscle, deeper portion of levator palpebris, superiority elevates the eyelid, inferior tarsal possibly depress the lower eyelid, orbitalis bridges inferior orbital fossa, its action uncertain. Nerve supply L6 SO4 আর বাকিগুলো extraocular muscle, superior, inferior, middle rective, inferior oblique, part of levator palpebris, superior are all supplied by the oculomotor nerve. টেরিকোপ্যালেটাইন ফোসাতে টেরিকোপ্যালেটাইন গ্যাংলিয়ন থাকে। আচ্ছা, পেড ভেনাস ক্যাভার্নাস, সুপিরিয়র পেট্রোজাল, ইনফিরিয়র পেট্রোজাল, ট্রান্সভার্স সিগময়েড, স্ফেনোপ্যারাটাল, পেট্রোসকোমাস, মিডল মেনিঞ্জিয়াল ভেইন। আর আচ্ছা, উপরে সবগুলো সাইনাস অ্যান্ড লাস্টে একটা মিডল মেনিঞ্জিয়াল ভেইন আনপেয়ার্ড। সুপিরিয়র স্যাজিটাল সাইনাস, ইনফিরিয়র স্যাজিটাল সাইনাস, স্ট্রেট সাইনাস, অক্সিপিটাল সাইনাস, অ্যান্টেরিয়র ইন্টার ক্যাভার্নাস সাইনাস, পোস্টেরিয়র ইন্টার ক্যাভার্নাস সাইনাস, বেজিলার ব্যাকসাইড অফ ভেইন। আচ্ছা, অপথ্যালমিক ডিভিশন অফ ট্রাইজেমিনাল নার্ভ, মেক্সিলারি ডিভিশন অফ ক্যাভার্নাস সাইনাস। আচ্ছা, structures in the lateral wall of sinus, axillary division of 5 nerve, oculomotor nerve, trochlear nerve, trigeminal ganglion, ophthalmic division of 5 nerve. V3 থাকে না, mandibular branch থাকবে না, 3 4 V1 V2 not V3। আর মিডিয়াল ওয়ালে ICA অ্যান্ড মানে ইন্টারনাল ক্যারোটিড আর্টারি আর হচ্ছে অ্যাবডুসেন নার্ভ থাকবে, ইনফেরিয়র ল্যাটারালটা ICA। আচ্ছা, ইন্টারনাল ক্যারোটিড আর্টারির আশেপাশে ভেনাস অ্যান্ড সিম্প্যাথেটিক প্লেক্সাস থাকবে। It's a small endocrine gland. আচ্ছা, roof formed by diaphragm or shell, floor by 2 layers of durameter on which bone sphenoid, shape হচ্ছে ওভাল। ওয়েট হচ্ছে 500 মিলিগ্রাম, লেন্থ 12 থেকে 16। আচ্ছা, অ্যাডেনো হাইপোফাইসিস, সেন্ট্রিয়াল লুপ, পার্স সেন্ট্রিয়াল, পার্স ডিস্টালিস, পার্স গ্ল্যান্ডুলারিস, নিউরো হাইপোফাইসিস, পোস্টেরিয়র লোব, পার্স পোস্টেরিয়র নিউরাল লোব, ইনফান্টিবুলার স্টেম, মিডিয়ান এমিনেন্স। আর হচ্ছে অ্যান্টিরিয়র হাইপোফাইসিসে ইন্টারমিডিয়েট লোব, পার্স ইন্টারমিডিয়েট, টিউবারাল লোব, পার্স টিউবারালিস। হিস্টোলজিক্যাল স্ট্রাকচার আচ্ছা গেল। ফেশিয়াল নার্ভ, facial nerve supplies muscles of the face, scalp, auricle, gives secretomotor to mandibular, lingual, sublingual, lacrimal, nasal, palatal, pharyngeal gland, including those in the tongue, in the floor of the mouth, even the taste from most of anterior 2/3 of the tongue, except from the valid papilla is carried by facial nerve. Since it is too much for the facial nerve, it does not supply skin of the face. This is innervated by trigeminal nerve. To maintain contact with trigeminal nerve, the facial nucleus come close to the trigeminal nerve nucleus. The nucleus of the facial nerve can act reflexively in response to sensory impulses from the face. Facial injury can causes very typical symptoms. Infranuclear lesions এ হচ্ছে Bell's palsy. Supranuclear lesion এ lower part of the face is paralyzed. Parasympathetic sphenopalatine, largest ganglion, pterygopalatine or upper noun sphenopalatine. It is called the ganglion of hay fever because it stimulated running nose and running nose and eyes. Otics হচ্ছে smallest and largest হচ্ছে pterygopalatine. এবার হচ্ছে কানেকশন, গ্যাংলিয়া সাবমেন্ডিবুলারি ফাংশনালি কানেক্টেড টু ক্রেনিয়াল 7 ফেশিয়াল অ্যান্ড কর্ডোটিম্পানি নার্ভ, সেন্সরি রুট, 2 ব্রাঞ্চেস ফ্রম লিঙ্গুয়াল নার্ভ। Sympathetic root branch from plexus from around the facial artery, secretomotor root, parasympathetic root, superior salivatory nucleus, facial nerve, chordotympani joins lingual nerve, distribution submandibular, sublingual, anterior lingual glands. Pterygopalatine functionally need connected to Shanti. Cranial 7, greater petrosal nerve, branch of facial nerve, 2 branches from maxillary nerve, sympathetic root, deep petrosal from plexus around internal carotid artery, secretomotor root, superior salivatory nucleus, lacrimotory muscle, nervous intermedius, facial nerve, genicular ganglion, greater petrosal nerve, plus deep petrosal nerve, nerve of pterygoid canal, distribution mucous gland of nose, paranasal, sinuses, palate, nasopharynx, some fiber pass through zygomatic nerve, zygotemporal nerve, communicating branch to lacrimal nerve, lacrimal gland. Otic functionally connect to cranial 9, glossopharyngeal nerve, branch from auriculotemporal nerve, sensory supply. আর তারপর হচ্ছে plexus along middle meningeal artery, inferior salivatory nucleus, glossopharyngeal nerve, tympanic branch, tympanic plexus, lesser petrosal nerve, branch from nerve to medial pterygoid, secretomotor to parotid gland. আচ্ছা, মোটর রুট যাবে ব্রাঞ্চ ফ্রম নার্ভ টু মিডিয়াল টেরিগয়েড, secretomotor to parotid gland via auriculotemporal nerve, tensor palatini and tensor tympani via nerve to medial pterygoid, unrelated. Ciliary functionally connected to cranial third oculomotor nerve from nasociliary, sensory হচ্ছে from nasociliary, then sympathetic to plexus along ophthalmic artery, then secretomotor root parasympathetic to Derringer vestral nucleus oculomotor nerve to inferior oblique, আর হচ্ছে distribution ciliary muscle sphincter visually. আচ্ছা, parotid gland, largest salivary gland, weighs about 15 gram. It's situated below the external acoustic meatus between the ramus of mandible and sternocleidomastoid. The gland overlaps this structure anteriorly. The gland also overlaps the masseter muscle. Part of it is forward extension is often detached, is known as the accessory parotid, lies between zygomatic arch and okay. It anteromedial surface of masseter, lateral surface of the temporomandibular joint, posterior border of ramus of mandible, medial pterygoid, emerging branch of facial nerve. Posterior medially হচ্ছে mastoid process with the sternocleidomastoid, posterior belly of the digastric. The styloid process is structure attached to the external carotid artery, enters the gland through this surface, and internal carotid lies deep to the styloid process. আচ্ছা, তাহলে medially masseter, medial pterygoid and ramus of mandible. আচ্ছা, parotid ductus tension হচ্ছে crown of upper second molar tooth. What is the anterior border of the crown, forward slightly downward on the crown or upper second molar tooth. Masseter aerator relation, okay. Parotid gland, medially internal carotid artery, styloid process and internal jugular vein are substances vitore, superficial to deep, facial nerve and branches, retromandibular vein and external carotid artery. So injury হওয়ার chances সবচেয়ে বেশি হচ্ছে facial nerve, আর হচ্ছে আর medially থাকবে styloid process with attached muscle, internal carotid artery, internal jugular vein and incomplete with, okay. Structure within the parotid gland with their relative position. Artery, artery enters the gland, external carotid artery enters the gland through posterior medial border. Artery emerges from the gland, maxillary artery, transverse facial artery, superficial temporal, posterior auricular veins হচ্ছে retromandibular vein within the gland by union of superficial temporal and maxillary. Nerve হচ্ছে facial nerve enters the gland through its posterior medial surface within the gland, divides into 5 terminal branch which leaves the gland through its anterior medial surface, parotid lymph node. Nerve supply, parasympathetic nerves are secretomotor, reach the gland through auriculotemporal nerve. The preganglionic fibers begin with inferior salivary gland, pass through the glossopharyngeal nerve, tympanic branch, the tympanic plexus, lesser petrosal nerve, relay in the aortic ganglion. The postganglionic fiber pass through the auriculotemporal nerve and reach the gland. Sympathetic nerves are vasomotor, derived from the plexus around the external carotid artery. Sensory nerve gland comes from the auriculotemporal nerve, but the parotid fascia innervated by the sensory fibers of the greater auricular nerve. Sympathetic first drain to parotid node and then as a lymphatic drains first to parotid, then to upper cervical. Development of parotid gland. Gland proper duct, alveoli, surface ectoderm, capsule, mesenchyme, stroma, mesenchyme. Clinical anatomy, Freiss syndrome. Auricular regeneration of secretomotor fiber of auriculotemporal nerve join the greater auricular nerve. This causes stimulation of sweat glands and hyperemia in this distribution, producing redness, swelling in the area supplied by the nerve. Freiss syndrome. যখনই চিউ করে then increase sweating in the region is supplied by auriculotemporal nerve. Auriculotemporal syndrome, area supplied by the nerve and external auditory meatus, lateral surface of tympanic membrane and the skin of the temporal region. As a submandibular superficial part, and deep part. Superficial part and deep part এটা হচ্ছে এটা separated হয় J shape mylohyoid দিয়ে. This part of fills the digastric triangle is extend upward deep to the mandible up to the mylohyoid, anterior, lateral and medial surface. Gland is partially enclosed between two layers of deep cervical fascia. Superficial fascia covers the inferior surface of the gland attached to base of mandible. Deep layer covers the medial surface of the gland attached to the mylohyoid line of mandible. Deep part, this part is small in size. It lies deep to the mylohyoid, superficial to hypoglossus and styloglossus. Hyoglossus and styloglossus posteriorly continuous the superficial part of the round the posterior border of mylohyoid, anteriorly extend up to the posterior endo sublingual gland. Submandibular duct of Orthon. Thin walled, about 5 cm long, emerges anteriorly. The default runs forward hypoglossal between lingual and hypoglossal nerve. Anterior border of the hypoglossal ductus crossed by lingual nerve opens in the floor of the mouth on the summit of the sublingual papilla at the site of frenulum of the tongue. আচ্ছা, এখানে হচ্ছে সাইলিডেনাইটিস বা স্টোন ইজ ভেরি কমন বিকজ অ্যান্টি গ্র্যাভিটি এটা ডিরেকশন যায়. ব্লাড সাপ্লাই, ফেশিয়াল আর্টারি, ভেইন কমন ইন্টু দ্য লিঙ্গুয়াল facial or lingual vein, the lymph passes to submandibular lymph node to jugular digastric lymph node. Suprasalivary nucleus, nervus intermedius, facial nerve, chorotympani joins lingual nerve, branch of V3, submandibular ganglion, relay, postganglionic fiber, submandibular and sublingual gland. This is supplied by branches of submandibular ganglion. Triangles of neck, the subdivisions of anterior triangle, carotid triangle, digastric, submental, muscular, posterior হচ্ছে subdivision of posterior triangle, occipital, subclavian, supraclavicular. Boundary, carotid superiorly, posterior belly of digastric, anteriorly, inferiorly, superior belly of omohyoid, posteriorly by anterior belly of sternocleidomastoid. Roof is formed by skin, superficial fascia containing platysma, cervical branch of facial nerve, transverse cutaneous nerve or neck, investing layer of deep cervical fascia, floor, hyoglossus muscle, thyrohyoid muscle, middle constrictor of pharynx, inferior constrictor of pharynx. Content of carotid triangle. Arteries, external carotid artery with superior thyroid, lingual, facial, ascending pharyngeal, occipital branches, internal carotid artery, common carotid artery with carotid sinus, carotid bodies, vein, internal jugular vein, common facial vein, pharyngeal vein, lingual vein, nerve, vagus nerve, superior laryngeal nerve, spinal accessory nerve, hypoglossal nerve, sympathetic chain. Special structure of neck. Extension, sheath extend downward along the vessels from the base of the skull to the arch of the aorta, carotid sheath. আচ্ছা, আর হচ্ছে relation anteriorly answer cervicalis up to the base of the skull and up to the fibrous pericardium. Content, medially হচ্ছে CCA, common carotid artery and internal carotid artery, and laterally internal jugular vein, আর হচ্ছে এই দুইটার মাঝখানে vagus nerve. Structure piercing carotid sheath, very very important. External carotid artery, tributaries of IGV nerve, glossopharyngeal, accessory nerve, hypoglossal and vagus. আচ্ছা, posterior triangle, posterior border of sternocleidomastoid, boundary. আচ্ছা, ডিভিশন, উপরের আপার পার্ট অক্সিপিটাল ট্রায়াঙ্গল, আর হচ্ছে স্মলার পার্ট সুপ্রাক্লাভিকুলার বা সাবক্লাভিয়ান. এটা হচ্ছে ডিভাইডেড হয় ইনফেরিয়র বেলি অফ ওমোহাইওয়েড দ্বারা. Content, nerves, occipitalis, spinal, root accessory nerve, 4 cutaneous branches, cervical plexus, lesser occipital, great auricular, anterior cutaneous nerve of neck, supraclavicular nerve, muscular branch, 2 small branch to levator scapulae, 2 small branch to trapezius nerve to rhomboidoid dorsoscapular nerve, C5, C6 roots of brachial plexus, vessels, transverse cervical artery and vein, occipital artery, lymph node, supraclavicular lymph node, occipital lymph node, subclavian, supraclavicular part, 3 trunks of brachial plexus, nerve to serratus anterior, long thoracic nerve, nerve of bell, nerve to subclavius, suprascapular nerve, third part, vessel, third part of cervical artery, suprascapular artery, vein, commencement of transverse cervical artery and termination and of chorus vein, lower part of external jugular vein, supraclavicular lymph node. Muscles of neck, ribbon muscle কিছু আছে. আচ্ছা, platysma, rectus spinae and then হচ্ছে infrahyoid muscle. ribbon muscle এর নাম sternohyoid, omohyoid, sternothyroid, thyrohyoid. suprahyoid muscle এর নাম digastric, anterior, posterior belly, stylohyoid, mylohyoid, geniohyoid and then পাঁচে sternomastoid. Sternocleidomastoid origin, sterna head tendinous arises from superlateral part of the front of the manubrium sterni. Clavicular head muscular tendinous arises from medial 1/3 of the superior surface of clavicle, passes deep to the sternal head and 2 head blend below the middle of the neck between 2 head, triangular depression of the lesser supraclavicular fossa overlying the internal jugular vein, inserted thick tendon into the lateral surface of mastoid process from its tip to the superior border by thin aponeurosis into the lateral half of the superior nuchal line of the occipital bone. Nerve supply, spinal accessory nerve provides motor supply, passes through the muscle branches from ventral ramus, situ or proprioceptive rad. আচ্ছা, অ্যাকশন, একটা মাসল কন্ট্রাক্ট হইলে it turns the cheek into the opposite side. It can also tilt the head towards the shoulder of the same side. When both muscles they draw the head forward as in eating and lifting the head from a pillow. With the longest culli they flex the neck against resistance. It also helps in forced inspiration. Deep structure of the neck. The skin of the neck supplied by 2-3 cervical nerve. Anterolateral part is supplied by anterior primary rami through the anterior cutaneous, great auricular, lesser occipital and supraclavicular nerve. A broad band of the skin over the posterior part is supplied by dorsal primary rami. Spinal nerve C1 has no cutaneous distribution. Nerve C5, C6, C7, T1 supply the upper limb through the brachial plexus and therefore do not supply the neck. The territory of C4 extends into the pectoral region through the supraclavicular nerves and the meets the ravatum T2 at the level of second costal cartilage. Investing layer of deep cervical fascia. Investing layer deep cervical fascia enclosed from capsule for parotid gland, submandibular gland muscle, trapezius muscle, sternocleidomastoid muscle space, supraclavicular space, suprasternal space, pretracheal fascia, deep cervical fascia enclosed thyroid gland from false capsule, parathyroid gland, prevertebral fascia enclosed the cervical plexus, brachial plexus, fascia pierced by 4 cutaneous branches of the cervical plexus. खुदा আচ্ছা এক্সটার্নাল ক্যারোটিড আর্টারি ব্রাঞ্চেস অ্যান্টেরিয়র সুপিরিয়র থাইরয়েড অ্যান্টেরিয়র হচ্ছে ফার্স্ট ব্রাঞ্চ এসবিতে আসতে পারে সুপিরিয়র থাইরয়েড লিঙ্গুয়াল অ্যান্ড ফেশিয়াল আর্টারি পোস্টিরিয়র অক্সিপিটাল অরিকুলার পোস্টিরিয়র অরিকুলার আর্টারি মিডিয়াল অ্যাসেন্ডিং ফ্যারেঞ্জিয়াল আর্টারি আর শেষে ডাইরেক্টর টার্মিনাল মেসিলারি অ্যান্ড সুপারফিশিয়াল টেম্পোরাল আর্টারি আচ্ছা vertebral artery first part cervical part from the origin up to transverse foramina of C6 6 vertebral artery second part vertebral part through the foramina transverse area upper 6 vertical up to C1 আচ্ছা কিন্তু এটা C6 C7 বলে কিছু নাই and कुछ तो हुआ है আচ্ছা third part suboccipital part lies in the suboccipital triangle emerging from foramina transversum of the atlas. The artery winds medially around the posterior aspect of the lateral mass of the atlas. Lands medially lying on the posterior arch of this bone enters vertebral canal by passing deep to the lower arch margin of posterior atlanto-occipital membrane. Fourth part intracranial extends from the atlanto-occipital membrane to the lower border of the pons. Vertebral canal pierces the dura and the arachnoid ascends to the front of the root of the hypoglossal nerve. As it ascends, it gradually inclines medially to reach the front of the medulla at the lower border of the pons. It unites with its fellow of the opposite side to form the basilar artery. আচ্ছা ফেশিয়াল নার্ভ লোয়ার মোটর নিউরন লিশন সেম সাইড আপার হাফ লোয়ার হাফ প্যারালাইসিস আর ফেশিয়াল নার্ভ পলসিতে আপার মোটর নিউরন লিশন হলে কন্ট্রাল্যাটারাল প্যারালাইসিস লোয়ার পোর্শন কন্ট্রাল্যাটারাল প্যারালাইসিস তাও শুধু জাস্ট লোয়ার পোর্শন আপার পোর্শন হবে না সেম সাইড আপার হাফ লোয়ার হাফ প্যারালাইসিস হবে লোয়ার মোটর নিউরন লিশনে nerve supply phase sensory supply acha motor supply mesoderm of second pharyngeal arch supplied by facial nerve temporal zygomatic buccal mandibular cervical sensory supply হচ্ছে branches of trigeminal nerve ophthalmic division supply of the area developed from frontonasal various branches supratrochlear infratrochlear supraorbital lacrimal external nasal maxillary division developed from the mandibular process various branches zygomatico temporal zygomatico facial infraorbital mandibular division supply the area over the angle of the mandible by auriculotemporal buccal mental branches from cervical plexus supply the area over the angle of mandible by great auricular nerve transverse cutaneous nerve of neck. Blood supply arterial supply facial artery branch of external carotid artery transverse facial artery branch of superficial temporal artery arteries accompany the cutaneous nerve venous drainage veins accompanying the artery and drains into common facial and retromandibular vein they communicate with the cavernous sinus. Okay. Lymphatic drainage of face upper territory greater part of forehead lateral half of eyelid conjunctiva lateral part of the cheek and parotid area preauricular node middle territory strip over the median part of the forehead external nose upper lip median half of the eyelid medial part of the cheek and greater part of the lower jaw submandibular lower territory central part of lower lip and chin submental. আচ্ছা so communication of facial vein cavernous sinus through following connection of the vein supraorbital superior ophthalmic আর হচ্ছে pterygoid plexus through deep facial vein. আচ্ছা facial vein divider valves rest directly on facial muscle movement of the facial muscle might facilitate the spread of septic emboli infected area of upper lip and lower part of the nose retrograde redirection cause thrombosis cavernous sinus with serious complication. Hence the upper lip adjoining nose lies between angular deep facial vein forms the dangerous area of case. Lower motor neuron lesion are same side upper and lower and upper motor neuron lesion contralateral right lesion হলে only lower part এ left lesion হবে. Development of face frontal nasal হচ্ছে forward bridge of nose medial lateral nasal prominence আর হচ্ছে maxillary cheek and lateral portion of upper lip, medial nasal, filtrum of upper lip, crest and tip of nose, lateral nasal, ala of nose, mandibular, lower lip. আচ্ছা, থাইরয়েড গ্ল্যান্ড। থাইরয়েড গ্ল্যান্ডে হচ্ছে বেসাল মেটিবুলিক রেট স্টিমুলেট সোমাটিক সাইকিক গ্রোথ, প্লেজ এন ইম্পর্টেন্ট রোল ইন ক্যালসিয়াম মেকানিজম মেটাবলিজম। একটা পিরামিডাল লোব থাকতে পারে, দুইটা জয়েন হচ্ছে ইসমাস দিয়ে। সিচুয়েশন, গ্ল্যান্ড লাইজ এগেন C5, C6, C71, embracing upper part of trachea. East lobe extend from middle to thyroid cartilage to the fourth or fifth tracheal ring. Isthmus extend from second to fourth tracheal ring. C1 has no cutaneous innervation. Dimension and weight: east lobe measures about 5 into 2.5 into 2.5, isthmus 1.2 into 1.2. Gland 25 gram, larger in female and male, and further increases in size during menstruation and pregnancy. Capsules of the thyroid. আচ্ছা, vertebral artery supply artery supplies arises from the upper surface of the first part of the subclavian artery. Capsules of thyroid: true capsule, peripheral condensation, connective tissue of the gland. False capsule derived from pretracheal layer of deep cervical fascia, thin along the posterior border of the lobe but thick on the inner surface of the gland, where it forms a suspensor ligament of Berry. Connects the lobe to cricoid cartilage. Dense capillary plexus is present deep to the true capsule. To avoid hemorrhage during operation, thyroid removed along with true capsule, compared with prostate, which has venous flexus lie between two capsule of the gland. Therefore, during prostatectomy, both capsules are left behind. Blood supply: arterial supply, upper one third of lobe and upper half of isthmus. Superior thyroid artery, branch of external thyroid artery, lower two third of lobe and lower half of isthmus. Inferior thyroid artery, branch of thyrocervical trunk. আচ্ছা, superior thyroid artery সাথে external laryngeal nerve, high pitch and husky voice, maintain pitch. recurrent laryngeal nerve থাকবে inferior thyroid artery সাথে। আর হচ্ছে এটার জন্য হবে হচ্ছে hoarseness of voice. Also by arterial thyroidema, lowest thyroid artery, branch of brachiocephalic trunk of or arch of aorta, and accessory thyroid artery, branch of tracheoesophageal artery. Vena jejunum: superior thyroid vein drains into internal jugular or communificial vein. Middle thyroid vein drains into internal jugular vein. Inferior thyroid vein drains into left brachiocephalic vein. Fourth thyroid vein of Kocher may emerge between the middle and inferior vein, drains into internal jugular vein. Lymphatic drainage: lymph or upper part of the gland, upper deep cervical lymph node, either directly or through the prepharyngeal nodes. Lymph from the lower part of the gland drains into lower deep cervical node directly, also through the pretracheal and paratracheal nodes. Nerve supply: nerves are derived mainly from the middle cervical ganglia and also partly from the superior and the inferior cervical ganglia. Those are vasoconstrictor. Histology: follicular cell lining of the follicle of the gland, secret hydrothyronin and tetrahydrothyronin. Thyroxine stimulate BMR, somatic psychic growth of the individual during active phase. Lining of the follicle, columnar, resting a cuboidal follicle contain colloid in their lumen. Parafollicular cell, C cell, fewer and light cell lies between the follicle. They secrete thyrocalcitonin, which promotes deposition of calcium salts in skeleton and other tissue, tend to produce hypocalcemia. Their effects are opposite to those of parathormone. Hey Prabhu. The thyroid develops from a median endodermal thyroid diverticulum, goes down in front of the neck from the floor of the primitum pharynx, is caudal to tuberculum impar. Lower end of diverticulum enlarges from the gland. The rest of diverticulum remain narrow and known as thyroglossal duct. Most of the duct zone disappears. Position of the upper end marked by the foramen cecum of the tongue. Anterior two third, posterior one third of the tongue, and the lower end often passes a pyramidal lobe. Gland become functional during third month of development. Remnants of thyroglossal duct may form thyroglossal cyst. Thyroglossal fistula: thyroid tissue may be developed at abnormal site along the course of the duct, resulting in lingual or retrosternal thyroid. Accessory thyroid may be present. Clinical: any swelling of the thyroid should be palpated from behind and moved with deglutition. Removal of the thyroid gland. Thyroidectomy with a true capsule may be necessary in hypertension. Thyrotoxicosis: partial thyroidectomy, posterior part of the both lobe are left behind. These avoid of risk of simultaneous removal of parathyroid. Also postoperative myxedema caused by deficiency of thyroid hormone during operation. Superior thyroid artery ligated near the gland to save the external laryngeal nerve. Hypothyroidism causes cretinism in infant and myxedema in adult. Benign tumor of the gland may displace or even compress neighboring structure like the carotid sheath. JK, etc. Malignant growth tend to invade and erode the neighboring structure. Pressure symptom and nerve involvement are common in carcinoma of the gland. Structures cutting through thyroid surgery from before backward procedure of thyroid surgery. Flaps of skin, subcutaneous tissue, platysma, flap muscle, cervical fascia, thyroid capsule, pretracheal fascia, and muscle not prevertebral valve fascia. Pretracheal muscles and fascia are sutures and the wound close. Parathyroid gland position. Anastomotic artery between superior and inferior artery. Thyroid artery usually a good guide to the gland because they usually lie close to it. Superior parathyroid is more constrained in position, usually lies in the middle of the posterior border of the lobe of the thyroid gland, though it may lie at a higher level, usually dorsal to the recurrent laryngeal nerve. Inferior parathyroid more variable in position, it may lie within the thyroid capsule below the inferior thyroid artery near the lower pole of thyroid lobe, behind and outside the thyroid capsule immediately above the inferior thyroid artery. Within the substance of the lobe nearest posterior border, it is usually ventral to the recurrent laryngeal nerve. Inferior thyroid artery also supply thyroid glands, superior inferior parathyroid glands, cervical part of esophagus and thymus and trachea. থাই মাস 10 থেকে 15 at birth, 30 থেকে 40 at puberty, only 10 গ্রাম after mid adult life. আচ্ছা, হেসেলস অরপাসল থাকে মেডুলাতে অ্যান্ড বাট সাবক্যাপসুলার স্পেস থাকে লিম্ফ নোডে. Palatal tonsil, pharyngobasilar fascia, superior constrictor, paratopharyngeal muscle, buccopharyngeal fascia, lower part of staphylococcus, glossopharyngeal nerve. আচ্ছা, ভলেট পেপিলা, ফলিয়েট পেপিলা, ফাঙ্গিফর্ম পেপিলা, ফ্যারিংস, এপিগ্লটিস, সফট ভ্যালেট, টাং. Papillary location. আচ্ছা, muscles of the tongue. So intrinsic muscle superior longitudinal, they alter the shape of the tongue, shorten the tongue and makes it dorsum concave. Inferior longitudinal, shorten the tongue, makes it dorsum convex. Transverse makes the tongue narrow and elongated. Vertical makes the tongue broad flattened. Extrinsic muscle genioglossus protrude the tongue from the mouth. Safety muscle and native fan shaped. Higher glossus depressed tongue makes dorsum convex and retracts the protruded tongue. আর হচ্ছে staphylococcus draws tongue upwards and backwards. Paratogossus pull root of tongue upward and backward. Narrow oropharyngeal isthmus. All the muscles of the tongue are supplied by hypoglossal nerve except palatogossus, which is supplied by cranial part of the accessory nerve. Okay, now supply sensory taste development of epithelium from endoderm. Sensory হচ্ছে anterior two-third lingual nerve. Taste হচ্ছে quarter tympani except valid papilla. Anterior two-third. Lingual nerve হচ্ছে from trigeminal and quarter tympani from facial. Development of epithelium of endoderm, 2 lingual swelling and 1 tuberculum impar. First arch tuberculum impar which soon disappears, posterior 1/3. দুইটাই glossopharyngeal nerve আর posterior মোস্টে দুইটাই internal laryngeal nerve of vagus. আলহামদুলিল্লাহ. আর হচ্ছে টেস্ট posterior 1/3 glossopharyngeal nerve including valid papilla. আর হচ্ছে development of epithelium from endoderm হচ্ছে posterior 1/3, third which forms large ventral part of hypobranchial eminence. Fourth হচ্ছে posterior most fourth arch which forms small dorsal part of hypobranchial eminence. Lymphatic, from the tip of the tongue into submental lymph node bilaterally, from anterior two-third to submandibular lymph node unilaterally, but a few central lymphatic drain into those nodes bilaterally. From the posterior 1/3 to jugulo-omohyoid lymph node bilaterally. At last, all this drain into jugulo-omohyoid lymph node. আর sentinel হচ্ছে jugulo-omohyoid. Nerve supply. Muscle of the tongue are developed from the occipital meatum, so they are innervated by hypoglossus nerve except paratoglossus, which is supplied by cranial part of accessory nerve to pharyngeal plexus. Sensory supply anterior two-third except valid papilla. Developed from two lateral lingual swelling of first pharyngeal arch, 1 tubercular impar or pre-tematic part of second arch. So, and of tubercular impart of pre-tematic part of second arch. So, general sensation carried by lingual nerve, a branch of mandibular nerve, nerve of first arch. Taste sensation is carried by quarter tympani, branch of facial nerve, which is the nerve of second arch. Taste sensation carried by general sensation carried by lingual nerve, branch of mandibular nerve, nerve of first arch. Taste sensation carried by chorda tympani, branch of facial nerve, which is the nerve of second arch. Posterior one third include valid papilla. Developed from hypobranchial eminence of third pharyngeal, so is general taste sensation carried by glossopharyngeal nerve of third pharyngeal. Arch posterior most developed from fourth pharyngeal arch. So this part innervated by vagus nerve through internal pharyngeal nerve, a nerve of fourth pharyngeal arch. Sympathetic supply superior cervical ganglion. Styloid apparatus. আচ্ছা স্ট্রাকচার অ্যাটাচড তিনটা মাসল দুইটা লিগামেন্ট মাসলস হচ্ছে স্টাইলোহাইড স্টাইলোগ্লসাস স্টাইলোফ্যারেঞ্জিয়াস অ্যান্ড লিগামেন্ট স্টাইলোহাইড স্টাইলোম্যান্ডিবুলার apparatus diverse origin. The styloid process, the styloid ligament muscle derived from the second branchial arch, the stylopharyngeus from third arch, styloglossus from occipital meatum, stylomandibular ligament from a part of the deep fascia of the neck. 5 attachments resemble the reins of chariot. Two of these reins ligaments are non-adjustable, whereas the three muscle adjustable, controlled by a separate cranial nerve. 7, 9th and 12th nerve. Key epistrixis phenovalent artery, branch of maxillary artery, artery of epistrixis. Larynx cartilage of larynx cartilage, unpaired epiglottis, thyroid, cricut and paired arytenoid, corniculate and cuneiform. Fibrocartilage, epiglottis, corniculate and cuneiform. Vocal process, apex of arytenoid, hyaline cartilage, thyroid and cricoid, basal part of the arytenoid. Muscles moving acting on larynx যে হচ্ছে nerve supply. All the intrinsic muscle of larynx are supplied by recurrent laryngeal nerve except cricothyroid, which is supplied by external laryngeal nerve. Abductor of vocal cord, posterior cricoarytenoid only. এটা হচ্ছে প্যাটেন্সি রক্ষা করে, একটা একটা সেফটি মাসল, অল মাসল, ফিফথ আর্চ আর ক্রিকোথাইরয়েড ফোর্থ আর্চ। হে প্রভু। আচ্ছা সার্ভাইকাল প্রেক্সাস formed by the rami above 4 cervical nerve C1 C2 C4. আচ্ছা superficial cutaneous branch glassed, great auricular, C2 C3 lesser occipital, C2 transverse cutaneous nerve on neck, C2 C3 supraclavicular, C3 C4. deep branches হচ্ছে আচ্ছা phrenic nerve, trapezius, ranunculomastoid, levatoscapulae, muscular branches. Vertebra done. Joints only, mobile joint, synovial joint of condylar variety. আর ডিপ্রেশন হয় ল্যাটারাল টেরিগয়েডের জন্য। মুভমেন্ট ডিপ্রেশন ল্যাটারাল টেরিগয়েড, ডায়াগাস্ট্রিক, genuine malleus of hyoid muscle, elevation masseter temporalis, medial pterygoid, protrusion medial lateral pterygoid, retraction posterior fibroid temporalis masseter, digastric, lateral movement, lateral left lateral pterygoid, right medial pterygoid muscle. আচ্ছা forebrain ভিতর telencephalon cerebrum made up of two cerebral hemisphere, median part of front of the interventricular foramen, basal ganglia, hippocampus, diencephalon, thalamencephalon, hidden by the cerebrum, consist of thalamus, hypothalamus. আচ্ছা এটা হচ্ছে সাবকর্টিক্যাল এরিয়া, thalamus, hypothalamus, metacephalus including the medial lateral geniculate body, epithalamus including pineal body, habenular trigon, posterior commissure, subthalamus. আর হচ্ছে ক্যাভিটি এখানে থাকবে ল্যাটারাল ভেন্ট্রিকল এন্ড থার্ড ভেন্ট্রিকল, ফোর ব্রেনে, মিড ব্রেনে থাকবে মেসেনসেফালন, ক্রাস সেরেব্রালি, সাবস্টেন্সিয়েট নিগ্রা, টেগমেন্টাম, টেকটাম, from before cerebral aqueduct backwards. Hindbrain rhombencephalon এইখানে থাকবে হচ্ছে মেটেনসেফালন ফর মেড আপ অফ 2 pons and 2 cerebellum, মাইনসেফালন ও মেডুলা অবলিঙ্গোটা ফোর্থ ভেন্ট্রিকল। আচ্ছা, এনএস, সিএনএস, পিএনএস, এএনএস। এএনএস এর ভিতরে প্যারাসিম্পেথেটিক, সিম্পেথেটিক, থোরাকোলাম্বার, প্যারাসিম্পেথেটিক, ক্রেনিয়াল স্যাক্রাল। ভেরি গুড। লোবস, ফ্রন্টাল, প্যারাটাল, অক্সিপিটাল, টেম্পোরাল। টেম্পোরালে কর্টিক, আচ্ছা এগুলোর হচ্ছে কর্টিক্যাল ফাংশন। প্যারাসিম্পেথেটিক ড্যামেজ যদি হয় ইউরিনারি ব্লাডারে, দেন আপার মোটরে হচ্ছে ওভারফ্লো ইনকন্টিনেন্স হবে, আর লোয়ার মোটরে হচ্ছে আপার মোটরে হচ্ছে আর্জ অ্যান্ড লোয়ার মোটরে ওভারফ্লো ইনকন্টিনেন্স। আই হোপ আই সেড দ্যাট রাইট। আচ্ছা, 1 to 4 ব্রেনে, 3 4 মিড ব্রেনে, 5 থেকে 8 পন্সে, 9 থেকে 12 মেডুলাতে, থার্ড হচ্ছে এডিনজার ওয়েস্টফেল, 7 সুপিরিয়র সিলিভিটারি, 9th হচ্ছে ইনফিরিয়র, 10 হচ্ছে ডর্সাল, 3 7 9 10 প্যারাসিম্প্যাথেটিক, S2 3 4 প্যারাসিম্প্যাথেটিক, নিউক্লিয়াস সিএনএস, রেনিয়াল না পিএনএস, নিউক্লিয়াস অফ অ্যাম্বিগুয়াস এর কানেকশন কি? ওকে, C8 T12 L5 S5 C1 spinal nerve anterior horn cell. ওকে, ফ্রন্টাল ফাংশন হচ্ছে পার্সোনালিটি, ইমোশনাল কন্ট্রোল, সোশ্যাল বিহেভিয়ার, কন্ট্রোলেটর, মোটর কন্ট্রোল, ল্যাঙ্গুয়েজ মিক্সচুরেশন, প্যারাটাল ডমিনেন্স, ল্যাঙ্গুয়েজ ক্যালকুলেশন, সেন্সরি, প্যারাটাল নন ডমিনেন্ট, স্পেশাল ওরিয়েন্টেশন, কনস্ট্রাকশনাল স্কিল, টেম্পোরাল ডমিনেন্ট, অডিটরি পারসেপশন, ল্যাঙ্গুয়েজ, ভার্বাল মেমরি, স্মেল ব্যালেন্স, টেম্পোরাল নন ডমিনেন্ট, অডিটরি পারসেপশন, মেলোডি, পিচ পারসেপশন, নন ভার্বাল মেমরি, স্মেল ব্যালেন্স, অক্সিপিটাল ভিজুয়াল প্রসেসিং। স্ট্রাকচার অফ সেরিবেলার কর্টেক্স, আচ্ছা ব্রেন ফাংশন, কন্ট্রাল্যাটারাল, সেরিবেলাম, ইপসিল্যাটারাল। আচ্ছা, পিরামিডাল সেল, নার্ভ সেলস হচ্ছে পিরামিডাল সেল, সেরিব্রাল, পিরামিডাল, স্টেলেট, ফিউজিফর্ম, হরিজন্টাল সেলস অফ কাজল অ্যান্ড সেলস অফ ম্যাটিনোটি। পিরামিডাল সেল প্রেজেন্ট ইন সেরিব্রাল কর্টেক্স, ফ্রন্টাল কর্টেক্স, প্রিফ্রন্টাল কর্টেক্স, আর হচ্ছে প্যারাটাল কর্টেক্স, হিপোক্যাম্পাস, অ্যামিগডালা। লেয়ার্স অফ সেরিবেলার কর্টেক্স, মলিকুলার লেয়ার, প্লেক্সিফর্ম লেয়ার। সো ফ্রম সুপারফিশিয়াল টু ডিপ, molecular layer, plexiform layer, external granular layer, external pyramidal layer, internal granular layer, ganglionic layer, internal pyramidal layer, and multiform layer, layer of polymorphic cell. Parts of grey matter, all cortex, telencephalon, diencephalon, all nuclei of CNS. Grey matter consists of cell body of neuron, nerve fiber, nuclear, blood vessel, axon of both myelinated, unmyelinated nerve. White matter consists of long myelinated axon, very few cell bodies. Classification according to number of branching of neuri, pseudo unipolar dorsal root ganglia, sensory ganglia of cranial nerve, unipolar mesencephalic nucleus of trigeminal nerve, bipolar CN1 to 8, multipolar all motor, আর হচ্ছে অল মোটর ইন্টারনানশিয়াল নিউরন, গলগি টাইপ 1, লং অ্যাকশন ফাইবার ট্র্যাক্টর অফ ব্রেন, স্পাইনাল কর্ড, পেরিফেরাল নার্ভ, মোটর সেলস স্পাইনাল নার্ভ, গলগি টাইপ 2, শর্ট অ্যাকশন সেরিব্রাল অ্যান্ড সেরিবেলার কর্টেক্স, সেল বডি গ্রে, অ্যাকশন ডেন্ড্রাইট হোয়াইট। Commissural fiber, corpus callosum, anterior commissure, posterior commissure, the fornix, avicular commissure, association fibers, ছয়টা নাম, projection fiber, internal capsule, corner radiator, optic radiation, corpus callosum, largest commissure fiber of the brain, it connects to cerebral hemisphere. Since it is neophilial commissure, it attains enormous size in men. আচ্ছা, এটার parts only নাম, corpus callosum, jejuni, rostrum, trunk and splenium. Overflow incontinence, sacral injury, overflow incontinence, projection fiber, cortex এর সাথে brainstem এর connection, connect within the same hemisphere, short association fiber, long association fiber, uncinate fasciculus, cingulum, superior longitudinal fasciculus, fronto-occipital fasciculus, projection fiber, afferent different nerve fiber passing to and from the brainstem to the entire cerebral hemisphere, internal capsule, corner radiator and optic radiation. আচ্ছা, তিনটা, internal capsule, corner radiator, optic radiation. Submandibular, ciliary ganglion, third, Edinger, pterygopalatine, 7th, superior salivatory, otic, inferior salivatory, 9th, up to midgut, vagus, 10, S2 3 4 pelvis, pancreatic nerve irrigates supply, hindgut, genitourinary system, T1 থেকে L2, sympathetic supply, lateral horn, sympathetic outflow. Internal capsule compact band of neocortical projection fiber lies mainly between the head of the caudate nucleus and thalamus medially and lentiform nucleus. As a head of caudate nucleus, putamen of lentiform nucleus, globus pallidus of lentiform nucleus, lateral and medially globus pallidus lentiform nucleus and laterally putamen of lentiform nucleus. আর হচ্ছে এক্সটার্নাল ক্যাপসুল অ্যান্ড ক্লস্ট্রাম, আর এখানে অ্যান্টেরিয়ার লিম্ব, পোস্টেরিয়র লিম্ব, মাঝখানে জেনু আর থ্যালামাস মাঝখানে, অ্যান্ড থার্ড ভেন্ট্রিকুলার ল্যাটারাল বাউন্ডারি। আচ্ছা, থ্যালামাস আর বাউন্ডারি, ল্যাটারালি পোস্টেরিয়র লিম্ব অফ ইন্টারনাল ক্যাপসুল, মিডিয়ালি থার্ড ভেন্ট্রিকল। আর হচ্ছে ইন্টারনাল ক্যাপসুল অ্যান্টেরিয়র লিম্বের মিডিয়াল থাকে হেড অফ কর্ডেড নিউক্লিয়াস, পোস্টেরিয়র লিম্বে থাকে মিডিয়াল থাকে থ্যালামাস। ল্যাটারালি হচ্ছে থাকে লেন্টিফর্ম নিউক্লিয়াস। ওকে, posterior limb, anterior two-third contain corticospinal fibers from the motor cortex to anterior horn cell or corticospinal tract. Genu contain corticonuclear fiber or corticobulbar fiber. Clinical anatomy: ascending fiber, descending fiber, rupture of lenticular striate branch of medial cerebral artery, Charcot's artery, resulting stroke, hemiplegia of opposite side. Acha, part: anterior limb, ascending fiber, anterior thalamic radiation, descending fiber, parts: anterior limb, genu, posterior limb, sublentiform, retrolentiform। আর হচ্ছে এটা ডিসেন্ডিং ফাইবার হচ্ছে কর্টিকোনিউক্লিয়ার ফাইবার বা কর্টিকোবালবার ট্র্যাক্ট। Basal nuclei plays an important role in control of posture and voluntary control. Concerned with motor control, basal nuclei have no direct input or output connection with the spinal cord parts: corpus striatum, caudate nucleus, lentiform nucleus, globus pallidus, and putamen. Globus pallidus medial, putamen lateral, amygdaloid nucleus, costum. Okay. As a function control of gross muscular movement by influencing cerebral cortex, influence skill, cortical motor activity, influence the execution of particular movement, help prepare for the movement, have no direct control through descending pathway to brainstem and spinal cord. Amygdaloid হচ্ছে in the sense of fear, for example, it can change heart rate, blood pressure, skin color, rate of respiration. Effective lesion of basal ganglia, Parkinson disease, hyperkinetic disorder, Wilson and Carnitas. Caudate nucleus. Limbic system. Olfactory parts: olfactory nerve, bulb tract, trigone, anterior perforation substance, thalamic nuclei, piriform lobe consisting of uncus, parahippocampal gyrus, posterior part of parahippocampal and singular gyrus, hippocampal formation including hippocampus dentate gyrus, inducem, griseum and longitudinal stria, entorhinal cortex, and entorhinal cortex, amygdaloid nucleus and septal region, fornix stria, terminalis, habenularis, anterior commissure. Function: control food habit, control endocrine behavior, control sex behavior, control emotional, convert recent memory to long-term memory. Fear, food habit, endocrine, emotion, anger, recent memory, sexual behavior, smell. Thalamus: medially third ventricle, laterally posterior limb of internal capsule. Large egg-shaped mass of gray matter forms the major part of diencephalon. There are two thalami, one is situated on each side of the third ventricle. Anterior end of the thalamus, that are rounded, forms the posterior boundary of the inner ventricular foramen. Posterior end is expanded to form the pulvinar, which overhangs the superior colliculus. As the inferior surface continues with tegmentum of the midbrain, medial surface of thalamus forms the part of the lateral wall of the third ventricle. Lateral wall, posterior limb of internal capsule. Function of thalamus: vast of sensory information of all type except smell converges on the thalamus. Olfactory information, ventral anterior and ventral lateral nuclei involved in performance and voluntary movement. Hypothalamus चारटा nucleus. Suprachiasmatic regulates circadian rhythm, receives direct retinal input. Supraoptic and periventricular synthesizes ADH, oxytocin, regulates water balance, lesion, diabetes insipidus, characterized by polydipsia and polyuria. Anti-region temperature regulation, lesion, hyperthermia, stimulates the parasympathetic nervous system. আর হচ্ছে posterior region temperature regulation lesion, poikilothermia, inability to thermoregulate, stimulate sympathetic nervous system, forms the most the most ventral part of diencephalon. সেরেবেলাম মোটর প্ল্যানিং এর জন্য ব্যালেন্স টোন এন্ড কোঅর্ডিনেশন আছে প্যালিও সেরিবেলাম সাইনাস সেরিবেলাম অ্যান্টিরিয়র লুব uvular pyramid of Vermis facilitate muscle tone and posture of the limb. Neocerebellum, cerebropontocerebellum, middle lobe, exit uvular pyramid concerning with smooth performance of skill acts by coordinates of movement. Arch cerebellum, vestibular cerebellum, odorless part, foculonodular lobe and lingula, maintaining equilibrium tone posture of truncus muscle. Cerebellar cortex, outline molecular layer, stellate basket cell, Purkinje cell layer, Purkinje Golgi cell, granular layer, numerous small rounded ground cell nuclei. Histology, white matter, cerebellum, intensive আচ্ছা এটা লাগবে না নিউক্লিয়াই ডেন্টেডটা হচ্ছে লার্জেস্ট ল্যাটারাল টু মিডিয়াল ডেন্টেড এম্বলিফর্ম গ্লোবাস এন্ড ফাস্টিজিয়াল cerebellus and muscle hypotonia, intention tremor, dysdiadochokinesia, nystagmus, scanning space, dysarthria, ataxic and anstereate pendular jar. ब्रेन स्टेम मोटर न्यूक्लियस सेंसरी न्यूक्लियस वेडेंजर वेस्फल नार्व 3 ट्रॉक्लियर 4 मोटर नार्व ऑफ ट्राइजेमिनल नार्व 5 फेशियल नार्व 7 सुपर सेल्वेटरी नार्व 7 इंफीरियर सेल्वेटरी 9 न्यूक्लियस एम्बिगुअस लुलाला 9 10 11 हाइपोग्लोसाल 12 मेसेनसेफेलिक হচ্ছে সেন্সরি নিউক্লিয়াস মেসেনসেফেলিক নিউক্লিয়াস 5 প্রিন্সিপাল সেন্সরি 5 স্পাইনাল 5 4 vestibular nerve anterior posterior cochlear nerve mixed tractus আচ্ছা সরি নিউক্লিয়াস ট্র্যাক্টাস সলিটারিয়াস 7 9 10 আর হচ্ছে মিক্সড নিউক্লিয়াস ডরসাল ভ্যাগাস নিউক্লিয়াস আচ্ছা ট্রান্সভার্স সেকশন অফ মিড ব্রেন স্ট্রাকচার্স ক্রেনিয়াল নার্ভ C3-4 টেম্পোরো পন্টয়েন্ট ফ্রন্টোপন্টয়েন্ট ফাইবার কর্টিকো স্পাইনাল কর্টিকোনিউক্লিয়ার ফাইবার রেড নিউক্লিয়াস মিডিয়াল এন্ড ট্রাইজেমিনাল লেমনিসকাস স্পাইনাল ল্যাটারাল লেমনিসকাস এমএলএফ মিডিয়াল লongitudinal fasciculus substantia nigra আচ্ছা এখানে হচ্ছে সুপেরিয়র কলিকুলাসে রেড নিউক্লিয়াসটা এক্সক্লুসিভ আর ট্রক্লিয়ার নার্ভ ইনফেরিয়র কলিকুলাসে ডিকাসেশন অফ সুপেরিয়র সেরেবেলার পেডাঙ্কেলটা এক্সক্লুসিভ স্ট্রাকচার সেকশন ট্রান্সভার্স সেকশন অফ পন্স স্ট্রাকচার CN 5 6 7 8 MTSL MLF এবারে MTSL কি তা আচ্ছা corticospinal corticonuclear tract pontine nuclei reticular formation superior middle cerebellar peduncle rubrospinal olivospinal tectospinal ventral dorsal cochlear nucleus vestibular nucleus spinal nucleus motor nucleus mesencephaly nucleus of trigeminal nerve brain stem and spinal cord motor system situated medially GSC 3 4 6 12 most medially sensory system laterally except medial lemniscus and sympathetic fiber cerebellar fiber situated laterally second order neuron when present in brain stem lemniscus brainstem ventral surface middle oblongata pyramidus olives rootlets of 12 plus inferior cerebral peduncle rootlets of 9 10 11 and cranial nerve pons trigeminal nerve in anterior surface abducens facial nerve vestibular cochlear nerve between pons and middle oblongata midbrain 3 4 crus-cerebri column of white matter or interpeduncular fossa the oculomotor nerve cerebral peduncle Transverse section of medulla, cranial nerve, nodular shagoto, corticospinal tract, medial lemniscus, MLF, sinulothalamic tract, spinocerebellar tract, reticular formation, nucleus of tractus solitarius, dorsal nucleus of vagus, nucleus ambiguous, hypoglossal nucleus, vestibular nuclei. আচ্ছা আচ্ছা, ট্রান্সভার্স সেকশন মেডুলা 9-11-12, কর্টিকোস্পাইনাল ট্রাক্ট, মিডিয়াল লিম্বাস, এমিলিয়াস, সাইনোথ্যালামিক ট্রাক্ট, সাইনোসেরেব্রাল ট্রাক্ট, রেটিকুলার ফর্মেশন, নিউক্লিয়াস অফ ট্রাক্টাস সলিটারিয়াস, ডর্সাল নিউক্লিয়াস অফ ভ্যাগাস, নিউক্লিয়াস অ্যাম্বিগাস, হাইপোগ্লসাল নিউক্লিয়াস, ভেস্টিবুলার নিউক্লিয়াস। আচ্ছা, থার্ড ভেন্ট্রিকল ফ্লোরে, আচ্ছা বাউন্ডারি পিটুইটারি স্টক মেমোরি বডি, ওকে ফাইন, এটা আছে। ব্রেন স্টেম ডেথ, all brainstem reflexes are absent, pupil fixed and unreactive to light, corneal reflexes are absent, vestibular ocular reflexes are absent, there is no eye movement following the injection of 20 ml of ice cold water into each external auditory meatus in turn. Okay. Oculocephalic reflex absent, there is no motor response to adequate stimulation within the cranial nerve distribution, no gag reflex, no reflex in response to a suction catheter in the trachea apnea test, no respiratory movement occurs when the patient is disconnected from the ventilator long enough to allow the carbon dioxide tension to rise above the threshold for stimulating respiration. PaCO2 must reach 6.7 kilopascal, 50 millimeter of mercury. Sunset sign, Shearer sign, SBA, apnea test. Acha, UK criteria for diagnosis of brain death. Precondition for considering a diagnosis of brain death. Patient is deeply comatose. No suspicion that coma is due to depressant drug, such as narcotic, hypnotic, tranquilizers. Hypothermia has been excluded. Rectal temperature must exceed 35 degrees centigrade. No profound abnormality of serum electrolyte. Acha, acid base balance or blood glucose concentration and any metabolic and endocrine cause of coma has been excluded. The patient is maintained on a ventilator because of spontaneous respiration has been inadequate or had ceased. Inducing neuromuscular blocking agent must have been excluded as a cause of the respiratory failure. In the wall of cavernous sinus are the oculomotor, trochlear, ophthalmic and maxillary nerves. Acha, inferior wall of the floor, third ventricle, formed by optic asthma, tuber syndrome, infundibulum, with its funnel-shaped recessed mammillary body, hypophysis attached to the infundibulum. Axillary nerve effects of injury, paralysis or deltoid, loss of power of abduction up to 90 degree at the shoulder, loss of rounded contour of the shoulder with prominent greater tubercle of humerus, sensory loss over half of deltoid. Cause of injury, dislocation of the shoulder, fracture or surgical neck of humerus. Collateral nerves, rises from the brachial process to the thumb. Median nerve, labor nerve, coarse movement of the hand as nerve in its injury at whatever level, patient unable to pick up a pin with the thumb and index finger. Recurrent brachial supply, abductor pollicis brevis, flexor pollicis brevis, opening pollicis brevis, first and second lumbricals, loaf. Effect of the injury at the level of elbow, flexor pollicis longus paralyzed, patient unable to bend terminal phalanx of thumb when proximal phalanx is held firmly by clinician. Forearm is kept in supine position due to paralysis of pronator, hand is retracted due to paralysis of facial carpi radialis, flexion at wrist is weak, flexion at interphalangeal joint of index and middle finger is lost, so that index and to a lesser extent middle finger tend to remain straight while making a fist. Thumb deformity present due to paralysis of thinner muscle, area of sensory loss in the hand is much less than the area of distribution. Vasomotor trophic changes, skin or lateral 3.5 disease, worn, dry and scaly, nails get cracked easily. Effect of injury at wrist, more common. Thumb deformity where thinner muscle wasted, thumb is adducted and laterally rotated. Opposition of thumb totally lost, unable to pick up pin. Paralysis of first second lumbricals, makes the index and middle finger lag behind in slowly making a fist. Sensory lost, vasomotor trophic changes similar as above of pulp of finger. Pen test positive due to paralysis of abductor pollicis brevis. Effect of median nerve injury, weak flexion wrist, weak flexion of wrist, loss of pronation of forearm, loss of flexion proximal interphalangeal distal interphalangeal joint of index and middle fingers, loss of flexion at interphalangeal joint of thumb, loss of thinner eminence, sensory trophic and vasomotor changes. C5 C6 C8 T1 তারপর এক্সিলা, দেন ফ্রন্ট অফ দ্য আর্ম 1 থেকে 6। কাটা পড়লে দেন এলবো, দেন ফ্রন্ট অফ ফরআর্ম, আর হচ্ছে রিস্টে কাটা পড়লে কার্পাল টানেল সিনড্রোম 5 and 6, দেন হচ্ছে পাম। পেন টেস্ট পজিটিভ অ্যান্ড পিঞ্চ। রেডিয়াল নার্ভ, হচ্ছে ইনারভেজ ব্রেকিওরেডিয়ালিস এক্সটেন্সিস ওভেন্ডার টু ট্রাইসেপস। Effects, weakness, loss of power of extension of wrist, wrist of sensory over, loss of narrow strip on the back of the forearm and lateral side of dorsum of hand. C5 থেকে T1, 1 2 3 ফার্স্টে এক্সিলা কাট অফ করলো, দেন ফ্রন্ট অফ দ্য ওয়ার্ম 2 3 কাটা পড়লে এলবো, দেন ফ্রন্ট অফ ফোরাম 2 3 and wrist and then dorsum of hand 3। আচ্ছা, নো এক্সটেনশন অফ এলবো, ওয়ানে হচ্ছে নো এক্সটেনশন অফ এলবো, রিস্ট অফ সেন্সরি লস। আচ্ছা, এক্সিলার আগে কাটা পড়লে হচ্ছে তিনোটাই হবে, অ্যান্ড দেন ফ্রন্ট অফ দ্য আর্মে কাটা পড়লে রিস্ট অফ সেন্সরি লস, অ্যান্ড হচ্ছে দেন রিস্টে কাটা পড়লে জাস্ট সেন্সরি লস। হাই, আচ্ছা উপরে হলে হাই রেডিয়াল নার্ভ ইঞ্জুরি। আচ্ছা, এক্সিলার ফ্রন্ট অফ দ্য আর্মে কাটা পড়লে weak flexion of wrist, loss of pronation of forearm, loss of flexion of proximal interphalangeal and digital distal interphalangeal joint of index and middle finger, loss of flexion at interphalangeal joint of thumb, আর হচ্ছে লস অফ থিনার এমিনেন্স সেন্সরি ট্রফিক ভেসোমোটর চেঞ্জ, অ্যান্ড কাপল টানি সিনারে লস অফ থিনার এমিনেন্স সেন্সরি ট্রফিক অ্যান্ড ভেসোমোটর চেঞ্জ। Common cause of injury: intramuscular injection in arm, triceps, sleeping in arm with the chair limb hanging by the side, Saturday night palsy, side of the chair, or even pressure by crutch paralysis, fracture of shaft of humerus, honeymoon palsy। আচ্ছা, শুরু করলাম হচ্ছে এক্সিলার থেকে। Ulnar nerve often cause musician nerve, arises from CAT1 of medial nerve. Superficial branch, primary series, deep branches supply most intrinsic muscle. Digital branches of first muscle of hypothenar eminence, medial 1.5 digit plus 4 and third lumbicals, all interossei also supply intrinsic muscle। আচ্ছা, claw hand include lesion causing claw hand into complex paralysis, lesion of middle cord or brachial flexor, lesion of ulnar nerve, combined lesion, latent severe Volkmann in ischemic contracture end result of neglected supportive tenosynovitis of ulnar bursa। ulnar bursa at the elbow তে হইলে forearm becomes flattened at the medial border, flexure carpi ulnaris paralysis at the elbow behind the medial epicondyle, flexion of wrist joint resulting in abduction of forearm become flattened at medial border, flexure carpi ulnaris paralysis, flexion of wrist joint resulting in abduction of wrist, half flexure digitorum profundus paralysis, flexion of femoral phalanges of ring and little finger lost, clawing of finger become because medial half of flexure digitorum profundus, flexure of proximal distal interphalangeal joint get paralyzed, flattening। আচ্ছা, C7-8-81 এক্সিলা ফ্রন্ট অফ আর্ম এলবো, এলবোতে কাটা পড়লে 1 থেকে 6 and 8 9, 1 থেকে 6 হচ্ছে ফ্ল্যাটেনিং মিডল বর্ডার অফ ফোরাম, লস অফ ফ্লেকশন অ্যাট ডিস্টাল ইন্টারফ্যাঞ্জিয়াল জয়েন্ট অফ 4th and 5th and digit, loss of hypothenar eminence, loss of adduction of thumb, loss of abduction of all fingers except little fingers, loss of adduction of all fingers, and art mark clawing of a 4th and 5th digit, sensory trophic and vasomotor changes। আচ্ছা, রিস্টে কাটা বলে 3 7 এবং 9, লস অফ hypothenar eminence বা slight clawing of 2nd and 3rd digits, sensory trophic and vasomotor changes। If ulnar nerve is injured at the elbow, clawing of finger is less because medial half of the flexure digitorum profundus, flexure of proximal distal interphalangeal joint also get paralyzed. If ulnar nerve injured at wrist, then clawing of the finger is more, as intact finger digitorum profundus flexures the digit. If ulnar nerve is injured at wrist, clawing of the fingers is more, as intact flexure digitorum profundus flexures the digits more. Thus, if lesion proximal near elbow, clawing is less. On the contrary, if lesion is distal near wrist, clawing is more. This is called ulnar paradox। both ulnar and medial nerve get paralyzed, তাহলে কমপ্লিট হ্যান্ড ক্ল হবে। তো আর হচ্ছে কাট টেস্ট পজিটিভ, বুক টেস্ট পজিটিভ। অ্যাট দ্য রিস্ট মোস্টলি ইনজুর্ড, লিটল ফিঙ্গার হেল্ড অ্যাবডাক্টেড ডিউ টু অ্যাকশন অফ এক্সটেন্সর মাসল, আনএবল টু straight fingers abduct, dorsal interossei paralyzed, unable to adduct thumb, adductor pollicis paralyzed, unable to flex ring and little finger, third foot lumbar paralyzed, motor loss to the muscle of palm, sensory loss of middle half and half digit injury, nail bed, dorsum of phalanx, hyperextension of MP joint, inflection of IP joint involving ring and little finger, ulnar claw hand. Ulnar claw hand has lumbricals, loss of loss of hypothenar muscle, prominence of metacarpal bone due to paralysis or interossei. Ulnar injury at wrist can be excluded by Frontman sign or book test। আচ্ছা, common injury: shoulder dislocation, axillary, humeral shaft fracture, radial, humeral supracondylar fracture, radial or medial, elbow medial condyle, ulnar, Monteggia fracture dislocation, posterior interosseous, hip dislocation, sciatic, knee dislocation, perineal। এবার কিন্তু ফোন মুখের পর মারবো না। Musculocutaneous nerve flex elbow supination biceps trachi median nerve flex wrist and all digits pronation opposition of thumb flex metacarpo phalangeal joint and extend interphalangeal PIP and DIP joints of digits second and third. আচ্ছা আলনা নার্ভ সি এর থেকে T1 ফ্লেক্স রিস্ট অ্যান্ড ডিজিট 4 অ্যান্ড 5 ডর্সাল অ্যাবডাক্ট ডিজিটস 2 থেকে 5 ড্যাপ পামার হচ্ছে অ্যাডাক্টস ডিজিটস 2 থেকে 5 প্যাড। আচ্ছা Fasces lumbricals and metacarp MP flexion and IP extension digits 2 থেকে 5 flex MP and extend PIP DIP joint of digit 4 and 5th adduct the thumb axillary nerve abduct shoulder 15 থেকে 90 lateral rotation of the shoulder radial nerve extend MP wrist elbow pronator forearm pronator teres main and pronator quadrator supinator forearm supinator main biceps low lateral to lumbrical abdominal pollicis abductor pollicis brevis flexor pollicis brevis are supplied by medial rest hand nerve muscle supplied by ulnar nerve. Axillary artery 3 major teres major from the first rib to posterior edge of teres major muscle 3 major branches lateral thoracic artery supply mammary gland runs along long thoracic nerve subscapular artery co-lateral to shoulder with suprascapular branches subclavian artery posterior humeral circumflex artery at surgical neck of axillary nerve. The radial artery commences at the level of radial neck by lying on tendon of biceps in its upper part. It lies overlapped by brachioradialis surface marking of the artery being the groove of which can be seen on the middle side of tense muscle in the muscular object distally in the forearm where the artery lies superficially between the brachioradialis section carpi radialis between these two tendon palpated at the wrist in the middle third of the forearm. Radial nerve lies along the lateral side of the artery. The nerve may be here incorporated in a carelessly placed ligature distal to the radial pulse. Artery gives her runs to assist in forming the superficial palmar arch. Passes deep to the tendon of abductor pollicis longus extensor pollicis brevis to enter the anatomical snap box in which it can be felt. Pierces the first dorsal interosseous muscle and adductor pollicis between first and second metacarpal goes on to form deep palmar arch with the deep branches of ulnar artery. Shoulder joint, glenohumeral joint is the typical synovial joint of the ball and socket variety since 4:1 disproportion between large head of the humerus, less than 1/3 of the humerus head, and the shallow gravity glenoid cavity. Joint is reliant on soft tissue structure for both static and dynamic stability. Painful arc syndrome. There is pain in abduction between 60 to 120 middle third of the arc. The extremes of movements are painless. Initial abduction lost with a complete tear. Lost in patient with a complete tear of the supraspinatus tendon rotator cuff tear. Acha, patient is unable to initiate abduction of the shoulder because supraspinatus deltoid help early phase of abduction. Supraspinatus causes 10 to 15 degree of abduction followed by 19 further followed by the deltoid which helps the further 90 to 100. Anterior dislocation commonest type of shoulder dislocation 95% axillary. In contrast to posterior type and hip joint, axillary nerve usually affected in this type of injury. Acha supplies the joint and deltoid teres minor muscle and cutaneous branch. Upper lateral cutaneous nerve of the arm supplies upper outer aspect of the arm. Dislocation therefore causes loss of sensation of this area as well as loss of shoulder abduction. Deltoid muscle wasting seen on long-term axillary nerve injury. Radial nerve commonly injured in fracture of mid-shaft of the humerus as the nerve runs through the radial spiral groove. Coracobrachialis musculocutaneous nerve path 7 flexes the forearm at shoulder joint. Biceps brachii musculocutaneous nerve path 6 strong supinator of the forearm flexed. All stream movement are done with it. Flexure of the elbow, short head flexure of the arm, long head prevents upward displacement against the head of humerus. Can be tested against resistance as shown. Brachialis musculocutaneous nerve is motor. Radial nerve is proprioceptive flexures forearm at the elbow joint. Frozen shoulder, adhesive capsulitis, frozen shoulder, common occurrence, self-limiting patient with usually 40-60 years of age, present with upper arm pain, progress after 4 to 10 weeks before subsiding over a similar time course. Restriction of glenohumeral movement is characteristics. Surrounding muscle show disease atrophy, painless extraction often. Mobilizing strengthening muscle sole treatment for in this painless frozen state. Natural history slow but a complete recovery, sometimes taking up to 2 years. Supination. Supinator biceps brachii supinates the forearm while the elbow is flexed and brachioradialis supinate the pronated forearm to mid-prone position. Pronation. Pronator teres pronator quadratus. Brachioradialis pronates the supinated forearm to mid-prone position. Flexor carpi radialis palmaris longus gravity also helps in pronation. Anterior compartment biceps brachii coracobrachialis brachialis musculocutaneous nerve. Posteriorly হচ্ছে triceps superficial anconeus brachioradialis deep supinator আর হচ্ছে abductor pollicis longus. Triceps হচ্ছে radial nerve. Superficial anconeus brachioradialis extensor carpi radialis longus, extensor carpi radialis brevis, extensor carpi ulnaris, extensor digitorum medialis NDP. अच्छा anterior compartment of arm extension elbow joint আর হচ্ছে posterior compartment of arm flexion করবে. Radial nerve restrop. আচ্ছা anterior compartment median nerve flexor carpi ulnaris and half of FDP flexor digitorum profundus by ulnar nerve. Anterior compartment of আচ্ছা thinner muscle median nerve দিয়ে হয় hypothinner ulnar nerve and abductor adductor pollicis interosseous lumbricals হচ্ছে ulnar nerve দিয়ে হয় আর হচ্ছে lumbricals হচ্ছে median nerve দিয়ে হয়. Lumbricals হচ্ছে medial to bipinnate আর lateral to unipinnate. Hybrid composite muscle trapezius spinal part of accessory nerve motor branch from C3 C4 proprioceptive levator scapulae branch from dorsal scapular nerve C3 C4 proprioceptive flexor digitorum profundus medial half ulnar lateral half median brachialis musculocutaneous motor radial proprioceptive pectoralis major pectoralis minor medial pectoral nerve lateral pectoral nerve subscapularis upper subscapularis nerve lower subscapularis nerve flexor pollicis brevis median nerve deep head may be deep to the ulnar nerve triangular ligament shape of some ligament triangular ligament deltoid ligament ulnar collateral ligament lacunar ligament ligamentum teres femoris iliofemoral ligament y shape radial collateral fan shape. আচ্ছা lumbricals দিয়ে MCP flexion and ICP extension pad plus extension plus flexion dab plus flexion plus extension. Pattern of muscle wasting in the nerve thinner wasting median nerve palsy hypothinner wasting ulnar nerve palsy intrinsic wasting ulnar nerve palsy. আচ্ছা, CH is progression of the segmented innervation dermatom. Various cutaneous areas of the limb. C3, C4 supplies the region at the base of the neck, extending laterally over the shoulder. C5 supplies the arm laterally, superior respect of abducted limb. C6 now supplies the forearm laterally and the thumb. C7 supplies middle and ring finger, middle 3 fingers and the middle of the posterior surface of the limb. C8 supplies the ring finger, medial side of the hand and the forearm, inferior aspect of the abducted limb. Navel T4 segment, tip of the shoulder. C4 lateral side of the arm. C5 lateral side of the forearm. C6 thumb. C6 hand, middle 3 digits. C7 little finger. C8 medial side of the forearm. C8 middle side of the arm. T1 axilla. T2 अच्छा femur angle of inclination at the angle between long axis of neck and shift of the femur. Hence, neck shaft angle, normal neck shaft angle 125, adult 116, children angle of femoral torsion. Femoral torsion angle between long axis of the head neck femur, transverse axis of the femoral condyle measures about 7 degree in male, tolerate in female. Blood supply middle part, middle epiphyseal artery derived from posterior division of obturator artery, ascending branch of medial circumflex femoral artery. Lateral part, lateral epiphyseal artery derived from retinoculum branch of medial circumflex femoral artery. Retinoculum branch হচ্ছে SBA. Following muscles attached to greater trochanter: piriformis, gluteus medius, minimus, obturator, externus, internus, gemellus superior, inferior, attachment to lesser trochanter, psoas major, iliacus. Site of avascular necrosis: femoral head, condyle, head of humerus, capitulum, proximal part of scaphoid, lunar talus. Lunar talus. Importance of adductor tubercle. Epiphyseal line for lower end of femur passes through it. Adductor magnus is attached to it. Femoral artery becomes obturator artery at this level. Shelton line. Extra picture continuous curve formed by the upper border of the obturator foramen and lower border of neck of femur. Middle age of femoral neck, inferior age of severe pubic ramus, loss of control of Shelton line, sign of fractured neck of femurs. Bones used for grafting: iliac crest, fibula, tibia. আচ্ছা, ওয়েট বিয়ারিং হচ্ছে ফালক্রাম পুলি, বিশ্রাম। Femoral triangle boundary superiorly by inguinal ligament, medially medial border of adductor longus, laterally medial border of sartorius floor, content of iliacus, tendon of psoas pectineus, adductor longus, roof formed by superficial fascia, contains superficial inguinal lymph node, great saphenous vein with its tributary deep fascia, fascial lateral which is pierced by the saphenous vein at saphenous or vein content, femoral artery, vein, nerve, femoral sheath includes upper 4 cm of femoral vessel, nerve to pectineus, femoral branch of genitofemoral nerve, lateral cutaneous nerve of thigh, lateral great saphenous vein with its tributary superficial inguinal lymph node, deep inguinal node. Femoral sheath, intercompartment, lateral arterial, femoral artery, femoral branch of genitofemoral nerve, intermediate venous, femoral vein, medial lymphatic, femoral canal. medial femoral canal, boundary of the femoral canal, anteriorly inguinal ligament, medially shaft edge of the pectineal part of the inguinal ligament, round lacunar ligament, Gimbarnett's ligament, laterally femoral vein, posteriorly pectineal ligament of Astley Cooper, which is the thickened periosteum along the pectineal border of the superior pubic ramus, which continues medially with the pectineal part of the inguinal ligament. Canal contain a plug of fat and constant lymph node. The node of the femoral canal incorporates gland of Rosenmuller. Canal has two functions: dead space for extension of the descending femoral vein, second lymphatic pathway from the lower rib to the external iliac node. Adductor canal, hunter canal, lateral canal. Lies in the adductor magnus, situated on middle 1/3 of the thigh. Roof is overlapped with sartorius, contain femoral artery. Boundary: posteriorly adductor longus, magnus, anterior laterally vastus, medially central, medially sartorius, which lies on a fascial sheet forming the roof of the canal. Contain terminal part of femoral artery, terminal part of obturator nerve, medial side of femoral nerve. Femoral vein, saphenous nerve, nerve femoral nerve, nerve to vastus medialis, two division of obturator nerve, subsarterial plexus of nerve, descending genicular artery. Subsarterial plexus medially cutaneous nerve of thigh, saphenous nerve, anterior division of obturator nerve. Muscles, anterior compartmental সব মাসেল নিয়ে এক্সটেন্ড করে এক্সেপ্ট সার্টোরিয়াস। সার্টোরিয়াস হচ্ছে Femoral nerve, abductor, lateral rotator of thigh, talar muscle, flexor of leg at knee joint. These actions are involved in assuming the position in which a talar work or palti posture used during prayer session also. Quadriceps sartorius and then quadriceps femoris. Quadriceps femoris of vastus lateralis, medialis, intermedius and rectus femoris. Femoris হচ্ছে supplied by femoral nerve. This trans also supply hip joint, extensor of knee joint also called kicking muscle, flexor of hip joint, vastus lateralis, femoral nerve. This trans also supply knee joint, extend knee joint helps in standing, walking, running. Vastus medialis same as above. আচ্ছা, extend knee joint prevents lateral displacement of patella. Rotate femur medially during locking stage of extension of knee joint. Action extremely important for stability of patella. Vastus intermedialis, extend knee joint. Articularis genu. Femorula pulls the synovial membrane upward during extension of the knee, thus preventing damage to it. Acha, the fascia lata. The fascia of the thigh, fascia lata inches hold lower limb except over the subcutaneous nerve of the tibia to whose margin it adheres at the saphenous opening. Above it is attached all around to the root of lower limb inguinal ligament, pubius, HTM, sacrotuberous ligament, sacrum, coccyx, iliac crest. Fascia of the thigh particularly dense laterally, iliotibial tract very resistant to fascia lata posteriorly, greater part of gluteus maximus inserted into it. Iliotibial tract when tensed by status muscle basis assist in stabilization of the hip and extended knee on when standing. আচ্ছা, হার্নিয়া অ্যান্ড ডুরাল র্যাপার্সের জন্য এই ফাসালাটা এক্সিলেন্ট মডিফিকেশন ইলিওটিবিয়াল ট্র্যাক ইন্টারমাসকুলার সেপ্টাম সাফিনাস ওপেনিং আচ্ছা অ্যাডাক্টর ম্যাগনাস পাওয়ারফুল অ্যাডাক্টর অফ থাই অ্যাট হিপ জয়েন্ট anterior division of obturator nerve adductor muscle acts posture control adductor brevis anterior or posterior division of obturator nerve action adductor longus adductor brevis helps in abduction or flexion of thigh adductor magnus hybrid muscle. The first adductor longus powerful adductor of thigh at hip joint adductor magnus hybrid muscle double nerve supply adductor part by posterior division of obturator nerve hamstring part by tibial part of sciatic nerve action adductor part causes adduction of thigh hamstring part helps in extension of hip and flexion of knee gracilis nerve anterior division of obturator nerve action flexion medial rotator of thigh it is the weak adductor of thigh it is used for transplantation of any damaged muscle pectineus nerve supply double nerve supply anterior fibers by femoral nerve action flexor of thigh hybrid or composite muscle posterior fibers by anterior division of obturator nerve adductor of thigh pectineus একটা hybrid muscle double nerve supply anterior fiber by femoral nerve posterior fiber by anterior division of obturator nerve আর femoral এর জন্য flexor হয় আর obturator এর জন্য adductor হয় Greater sciatic foramen above piriformis, superior gluteal nerve L4, L5, S1, superior gluteal vessels. Below piriformis, 6 nerve, 2 vessels, sciatic nerve form L4, L5, S1, S2, 3, S3, inferior gluteal nerve L5, S1, S2, and inferior gluteal vessel. Then posterior cutaneous nerve of thigh, sacral plexus, nerve to quadriceps femoris, nerve to obturator internus pudendal nerve, internal pudendal vessels. Acha, structure passing through greater and lesser sciatic foramen. Both foramen দিয়ে যাবে পিন tendon of obturator internus origin up to gemelli nerve of obturator internus pudendal nerve internal pudendal vessels আচ্ছা gluteus maximus upper attachment includes sacrotuberous ligament ilium sacrum coccyx attached to iliotibial tract through which it stabilizes the knee joint produces extension at the joint supplied by the inferior gluteal nerve overlies greater lesser sciatic foramen vessel nerve muscles of this foramen transmit Acha is the main extensor of hip joint. Acha, 10 muscle of the gluteal region form only 3 functional groups. Gluteal maximus is the chief extensor of the thigh at the hip joint. Action is very important in raising from a sitting position, essential for maintaining erect posture. Other actions are lateral rotation of thigh, abduction of the thigh by upper fibers. Along with the tensor fascia lata, the muscle stabilizes the knee through iliotibial tract. Gluteus medius and gluteus minimus, powerful abductor of the thigh. Their anterior fiber also medial rotator. Important action is to maintain the balance of the body when opposite foot is off the ground. As in walking and running, they do this by preventing opposite side of the pelvis from tilting downward under influence of gravity. Piriformis generally superior. So generally inferior obturator internus and obturator externus, and the quadratus femoris all fall into lateral rotators of the thigh. Tensor fascia lata is an abductor, medial rotator of the thigh, extensor of the knee. Clinical correlation: intramuscular injection given in superlateral quadrant of the gluteal region in the gluteus medius minimus. Avoid injury, mean upper lateral. Avoid injury to large vessel nerve which pass through the lower part of this region. When the gluteus maximus paralyzed, as in muscular dystrophy, patient cannot stand from a sitting position without support. Gluteus medius and minimus are paralyzed. Patient cannot walk normally. Slaves or waddles on the paralyzed side to clear the opposite foot from the off the ground, as in lunging gait. When it is bilateral, when it is called waddling gait. Intramuscular injection. Fastest lateral child, gluteus medius adult, to prevent injury to sciatic nerve. Gluteus medius minimus, injury to supragluteal nerve opposite pelvis से झुके जाए. Then Trendelenburg gait, like Bell's palsy. अच्छा, Trendelenburg test, fracture neck of femur, dislocated hip joint, weakness, paralysis of hip joint, say left superior gluteal nerve paralysis, L4, L5, S1, paralysis of left gluteus medius minimus during walking when body supported on left foot, right unsupported side of pelvis drop, inability to walk with right foot, test positive. Popliteal fossa boundary, superlateral biceps femoris, supermedial semitendinosus, semimembranosus, supplemented by gastrus arterius adductor magnus, inferior medial head of gastrocnemius, inferior lateral head of gastrocnemius, supplemented by plantaris. Roof, deep fossa, popliteal fossa, superficial fossa over the roof contains, roof fascia, popliteal fossa, superficial contents over the roof contain short saphenous vein pierces it, 3 cutaneous nerve branches and terminal branch of posterior cutaneous nerve of thigh through thigh, posterior division of medial cutaneous nerve of thigh, perineal or sural communicating nerve, floor above downward, popliteal surface of femur, capsule of knee joint, oblique popliteal ligament, strong popliteal fascia covering popliteus, tibial nerve, popliteal vein, venous, अच्छा. Injury হলে most superficial tibial nerve, deep tibial artery in midline, middle portion, এটা middle portion এর ইয়ে. Content of popliteal fossa. Popliteal fossa and branches, sciatic nerve usually divides into terminal branches in the upper part of the fossa. Tibial nerve branches, common perineal nerve branches, posterior cutaneous nerve of thigh, genicular branch of obturator nerve, popliteal lymph node, and fat popliteal fossa and tibial vessels and tibial nerve cross the fossa vertically and arranged over the arranged one over the other. Tibial nerve most superficial popliteal vein lies deep or interior to tibial nerve. Popliteal artery deepest of all and crossed posteriorly by vein and nerve. Relative position in the following structure: in upper part from medial to lateral side, artery, vein, nerve; middle part from medial to forward, nerve, vein, artery; in lower part from medial to lateral, nerve, vein, artery. Guide ropes: তিনটা muscle major surface of tibia represent one muscle from each of the three compartments of the thigh. Sartorius belong to anterior, supplied by nerve of ilium or femoral nerve. Gracilis middle compartment supplied by pubis or obturator nerve. Semitendinous belongs to posterior, to supplied by nerve of ischium or sciatic. These two muscles anchored below at one point straight out above to span the pelvis like three strings of a tent. From this arrangement, it appears they act as guide rope and will stabilize the bony femur of the femur. Anserin bursa, large complicated bursa with severe diverticula. It separates the tendons, arterials, gracilis, semitendinosus at their insertion from another from the bony surface of tibia and from tibial collateral ligament. Goose foot, muscles of the back of the thigh. Injury হলে biceps femoris দিব। আচ্ছা, origin from ischial tuberosity, insertion into one of the long bones of the leg. Nerve supply from the tibial part of the sciatic nerve. The muscles access flexure of the knee and extensor of the hip. Muscles of back are called hamstring muscles, generous of membranosus, long head of biceps femoris, ischial head of biceps femoris, ischial head of adductor magnus. Hamstring share the following hairs. আচ্ছা, anterior, medial, posterior, femoral, obturator, sciatic nerve, tibial part. আর হচ্ছে gluteal region, lateral compartment of thigh, posterior compartment of leg, anterior compartment of leg, lateral compartment of leg. Okay, let's get into it. At anterior compartment of thighs, arterius, knee flexor, quadriceps femoris, rectus femoris, vastus medialis, intermedialis, lateralis. Our medial compartment, adductor longus, medius, magnus, brevis. Gracilis pectineus. Posterior compartment, semitendinosus, membranosus, biceps femoris, biceps both head, adductor magnus. Gluteal region, lateral compartment of thigh, O2G2B2, gluteus maximus, gluteus medius, minimus, tensorfascial lata, piriformis, obturator internus, externus, superior gemellus, inferior gemellus, quadratus femoris. আচ্ছা, piriformis, nerve to piriformis, obturators, nerve to obturatus internus, quadratus, nerve to quadratus femoris, gluteus maximus, inferior gluteal, gluteus medius, minimus, superior gluteal. Posterior compartment of leg, superficial, gastrocnemius, soleus plantaris, popliteus tibialis posterior, flexure digitorum longus, flexure hallucis longus. এটা হচ্ছে tibial nerve. tibial nerve করবে plantar flexure আর deep peroneal nerve করবে dorsiflexure. deep peroneal nerve and superficial peroneal nerve এসে ফিবুলার নেকে এসে ভাগ হয়। anterior compartment of leg, tibialis anterior, extensor digitorum longus, extensor hallucis longus, extensor hallucis longus supplies into great toe. peroneus tarsus আর lateral compartment of leg এ হচ্ছে peroneus longus brevis. lateral compartment এ peroneus tarsus থাকবে বাট anterior compartment-এ চলে আসবে। সো এটা আমরা anterior compartment-এর অংশ ধরবো আর এটা supplied by superficial peroneal nerve. lateral compartment of leg, superficial peroneal, anterior compartment of leg, deep peroneal. Flat foot, absence or collapse of the arches may congenital acquire effect, loss of stringer in foot, clumsy, shuffling gait, or loss of shock of absorbing function, risk of trauma, osteoarthritis, concavity of the sole, or loss, compression of the communication between lateral medial plantar nerve, compression of nerve and vessels of sole, metatarsalgia, mechanism of arch support, shape of stone. আচ্ছা, causes of pens planus, only cause normal variant normal variant hyperlaxity syndrome, Marfan syndrome, tarsal coalition, rigid and painful flat foot. Pace cavus. Clawfoot tibia condition unis medial longitudinal arch is unduly high. Most cases are caused by muscle imbalance in many instances resulting from poliomyelitis. Tibia most commonly fracture, long bone sustains most compound injury, laceration over the subcutaneous surface of the tibia healed poorly because of lack of vascularity in the subcutaneous tissue. Only is the periosteum supports the skin. Causes of pace cavus, spinal anomaly, spinal bifida, হেরিডিটারি সেন্সরি মোটর নিউরোপ্যাথি যেমন শাকট ম্যারি টুথ ডিজিজ শাকট ফুড নিউরোপ্যাথিক ফুড পোস্ট কম্পার্টমেন্ট সিন্ড্রোম ভক্সমিক ইসকেমিক কন্ট্রাকচার। আচ্ছা, medial longitudinal arch considerably higher, more mobile, resilient than lateral axis shock absorber, constituent end anterior head of first, second, third metatarsal, posterior middle tubercle of calcaneum phalanges do not take part in forming the arches. Summit superior articular surface of the body of talus, pillar anterior pillar talus navicular cuneiform, তিনটা কিউনিফর্ম ফার্স্টে মেটাটার্সাল পোস্টেরিয়র পিলার মিডিয়াল পার্ট অফ ক্যালকানিয়াম মেইন জয়েন্ট ট্যালো ক্যালকানিয়ন navicular joint anterior transverse subrotated by tibialis anterior posterior muscle tying together the posterior bones of the arch. Head of 5 metatarsal, it is complete. Lateral longitudinal low has limited mobility built to transmit weight and thrust to the ground. Constitution end anterior end by head of 4th and 5th metatarsal, posterior end lateral tubercle of calcaneum. Summit lie at the level of articular facet of superior surface of calcaneum at the level of subtalar joint. Pillar anterior pillar cuboid bone and 4th and 5th metatarsal, posterior pillar lateral half of calcaneum main joint calcaneum cuboid joint, posterior transverse supported by peroneus longus tendon. Long plantar ligament passes to the base of the 4th 5th metatarsal bone, supports the lateral longitudinal arch. Greater part of tarsus metatarsus incomplete. Flat foot, absence or collapse of the arches may be congenital acquired effect. Loss of string in the foot, clumsy shuffling gait, loss of shock absorbing function, risk of trauma, osteoarthritis. Flexure retinaculum. Structure passing below reflexor retinaculum, tibialis posterior, flexor digital longus, posterior tibialis artery, posterior tibialis nerve, flexor hallucis longus. আচ্ছা, ইন্টারভার্টিবুলার কোয়াড্রা ইকুইনাস সিন্ড্রোম নিউরোফিজিওতে পড়বো। ফ্যাসিড প্যারালাইসিস, পেইন, নামনেস, উইকনেস এফেক্টিং ওয়ান অর বোথ legs, saddle shape area of anesthesia, analgesia, sphincter disturbance in the form of incontinence of urine, feces, difficulty with micturition. Importance, আচ্ছা, lumbar disc L4, root L4, sensory loss, inner calf, weakness, inversion of foot, reflex, knee, L4 5 L5 outer calf, dorsum of the foot, weakness, dorsiflexion, hallux or toes. আর হচ্ছে L5S1, root S1, sensory loss, sole and lateral foot, আর weakness, plantar flexion and reflex loss, ankle. L4-5 হচ্ছে L5 root আর outer sensory loss, outer calf, dorsum of foot, weakness, dorsiflexion, hallux and toes. Herniated lumbar nucleus prolapsus. L4-5 fifth lumbar nerve root, over sacroiliac joint, পেইন হবে ওভার স্যাক্রোইলিয়াক জয়েন্ট, হিপ, থাই, লেগ, নামনেস হবে ল্যাটারাল লেগ ফার্স্ট তিনটা টো, weakness, dorsiflexion of great toe and foot, difficulty walking on heel, foot drop may occur, atrophy minor, reflexes changes is uncommon in knee and ankle joints, internal but internal hamstring reflex diminished or absent. L5S1 disc আর level of herniation যখন L5S1 ডিস্কে যাবে ওভার, পেইন হবে ওভার স্যাক্রোইলিয়াক জয়েন্ট, হিপ, পোস্টেরিয়র ল্যাটারাল থাই অ্যান্ড লেগ টু হিল, আর নামনেস হবে ব্যাক অফ দ্য কাফ, ল্যাটারাল হিল, ফুট টু টো, আর হচ্ছে weakness হবে plantar flexion of the foot, grade 2 may be affected, difficulty walking on toes, atrophy হবে gastrocnemius and shoulders, reflexes, ankles are diminished or absent. Extensor retinaculum, structure passing through tibialis anterior, আচ্ছা, চারটা টেন্ডন, একটা আর্টারি, একটা নার্ভ, from medial to lateral, tibialis anterior, extensor hallucis longus anterior, tibial artery, depth anterior to peroneal nerve, extensor digitorum longus, peroneus tarsus. Blood supply of the lower limb. Femoral artery, continuation of external iliac artery below the inguinal ligament, passes to the apex of femoral triangle intersadductor canal. Terminus by passing through the hiatus in the adductor magnus to become the popliteal artery. Branches include superficial epigastric artery, superficial circumflex iliac artery, superficial external pudendal artery, deep external pudendal artery, profundifemoris artery, profundifemoris. আচ্ছা, ব্রাঞ্চে, আচ্ছা, দেন হচ্ছে femoral artery আর প্রোফান্ডা ফিমোরিসের ব্রাঞ্চেস হচ্ছে ল্যাটারাল সার্কামফ্লেক্স আর্টারি আর মিডিয়াল সার্কামফ্লেক্স আর্টারি, পারফোরেটিং ব্রাঞ্চ, পপলিটিয়াল আর্টারি. Continuation of femoral artery at hiatus in adductor magnus passes over to lower border to of popliteal spheroid device into anterior posterior tibial arteries. Branches include muscular, several genicular, anterior tibial artery, posterior tibial artery. Acha, anterior tibial artery begins opposite distal border of oblivious terminus in front of the ankle, continuing at dorsalis vagus artery descends. As it descends on the, it lies on the interosseous membrane. Distal part of the tibia in front of the ankle joint passes between the tendon of flexor digitorum flexor hallucis longus distally. Related to deep peroneal nerve lies anterior to the medial third of the vessels and lateral to the lateral to 8 in the lower third. A posterior tibial artery, largest terminal branch of popliteal artery, terminates by dividing into medial and lateral plantar artery, accompanied by two veins throughout its length. Position of the artery corresponds to a line drawn from the lower angle of popliteal fossa at the level of the neck of the fibula to a point midway between the medial malleolus and the most prominent part of the heel. Dorsalis pedis arteries, pulsation felt on navicular cuneiform lateral to extensor hallucis longus. Vessel direct continuation of anterior tibial artery commences on the front of the ankle joint, runs to the proximal end of first metatarsal space, gives off arcuate artery, continue forward as first dorsal metatarsal artery, accompanied by two veins, shows its length, crossed by extensor hallucis tragus. Great or long saphenous vein, perforating vein. External iliac lymph node via femoral canal, deep inguinal lymph node, deep to fascial and medial to femoral vein at the groin. Anterior tibial, posterior tibial, peroneal vessel থেকে popliteal lymph node, then হচ্ছে tissue of the lower limb beneath deep fascia, then হচ্ছে drainage, then deep inguinal limb via femoral canal. Medial group plus lateral group along saphenous vein, superficial thigh region, anterolateral abdominal wall, below umbilicus, gluteal, lower part of vagina, anus, external genitalia except glans. It has a superficial inguinal node, subcutaneously near saphenofemoral junction. External iliac node. Superficial inguinal lymph node, lower vertical group contain about 4 to 5 nodes. Drain the skin and fascia of the lower limb. Great saphenous territory except buttock and short saphenous territory. Upper lateral group contain about 2 or 3 nodes. Skin and fascia of the upper part of the lateral side of the thigh, buttock, flank, back of the umbilical plane. Upper medial group contain 2 or 3 nodes. They drain anterior abdominal wall below the level of umbilicus, perineum including external genitalia except the glands. Anal gland below the pectinate line. Vagina below the hymen. Penile part of the male uterus. Superior lateral angle of the uterus. Sciatic nerve, longest and thicker nerve of the body, largest nerve of sacral plexus, 2 cm thick, root value L45S123. If L45S123 nerves and leaves the plexus to the nerves and leaves the pelvis to the eta foramen made of 2 parts. Tibial part, ventral division of anterior primary rami of L45S123, Roman peroneal nerve, dorsal division of anterior primary rami of L45S1S2. Okay. Paralysis of sciatic nerve results. Sciatic nerve may be wounded in penetrating injuries or in posterior dislocation of the hip associated with fracture of the posterior lip of the occipital to which nerve is closely related. Damage to sciatic nerve is followed by paralysis of hamstring and all the muscles of the leg and foot supplied by distributing muscle. There is loss of ball movement in the lower limb below the knee joint with foot drop deformity. Sensory loss complete below the knee except for an area along the medial side of the leg over the medial malleolus down to hallux, which is innervated by saphenous branch of femoral nerve. Common perineal nerve paralysis causes injuries not uncommon. Foot drop results component of foot drop exclude failure of dorsiflexion due to paralysis of anterior compartment muscle. Deep perineal nerve failure of eversion due to paralysis of lateral compartment muscle. Superficial perineal nerve patient exaggerated flexion of hip and knee when walking to lift foot well clear of ground to prevent scuffing toe of shoe. Sensory innervation lower leg and foot, lateral leg and the dorsum of the foot supplied by fibular nerve with the exception of the first dorsal web space. Sole of the foot supplied by lateral and medial branches of tibial nerve. Sural nerve combination of both perennial tibial branches supplies the posterior leg and lateral side of the foot. Saphenous nerve branch of the femoral nerve supplies the medial leg and medial foot. Deep perineal nerve foot drops high stepping gait. अच्छा femoral nerve sciatic nerve weaken extension of the thigh, loss of flexion of the knee, loss of function of below the knee, sensory loss on posterior thigh, leg except medial side and the foot. Common fibular nerve, neck of fibula produces causes combination of deficit of lesion of the deep and superficial fibular nerve. Deep fibular nerve, weakened inversion, loss of extension of the digit, loss of dorsiflexion, foot drop, sensory loss limited to skin of the first web space between the great and second toes. Okay, deep fibular produces a combination of deflation common fibular nerve, neck of fibula produces a combination of deficit of lesion of the deep and superficial fibular nerve. Deep fibular nerve weakened inversion, loss of extension of the digit, loss of dorsiflexion, foot drop, sensory loss limited to the skin of the first web space between great and second toes. Superficial fibular nerve, loss of inversion of the foot, sensory loss of on anterolateral leg and dorsum of the foot except for the first web space. अच्छा cutaneous nerve supply plus cutaneous nerve supply plus আচ্ছা জয়েন্টস স্টাইলোপ্রুডার জয়েন্টস অফ অ্যাঙ্কেল জয়েন্ট সিম্পল হিঞ্জ আর হচ্ছে হিপ জয়েন্টে কাজ ফ্লেকশন এক্সটেনশন অ্যাবডাকশন অ্যাডাকশন মিডিয়াল ল্যাটারাল রোটেশন সার্কামডাকশন extracapsular ligament iliofemoral ligament inverted y-shape anterior iliac spine to the trochanteric line pubofemoral ligament acetabulum to lesser trochanter ischiofemoral ligament posterior support ischium to greater trochanter Flexion, psoas major and iliacus, chief flexor sartorius, rectus femoris, pectineus. Extension, gluteus flexor, chief extensor, hamstring muscle. Abduction, gluteus medius, minimus, chief abductor, tensor fascia lata, and sartorius. Adduction, adductor longus, adductor brevis, adductor magnus, chief adductor, pectineus, and gracilis. Medial rotation, anterior fibers of gluteus medius and minimus, chief medial rotator, tensor fascia lata, lateral rotation, piriformis obturator, externus obturator, internus associated gemelli, quadratus femoris. This muscle generally termed short rotator. আচ্ছা, dynamic and static stabilizer, ligament, static ligament, iliofemoral, fibrovascular, ischio-femoral, joint capsule, 2 and 3 is acetabulum labrum, fiber cartilaginous triangular structure that surrounds the rim of the acetabulum except at the inferior pole, transverse ligament, dynamic stabilizer, short external rotator, iliopsoas and hip abductors. Common cause of limb length inequality of the hip, causes of limb length inequality, osteoarthritis, hip fracture, hip dislocation, hip dysplasia, avascular necrosis, fixed place deformity. Retina retinacular vessels, nutrient artery, reticular vessel, capsule, reticulum, nutrient artery. Movement, lower limb joint, flexion, psoas major, iliacus, chief flexor, sartorius, rectus femoris, pectineus. Extension, gluteus maximus, chief extensor, hamstring muscle. Abduction, important, gluteus medius, minimus, chief abductors. Then tensor fascia lata, sartorius. Adduction, adductor longus, adductor brevis, adductor magnus, chief adductors, pectineus and gracilis. Medial rotation, anterior fiber, gluteus minimus, medius, chief medial rotator, tensor fascia lata. Then lateral rotation, piriformis obturator, externus obturator, internus associated gemelli, quadratus femoris. This muscle generally termed short rotator. Sural nerve, composite nerve, medial aspect, saphenous nerve, buccata, sciatic nerve. Cutaneous supply of leg. Movement of ankle joint, dorsiflexion, ulnar front muscle, tibialis anterior, extensor hallucis longus, extensor digitorum longus plus peroneus tarsus, ulnar front muscle. এটা হচ্ছে ডিপেরিনাল নার্ভ, প্লান্টার ফ্লেকশন গ্যাস্ট্রোসোলিয়াস দুইটা, অ্যান্ড প্লান্টার ফ্লেকশন ulnar back muscle, দেন হচ্ছে plantaris and tibialis posterior, flexor hallucis longus, flexor digitorum longus. Movement. Inversion, all medial and plantar muscle, plantar flexion and adduction of forefoot, increased in plantar flexion, limited by tension in peroneus muscle. And interosseous sterocalcaneal ligament. अच्छा, किसी भी zone. Eversion, dorsiflexion and abduction of forefoot limited by tension in the deltoid ligament and both tibialis muscles. अच्छा, movement of the eversion joints mainly subtalar talocalcaneal navicular joint, partly transverse tarsal joint, not ankle joint. अच्छा, inversion ক্ষেত্রে ROM 30 degree, tibialis anterior, tibialis posterior আর accessory flexor hallucis longus, flexor digitorum longus. Eversion হচ্ছে peroneus longus brevis আর accessory peroneus tarsus. Joint sticking path subtalar and talocalcaneal navicular joint, main joint, and transverse tarsal or mid tarsal joint, accessory joint. Ankle joint এখানে আসে না. Foot drop হচ্ছে sciatic, peroneal, deperoneal and tibial nerve. Anterior cruciate ligament, Okay, anterior cruciate ligament attached to the anterior intercondylar area of the tibia passes up মানে আবুল আচ্ছা যাক passes upward backward laterally to the attached to the posterior part of the medial surface of lateral femoral condyle. Posterior cruciate ligament, posterior intercondylar area of the tibia passes upward forward medially to the attached to the anterior part of the lateral surface of medial femoral condyle. Prevent ACL, prevent posterior displacement of the femur on the tibia, prevent anterior displacement of the tibia. আচ্ছা, posterior displacement of the femur আর posterior আর anterior displacement of the tibia with no knee joint flex. ACL prevent the tibia from being pulled anteriorly. Tension of the ACL greatest when knee extended, weaker than posterior cruciate ligament. ACL injury, classic twisting injury, interlock rotation, anterior translocation of tibia সাথে. Anterior draw test is the most reliable clinical test of a ACL injury. আচ্ছা, posterior cruciate ligament is attached to the posterior intercondylar area of the tibia, passes upward. আচ্ছা, posterior cruciate ligament with the knee joint flex. PCL prevents the tibia from being pulled posteriorly. PCL prevents the anterior displacement of the femur of the on the tibia, prevent posterior displacement of the tibia. Tension of the PCL is greatest when knee is flexed, and PCL injury is less common and frequently misdiagnosed. Posterior draw test, most reliable clinical test for a PCL injury. আচ্ছা, প্রিবেটালার bursitis due to inflammatory swelling known as housemaid knee. Answer is bursa. Answering bursa, pes answering goose foot. Lies between tibial collateral ligament, tendinous, arterious, gracilis, and semitendinosus. এক্সট্রা ক্যাপসুলার লিগামেন্টের হচ্ছে এই knee joint static stabilizer ligament. Cruciate provides anterior posterior stability. ACL, PCL. Collateral provide valgus varus stability. MCL, LCL. Menisci medial lateral joint capsule. Dynamic stabilizer muscle that cross the joint. Quadriceps rectus femoris, vastus lateralis, vastus medialis, vastus intermedius, hamstrings, semitendinosus, membranosus, biceps femoris, sartorius. As locking, unlocking. Locking always allows the knee to remain in position in full extension produced by continued action of extensor muscle. Quadratus femoris, especially vastus medialis. Locking occurs as medial rotator of femur. Muscular effort is less needed. Secure the joint fast থেকে 10 degree hyperextension. Locking occurs during full stage of extension, aided by oblique puller ligament, cruciate ligament, tibial collateral ligament, fibular collateral ligament, oblique popliteal ligament. All joints and ligament become taut except PCL. Unlocking হচ্ছে reverse locking of mechanism produced by continued action of popliteus. Rotates laterally. Unlocking occurs as a lateral rotation of femur. More muscular effort is needed. Unlocking occurs during flexion. All joint and ligament become flexed except PCL. Unheavy triad, common in footballer player triad, consists of rupture of tibial collateral ligament, tearing of anterior cruciate ligament, injury to medial meniscus. Baker's popliteal cyst. Swelling behind the knee caused by escape of synovial fluid posteriorly through joint capsule. Impairs flexion and extension of knee joint. Dermatome. L1-3 supply anterior aspect of the thigh from above down. L4 supply frontomedial aspect of the leg. L5 supply the fronto-lateral aspect of the left, but also extend to the medial side of the foot. Supply S1 supply the lateral side of the foot and the sole. S2 supply the posterior surface of the leg and the thigh. ST4 supply the buttock perineal region. 5 supplies the first toe and 1 supply the fifth. Oh. Although S3 supplies the posterior part of the scrotum or vulva, L1 supply anterior part of the structure via ilioinguinal nerve. Sensory part all by sciatic nerve except middle part supplied by saphenous nerve for femoral nerve. First dorsal web space, deep perineal nerve, sural nerve. Sural nerve দিয়ে কোনটা হয়? Walk means ischemic contracture, fracture, deformity of the wrist and finger, ischemic contracture of extrinsic intrinsic muscle of forearm. Earliest changes usually involve fracture, digitorum profundus.